się nie... Szanowni Państwo, prosimy już o zajęcie miejsc. Jesteśmy na uczelni wyższej, kwadrans akademicki za nami. Więc będziemy powoli zaczynać. Witamy serdecznie na konferencji Zdrowie i bezpieczeństwo dla przyszłości, podsumowującej cykl Droga do prezydencji.
W tytule dzisiejszego spotkania jest również mowa o Białej Księdze i to ona, oprócz naszych ekspertek i ekspertów, będzie jednym z głównych bohaterów dzisiejszego spotkania.
Instytut Rozwoju Spraw Społecznych, który mamy przyjemność reprezentować, zorganizował jak dotąd 6 konferencji poświęconych przygotowaniom do prezydencji, a tuż przed jej rozpoczęciem jej poszczególnym priorytetom właśnie w zakresie zdrowia, bo w tej sprawie się dzisiaj spotykamy. To spotkanie zamyka nasz cykl. Mamy nadzieję przyjrzeć się na nim wyzwaniom, jakie w trwającym półroczu czekają Polskę i Unię Europejską i omówić rozwiązania najpilniejszych problemów w obszarze zdrowia, opieki zdrowotnej i polityki lekowej.
Of the health policy and health, we are happy to inform you that this meeting is under the patronage of Polish Presidency, European Social Economic Committee, Institute of Lech Wałęsa, Committee for Clinical Science of Polish Academy of Science, Think Tank Academy and Teraz Polska Organization.
Teraz zaprosimy Państwa na obejrzenie krótkiego filmu, który podsumowuje wszystkie dotychczasowe wydarzenia, inicjatywy w ramach Instytutu Rozwoju Spraw Społecznych, które były poświęcone priorytetom zdrowotnym polskiej prezydencji w Radzie Unii Europejskiej. Serdecznie zapraszamy na film.
In the framework of Polish presidency.
Witamy Państwa na konferencji Zdrowie i bezpieczeństwo dla przyszłości, zamykającej cykl Droga do prezydencji. W ramach inicjatywy Instytutu Rozwoju Spraw Społecznych przez ostatnie 2 lata zorganizowaliśmy 6 debat poświęconych priorytetom zdrowotnym polskiej prezydencji w Radzie Unii Europejskiej. 30 października 2024 roku gościliśmy wybitnych ekspertów w zakresie psychiatrii dzieci i młodzieży. W listopadzie zaproszeni przez nas specjaliści dyskutowali o cyfrowej transformacji w medycynie i ochronie zdrowia. A w grudniu odbyła się konferencja o profilaktyce i zdrowiu publicznym. Przygotowaliśmy serię 46 wywiadów Rozmowy o prezydencji, w której o wyzwaniach zdrowotnych rozmawialiśmy z ekspertami medycznymi i systemowymi oraz ponad 90 publikacji z naszych konferencji. Dzisiaj spotykamy się na Warszawskim Uniwersytecie Medycznym, aby zaprezentować wyjątkową publikację podsumowującą nasze działania. Zebraliśmy wypowiedzi, analizy i rekomendacje ponad 140 ekspertów w zakresie opieki zdrowotnej i decydentów. Tak powstała w 2025 roku Biała Księga, rekomendacje ekspertów w obszarze ochrony zdrowia, którą dziś oddajemy w Państwa ręce. Otworzy prezes Instytutu Rozwoju
The
Spraw
President of the Institute for Development of Social Affairs, Małgorzata Bogusz, will open the conference. Welcome.
Szanowni Państwo, przede
Ladies and
wszystkim
gentlemen, first of all, this is the White Book, this is our work, this is our achievement, this is the summary of almost 2 years of very intensive work, many debates, meetings, discussions, executed also here at the Warsaw Medical University. Dear Minister, dear Rector, dear guests, ladies and gentlemen, we are very proud to present our White Book. At the same time, we want to thank all the authors, all the people that contributed to this book, all the people who during almost 2 years have accepted invitations to our debates, who shared their knowledge, expertise, experience, and discussed how the priorities of healthcare should look like in the domestic and European perspective. I would like to thank the Warsaw Medical University and rector, Rafał Kranke, to be able to organize this meeting here. I would like to thank Professor Bolesław Samoliński that he was open enough to get convinced to this initiative, and he got involved because this is our second white book with Professor Samoliński, because the first one concerning challenges of senior policy, titled Health Aging, was created in 2013. It had 200 pages and over 100 authors contributed to it. The one that we provide to you today has almost 300 pages and even more authors. This is not over, and I'm already curious what we're going to create the third one about. And now seriously, as a community, as a union, we are at the crossroads. People say that the European Union must adjust its modus operandi, needs to face the current challenges, both local as well as global. It was mentioned in a very important report, the ex-Prime Minister of Italy, Mario Draghi, in the report dedicated to competitiveness. He said that without decisive actions, the European Union will go through slow agony. In order to prevent it, Europe needs to increase investment and have more coordinated industrial policy if they want to keep up with US and China. On the other hand, we live in the atmosphere of war and growing geopolitical tensions. And although we don't have missiles over our heads, we live with less and less sensation of security. The ex-president of Finland, Sauli Niinistö, in the famous report Safer Together, prepared for European Commission, underlined the necessity of holistic approach to security and safety, covering both civilian and military dimension. And in this spirit, we present the program of Polish presidency that is based on 7 pillars of safety, and one of these pillars is health security. Isn't it a case that if we meet with each other, when we see each other, the most frequent wish that we articulate to our friends is in daily relations is wishing someone to be healthy, to stay healthy, because health is the most important thing, because health is for us the most desired thing. Poland, the Polish presidency in the Council of the European Union, is the key moment for the future, especially in the context of health security. Our role as a country, as a member state, is based on strengthening the position of the health protection in the EU and improvement of the quality of health. I wish it to everyone. I wish you fruitful debate, and I know that today we'll be discussing what is the most important in the framework of healthcare. We will discuss different dimensions of EU legislation. Also addressed in Brussels, we will talk about European Health Data Space, Medical Medicines Alliance and Act, the initiatives that we as Institute for Social Development, we are part of and we support. We will discuss huge change, which is the change and revision of the Pharmaceutical Act, the first revision for the last 20 years. In the panel that we'll have at the end of the day, we will also think if the initiative that is so much discussed, the only effective one, huge and revolutionary approach to treating or taking care of oncology patients, so European cancer beating plan can be used and can inspire creating similar plans in other areas. This is something we're going to address today. Thank you so much. I'm honored to host you here. I'm so happy that you are with us, and I invite you to read and review the White Book. It's available under the QR codes that you can find in your materials. Those QR codes in Polish and English version are available everywhere, and they will be communicated by us. Thank you. Thank you so much, and now we proceed to honorary speeches. We invite Professor Rafał Krękę, rector of the Warsaw Medical University. Good morning, everyone, ladies and gentlemen, participants, and dear guests of this conference. I'm very pleased to welcome all of you in the main campus of our university, in the main hall of Medical University. The possibility of organizing this conference, as underlined by the president of the institute, constitutes the summary of the group of conferences named PATH to Presidency. We have representatives of NGOs, politics, medicine, healthcare, and we are honored to host you here. Warsaw Medical University is one of the biggest universities in Poland that offers medicine and is also the oldest university of our capital city. So it's not that often that we refer to our history, which is over 200 years, and this conference is dedicated to the future. I would like to thank the organizers, Małgorzata Bogusz, member of the European Social Economic Committee, and also the president of the Institute for Development of Social Affairs, and Professor Samoliński, the director of the Public Health Policy at our university. Thank you so much both for your efforts of organizing this cycle of conferences.
Pani prezes wspominała o poprzedniej prezydencji i zaangażowaniu
państwa. Bogusz mentioned your involvement during the previous presidency. Then Professor Samoliński was the head of the priorities of Polish presidency. And one of those priorities, when it comes to respiratory illnesses in children, was included in EU priorities and conclusions of the European Council. So I deeply believe that this contribution will be also so significant. EU presidency is a privilege and also a great responsibility that we assume every 14 years. However, this responsibility is with us on a daily basis, also in our daily work as doctors, teachers, politicians, scientists, entrepreneurs, and activists. The motto of our presidency in 2025 is Safety of Europe. President also mentioned that when we divide the notion of safety into different layers, we come to a conclusion that health security is one of the most important issues. We will discuss key aspects related with health security for the Poles. It's also important. I'm thinking about medical education. It's an important topic. However, unfortunately, discussed from the political perspective, prophylaxis that we've been mentioning for years. However, tangible action oriented towards prophylaxis has been undertaken only recently. We can say also that we allow some actions or forms of using tobacco products that until recently have not been regulated. We talk about health safety, health security, and many other topics. I believe that this conference, for us, the members of our academic community and experts, a possibility to have an inspiring discussion. So let's discuss it, let's debate, let's recommend solutions for the decision makers. Let's pass on the knowledge and experience to next generations. And we also need to say that in this situation that we cannot forget about the threats that are ahead of the European Union and challenges that threat the unity and stability. Despite all those difficulties and challenges, European Union still remains the symbol of cooperation, solidarity, and work for peace and stability. Let's work for those values, and I wish you all the best. I would like to wish all of us fruitful discussion.
Dziękujemy bardzo.
Thank you very
mamy
much.
zaszczyt
And now we have the
zaprosić
honor of
panią
inviting Magdalenę Sokowiak-Czarnecką, Undersecretary of State at the Chancellery of the Prime Minister. She is responsible for European Union affairs.
Bardzo dziękuję.
Thank you very much.
Po pierwsze, dlatego, że lubię konkrety.
Well, first of all, I like moving on to the point always. And I would like to, that's why I would like to thank the Madam President. Wow, the White Book is in place, it's been delivered, and it's very to the point. And this is, I think, the way cooperation should look like between the government, NGOs, patient organizations. It's important to exchange views. And over the past few months, we worked with Madam President in the Committee for Polish Presidency, and we were preparing for that. And I wanted to make sure that we are preparing with the policy of an open door, making sure that we talk to people who are involved in the topic. So that's why we had this committee and a council for presidency. So thank you very much for your engagement. So when we decided that the main message of the Polish presidency would be security in Europe, when we were developing the 7 pillars, it was obvious to us that even though health is not the main competence of the European Union, health security will be one of our priorities. You just mentioned about presidency in 2011. I think the difference between now and then is that meanwhile we've had COVID-19, and that moment showed us in the EU that we cannot leave health on the margin. Even though we decided in the treaties that health would not be our main domain, we have to work here and now. There is this idea of joint procurement of vaccinations, and there's something to it. In a crisis, the EU works very efficiently and very quickly, and the topic of health became part of the agenda. We have a president of the Health Committee, MEP, Mr. Jakubiak, who is a living example of how the approach to health has changed. For example, he's on the Health Committee, and the European plan for fighting cancer. And again, I have to mention Mr. Jarubas, because in 2019, in his campaign, he talked about the necessity of the program, and the program has been delivered because it's already entering the decisive phase. So we're focusing very much on health security during the presidency, but we also wanted to show our vision as Poland for the years to come in the European Union. That is why one of the priorities involves mental health of children and youth. And I'd like to thank Madam Kacperczyk for going in this direction. And Madam Minister took some very courageous steps, because soon we will have a conference in Krakow and a report on mental health of children and teenagers. teenagers. And I think it's an important topic because it's related to disinformation. We live in turbulent times, which are geopolitically difficult. One of the tools of hybrid war is disinformation, and it's easiest to spread disinformation through social media. So the fact that we are taking on this topic, we are showing the report about the impact of social media on mental health of kids and youth. And today, it's no secret that this is a huge challenge, namely mental health of children and youth. I'm looking at the former spokesperson of children's rights who was dealing with this topic. So this is our responsibility as Europeans. We need to make sure that Europe is a safe space for our children and that our children can develop in peaceful countries and in health. I need to mention prevention and women's organizations as well. I know that today's partner is Association Women's Center, and I am involved in its work. And again, it's all about engagement of NGOs, engagement in the work that should be our joint work in Poland. Women from the association Women in the Center organize preventive measures across Poland, mainly with regard to breast cancer. I think the time when you spend, this moment when you spend your free time helping others is the most precious thing you can do. So I was touched when I saw the White Book, because we've been talking about it for so long. And when I took my role at the beginning of January last year, well, everybody says that they were preparing each presidency for 4 years, but we did it in 11 months. But what was put on the table very quickly were priorities in health, and Madam Minister was leading these discussions. And we came up with concrete indications, concrete pillars. So thank you for that. How we implement that? Well, that will be done by Madam Minister. It's her area, and I don't want to encroach on it. But as a person responsible in the Polish government for the Polish presidency, I promise you that we will be focusing on that. When you see the agenda of the Polish presidency, you will see that a lot of things related to health that we talked about during different councils, and a lot of them are included in the program of the presidency. So, for example, digital data flow, critical medicine act, and mental health of children and youth. So, ladies and gentlemen, I wish you fruitful deliberations. I'm looking forward to see the outcomes, and thank you for your time and your engagement, because we want to create healthy, safe and resilient Europe together. Thank you. Thank you very much. We also have Katarzyna Kacperczyk with us, Undersecretary of State at the Ministry of Health. Madam, over to you. Well, thank you very much. I too came with the White Book. Congratulations. Well, from my personal experience, I can say that my past week has been very intensive. I've been dealing with the presidency. There were events in Poland, in Brussels, and yesterday on the plane, I was thinking, I'm glad weekend is coming. Maybe I can have some rest. I can lie down with a book. And thank you very much for this book. I already have a book to read over the weekend. And thank you for this huge work. Thank you to the rector for having hosted all of the debates and discussions concerning priorities of the presidency in the area of health. I also had the pleasure of participating in some of them. Very to the point, very interesting discussions. So Madam President, thank you very much for your work, for the work of your team. We were in touch, and I know how much technical work it involved. So thank you very much to you and to your whole team. And Madam Minister, thank you. I remember the presidency from 2011. Back then, I was working at the Ministry of Foreign Affairs, and I had the pleasure of coordinating the organization of the presidency, and I was on that team, and I always keep repeating that health has always been the topic of the presidency, but it wasn't really a priority. But now we found partners and kind souls, such as Madam Minister Magdalena Czarnecka-Sobkowiak, who has been supporting the development of this agenda. It was included in a broader topic of state security, European security, and it was much easier for us with the expert support, the support of our Minister, and support of all of you. Like the Minister said, priorities were not developed behind closed doors of offices. I had meetings at the Chancellery of the Prime Minister with representatives of the Council or NGOs, Council of NGOs, and also back at the Ministry. I had a lot of meetings with NGOs, with representatives of the industry, the Polish industry and pharmaceutical industry. So I understand we are going to talk about this important topic today. So thank you very much for all your recommendations and suggestions. As you can see, they have been reflected in our priorities and the events that we planned during our presidency. In fact, I was very pleasantly surprised and touched by how active you were. The amount of proposals you were submitting to organize satellite events during the presidency, well, there were really a lot of them, and it's really important. And I keep repeating that this presidency is not the presidency of the Prime Minister or the Ministry of Health. It's not the presidency of the government, but it's the presidency of Poland, of us all. So I think this is a perfect opportunity to promote our interests and priorities in the area of health, but also to share with partners in the EU, to share what we have best in Poland. Because we often complain about the healthcare system, about long queues, and about certain imperfections. It doesn't only apply to Poland. Other countries have such problems as well, but we have a lot of things we can be proud of. We have fantastic doctors, fantastic nurses, and fantastic medical centers, hospitals, and also primary healthcare clinics. We've accomplished a lot over the past years, and yes, there's still a lot of us. We have a lot of room for improvement, but also we have a huge potential we can be proud of. So it's a perfect opportunity to show what we have best in Poland. And based on my personal contacts with member states, I can tell you that there are a lot of such areas where member states are really interested in learning from us, from our solutions in Poland, and for example, digitalization, but also our reforms in mental health. So I guess these are the things that are going to strengthen Polish position, not only during the presidency, but also after it's been completed. That's the goal. Presidency will take only 6 months, but I always keep saying that we started the presidency earlier. I was developing the agenda in the area of health from January 2024. sector. A lot of priorities that are our national priorities we managed to include permanently in the agenda of the European Commission, for example, mental health of children and youth in the context of new digital challenges. So this is a new topic on the EU agenda, so it's now a priority of both the European Commission, Ursula von der Leyen, its president. So even if the Polish presidency is over, this topic will stay with us in the form of prevention. I hope we will close those difficult things that are on the agenda, so legislative aspects related to medication security, drug security. So soon we will have a draft Critical Drugs Act, and this is critical work for the Polish Ministry and Polish MEPs. So I'm glad that this topic is discussed in a broader context, not only in the context of competitiveness and supporting the industry and companies, but also a dimension that concerns patient security, availability of medications, and also economical aspects. And on a final note, I didn't say it at first, but when I was talking about cooperation, I wanted to thank Madam Senator for promoting the health agenda in the Polish Senate. As you know, the Polish Senate announced that 2025 would be a year of prevention. So we are planning a lot of events in the Senate and in the Sejm. And I talked to my colleagues in the EU because it's worth talking about it. It's an exceptional situation. It's not just about NGOs. It's not just about universities and NGOs getting involved, but it's an unprecedented way in which the Polish Parliament is involved. It's exceptional, it's rare in the EU, and we want to talk about it and brag. So I'll stay with you for a little while. I hope we will be able to talk about the priorities. And one more time, thank you for the white paper. This is my book for the weekend, and yes, we are hoping for more. The presidency is still ongoing, so thank you for the support so far, and I'm looking forward to some more. Ladies and gentlemen, we also have guests who, due to their duties, could not arrive here personally, but especially for this occasion, they prepared their video presentations. Sandra Galina, Director General for Health and Food Safety Center of the European Commission.
Ladies and gentlemen,
Szanowni panowie,
z całego
serca dziękuję Instytutowi Rozwoju Spraw Społecznych za zorganizowanie tej konferencji i opracowanie Białej Księgi. Naprawdę dziękuję. Polska prezydencja odbywa się w bardzo złożonym, ale i ważnym czasie dla Unii Europejskiej. Na przykład Komisja Europejska właśnie rozpoczęła nową 5-letnią kadencję. To czas na nowe pomysły, to czas na nowe działania dla Unii Europejskiej. Państwa wkład jest bardzo, bardzo ważny, nie tylko dla polskiej prezydencji, ale przede wszystkim dla szerszego kontekstu europejskiego. Chciałabym dodać, że polska prezydencja koncentruje się na wzmocnieniu bezpieczeństwa europejskiego we wszystkich jego wymiarach, w tym bezpieczeństwa zdrowotnego. Jeśli chodzi o opiekę zdrowotną, powiedziałabym, że priorytety prezydencji są bardzo jasne. Są to cyfrowa transformacja opieki zdrowotnej, promocja zdrowia i zapobieganie chorobom, a wreszcie zdrowie psychiczne dzieci i młodzieży. Priorytety te są w pełni zgodne z mandatem, jaki przewodnicząca Ursula von der Leyen udzieliła komisarzowi Varhelyiemu na tę nową kadencję. Powiedziałabym, że działania UE w zakresie bezpieczeństwa zdrowotnego zostały wzmocnione od czasu pandemii COVID-19. Wielu z Państwa o tym wie. Powinniśmy być teraz lepiej przygotowani na przyszłe kryzysy. Przełączam się na kanał polski.
Help the EU to anticipate, to respond to cross-border health threats in a much more coordinated way. The implementation of the regulation is now in full swing, and we are trying to help all the member states to create a preparedness that is for all Europe. Another important element of health security is secure supply of medicines. This is a pressing concern for many member states. We have also seen there are many vulnerabilities during the crisis, but also during normal times. Pharmaceutical supply chains are really very fragile in some respects, especially in crisis. The Commission has proposed reforms of the EU pharmaceutical law, and also for the obligations of pharmaceutical companies to put, I would say, at the disposal of member states products during the shortages and to monitor the shortages much better. Now, the reform is on the table of the European Parliament and of the Council, and I welcome very much that the Polish presidency has prioritized this file. It is very, very important. We also need to do more in reducing dependencies of supply chains for critical medicines, and this is why the Commission is working hard on a Critical Medicines Act. I hope that the discussions among EU member states on this act, which we have been working on here in DG Sante, will start during the Polish presidency. The digital technologies are simply transforming healthcare too. With the European Health Data Space, a big achievement, just last week it was approved in the European Parliament, a secure and interoperable environment is there to exchange data, or will be there. The patients and the researchers and the innovators will all benefit from this. This is very important. Public health institutions and EU agencies will gain better and faster access to health data wherever they are. This could help them, for instance, to protect people from cross-border health threats much more, I would say, efficiently and effectively, or to detect and monitor issues that concern, I would say, drug safety. The digital transformation, in my view, is something which requires a lot of trust. That is also why the Commission presented an action plan on cybersecurity of hospitals and healthcare providers in January. This will help protect health data, which are very sensitive, and also have a level of protection for health systems. Now, I go to prevention. Prevention is extremely important for resilient health systems. Investing in prevention is not a cost, but it reduces the burden of non-communicable diseases, and it helps to relieve the pressure from our systems. So also economically it makes a lot of sense. The Commission intends to step up the work on prevention during this mandate. We will follow on the steps of the European Beating Cancer Plan that has shown how effective European action on non-communicable diseases can be. We will be building on that success, we will be continuing the cancer plan, but we would like to develop a comprehensive approach to health promotion and disease prevention. This is really very much needed with the demographics that Europe has. We also like to continue our work on mental health, looking at the impact of social media and screen time on the well-being, especially of children and young people. So let me say this is a very focused action. I would say that in closing, the Polish presidency has an opportunity to set a successful path, to set an agenda for the coming years. This is a vital moment, as I said, in healthcare security, in all the facets of health for the years ahead. This is an important presidency. We need to remain alert to threats. We need to secure our supply of medicines. We need to ensure a secure digital transformation of healthcare, and we need to support prevention to try to have more resilient health systems. So my motto is that together we can build a stronger, healthier and more secure European Union. And I thank you for listening to me and my best wishes for your event. Thank you.
Serdecznie dziękujemy.
Thank
Przewodniczący
you so
Europejskiego
much.
Komitetu
The head of the
Ekonomiczno-Społecznego,
Social Economic Committee,
również
Olivier
nie
Robke,
mógł do nas
couldn't
dołączyć.
join us as
Zapraszamy
well,
Państwa do
so we invite you
krótkiego
to
nagrania.
listen his recording as well. Szanowny Panie Ministrze, Szanowna Pani Poseł, Posłowie, Szanowni Goście, drodzy uczestnicy, dziękuję za możliwość zabrania głosu podczas tego bardzo ważnego i aktualnego wydarzenia. Jesteśmy
and it's now the time to set new objectives, as well as a strategy to reach them. This is why I am very thankful to the Polish presidency for launching many important initiatives, including in the area of health. At the EESC, as representatives of organized civil society, we have carried out extensive work in the area of health in the last few years. I would like to share with you our vision for the future of health in the European Union. First of all, we believe that health is a fundamental right. Therefore, we call for the establishment of a European health guarantee, which would ensure that everybody enjoys equal access to healthcare. These days, we hear a lot about competitiveness and security. These aspects are truly important, especially in the current geopolitical context. However, this should not make us forget the importance of equality and solidarity. We believe that we should step up resources for social and health investments. We would like to see an integrated scoreboard of socio-economic, health and environmental reforms, with a view to a strategy that goes beyond growth. Shortages in the health workforce are very worrying, especially in the context of the aging population and increased demand for healthcare in the years to come. We believe it is necessary to adapt measures to improve working conditions of the health workforce to make the profession more attractive. We need targeted investment plans to strengthen capacity and promote and support healthcare staff. On the demand side, pressure on the healthcare systems can be diminished by ensuring that people benefit of better health. For this, we believe it's crucial to step up prevention efforts, including promotion of healthy lifestyle and early detection via screening and testing. This is especially relevant in the field of cardiovascular diseases and cancer, which are the leading causes of death in the European Union. We are looking forward to the adoption of the new EU cardiovascular health plan announced by the European Commission. Digitalization and artificial intelligence offer us many opportunities to modernize health systems, alleviate pressure on health professionals, and offer benefit to patients. The recent adoption of the European Health Data Space represents a success, as it will enable individuals to have faster and easier access to their electronic health data and support research by providing researchers with access to anonymized, secure and interoperable health data. However, it is crucial that guidelines on cybersecurity and inclusivity are adopted by improving digital literacy among health professionals and the general public. We welcome the recent publication of the European Action Plan on the cybersecurity of hospitals and healthcare providers, which represents a considerable step forward in this direction. Mental health issues affect a big proportion of the population in the EU, with up to 46% of Europeans having experienced an emotional or psychosocial problem. Young people are among the more affected. We believe the EU needs to do more. The EU plan for mental health needs to be accompanied by a time frame, sufficient funding, defined responsibilities and indicators to monitor progress across the EU and member states, including in the framework of the European semester process. We recommend reforming health systems across the EU to provide integrated and planned long-term interventions and care. including to prevent mental health problems and to integrate mental health literacy in the school curriculums. Up to 36 million EU citizens are affected by a rare disease. At the EESC, we have built over the years a community of representatives of patients' organizations, policymakers, and health professionals. We are asking for a comprehensive European approach to rare diseases, which would guarantee early screening and diagnosis and close the gaps in patient care pathways, addressing inequalities across the EU. To conclude, I would like to confirm our commitment to equal access to quality healthcare for everybody in the EU. We look forward to continuing our cooperation with the European institutions and civil society to make the right to health a reality. Thank you very much.
Dziękujemy. Teraz moment,
Thank you
który
so
zapowiedział
much.
wcześniej
And now the
Robert.
moment
Szanowni
announced by
państwo,
Robert
przedstawiliście
before.
mój współprowadzący
We haven't
Robert Socha.
presented also. Robert Socha. This is my co-host.
Karolina Wasilewska.
Karolina Wasilewska.
A ze mną Łukasz Przybysz,
And
jedna z
Łukasz
osób
Przybysz,
odpowiedzialnych
one
za
of the
redakcję
persons
naukową
responsible
Białej
for
Księgi.
preparation
Jesteśmy
of the
bardzo
White
dumni,
Book.
że
We are so
współtworzyliśmy
proud
tę
that we have
publikację, bo jest to
co-created this
unikatowy zbiór
publication.
komentarzy,
It's
opinii,
unique
rekomendacji dla
collection
Polski i
of
Unii Europejskiej na
recommendations,
czas
comments for
naszej
Poland and
prezydencji
the
i po
EU
niej.
during our presidency and later on.
Drodzy Państwo,
Ladies and gentlemen, list of authors
tej księgi,
of this
którą
book
trzymam tutaj
that I
w
hold
ręku,
in my
jest
hand
naprawdę
is
imponująca.
extremely long.
Długa.
It's a
Praca też
very
była
long list.
Ale szybka
Work
też.
was very demanding.
Rąbka tajemnicy. Co
Let
tutaj mamy?
me
Państwo
reveal some
mają w
secrets.
rękach tę
In
księgę,
your,
mogą
you have
pobrać
your
ją
book
pod
in your
QR-kodami, do
hands.
czego
You can
zachęcamy
download
w
it
języku
from the
polskim i
QR code
angielskim.
in English
Ale
and in
rąbka
Polish.
tajemnicy tego,
But
co
let
tutaj
me
mamy
tell
w
you what's
środku,
inside.
uchyli profesor Bolesław
And
Soboliński.
Professor Bolesław Soboliński will tell you what's inside. He's the chair of the subcommittee on priorities in the healthcare area for the Polish presidency of the Council of 2011, head of the Department of Public and Environmental Health at the Medical Warsaw University, where we are today, and co-author and one of the persons responsible for scientific edition of this white book. Professor, the floor is yours.
Bardzo dziękuję, proszę Państwa.
Thank you so much, ladies and gentlemen. My surname was mentioned several times today. I feel a bit confused because I don't have such a huge contribution into the health policy, although it's close to my heart. And I always tell my students that without what we teach them, without what they will do in the future, and we teach a lot of students. It was mentioned by Rector, but we have more than a dozen of types of studies in our department. It's not only public health, but there's also such studies as physiotherapy, emergency services, nursing, and so on and so forth. So this is why this book was created also. People knowing the health policy will be very much interested in this book, but it's an educational document. It's with great content. I want to talk briefly about this white paper. You could have downloaded from the QR code, and I have some reflections that should be added about this paper. At the beginning of this presentation, Polish presidency of the EU Council recommendation of experts in the area of health. And it's a very tricky title because these are experts in the area of healthcare, but you will find also many valuable opinions of people that shape the healthcare policy, which is critical. and fantastic patronage that we have, that you can read on the first pages. List of authors, right? You can look through it. Let me show you some pages. These are only the authors. So 141 authors. So we are talking about the fact that the paper has 300 pages, 400 pages A4 in A4 format, and there are statements of 141 people. It's a great success. And ladies and gentlemen, this is not my success, it's a success of Małgorzata Bogusz and her team, who made a great effort in order to collect those statements during all those meetings in the framework of PATH to Presidency, and then to put it on paper. You know that it's easily said, but it's more difficult to write, because the writing, the paper makes it more accountable, because it stays in everyone's memory and stays forever. When the Egyptians were writing on the wall, and now we are writing on the paper, and what they have written on the walls, it stays forever. Paper is not as permanent as the Egyptian walls, but we also hope that when someone reads it once or twice, then you'll be able to remember. What else should we add? You can't read it like a novel. You need to study this paper. It requires reflection. Please remember, when you go through different chapters, that you'll find some individual perspective. This is critical, that in one page, in this white paper, as the only document created this way, that you have vision, opinions, and suggestions of different stakeholders of the healthcare area. We have experts that are great clinicians. In this white paper, we have NGOs here, and also politicians presenting their opinions. This is something unique, a unique clash of perspectives. In the White Book, we also have the first title dedicated, and then the presidency without secrets, the context of Polish presidency in the EU, expert debate on the priorities of health of Polish presidency, and the fourth chapter, recommendations of associations and different stakeholders and experts. One cannot discuss it briefly in several minutes that I have at my disposal, and I wouldn't even try. I wouldn't like to take away the possibility of reading the documents. However, I have allowed myself to select several chapters or areas to reveal how interesting that is. Let me start with our colleague that we cooperated with for years, because he started in European Commission over 15 years ago, Andrzej Ryś, who comes from the Jagiellonian University, and he was a significant person in the health policy of EU Commission. A great interview made by Karolina, who is hosting the meeting today, where he presents many years of action of EU in the area of health, and focuses on what was mentioned before, namely the experience of pandemic that opened our eyes in the EU to the fact that health is a common value and it cannot be delegated to national policies only. And also very significant issues like common purchase of vaccination and COVID certificate. This is something that showed that the EU can act together. And let me also provide a citation that he also used, these words of Winston Churchill: we should not waste any crises. I think it's a very important message that I think is very visible in this white paper. I should also mention the chapter of the MP, Mr. Jarubas. He's very competent, and he heads the Commission of Public Health in the European Parliament. He mentions very clear suggestions about directions for this policy. For example, pharmaceutical independence and autonomy of Europe in those challenges ahead of us. Act on critical medicines, very important area of health policy, common fund supporting towards unification of the market and professions, and diverse access to medicines indicated by the MP, because there are disequalities in health in the EU. When we talk about public health, we talk about leveraging and leveling, getting equal chances when it comes to access to healthcare. It's a very critical chapter provided by Minister Kacperczyk. The minister starts with security of Europe. This is so important. We've talked about it before. We have different areas of security and safety. I encourage you to read the last chapter as well. This is my chapter, I'm the author, when I indicate that there is no safety and security without health. Whatever happens, when we are ill, we suffer all the consequences. So security of Europe needs to start with health security. We will not do anything without health. And presentation of the EU priorities. And what is also significant, that it's a presentation on the background of EU policy. Chapter of Ms. Minister Czarnecka, placing Polish presidency in the current environment, common action for strengthening the system of healthcare in Europe, improvement of mental health, health crisis management should become a permanent heritage of Polish presidency. It's a great opportunity to shape those policies in the area of health and security. We want the Polish presidency to be the initiation of the new tendency in Europe. Of course, there are many other things that have been written very wisely in the white paper that should be presented, so please excuse me that I have only selected very few people, very few examples for this white paper, but let me also at the very end refer to the first statement that we have in the white paper. This is Lech Wałęsa, the symbol of our freedom after 1989. Great statement of Lech Wałęsa about the value that he has dedicated his life to, solidarity in health. We call it social solidarity in public health, but it mentions the right to health and shaping the conditions to contribute to health, not only through the fact that we have specific level of healthcare, but also because we need to have a particular surrounding for healthcare, which can be shaped.
Ladies and gentlemen, next there are chapters such as structure and methodology. Mr. Przybysz, whom you have already met, a very important chapter, saying that from methodological point of view, you can create this white paper or recommendations of experts with a lot of content. Well, there's nothing new to you as guests, but to my students and actually to our students. For our students, that's really a lot. It's actually a textbook. And one more very important chapter by Jakub Wierczyński and Małgosia Bogusz, which shows us, starting from 2011, again all priorities in terms of health in the EU. Worth looking at it. Now, what is characteristic here is that we have some statistics, not just a presentation of priorities, but also an analysis showing the most frequent topics dealt with during presidency. So ranked first, medical products, ranked second, pharmaceutical products, 3, innovations, 4, cross-border threats. And the clinic that we deal with in medicine is, the clinical aspects are further down, antibiotic resistance, rare diseases, cancer. So now, on a finishing note, let me just show you that in part 2, we also have a very important quote by Minister Chmielowiec about the European Patients Charter. And I also talked about the voice of Katarzyna Kacperczyk in the paper, but also another important chapter of the Chief Sanitary Inspector, who's talking about the impact of COVID and war on health security of the population. So security is really very important in Europe. Prevention. And here we have a voice of a clinicist, Professor Maciej Banach, sitting in the first row. And this is really incredible, worth noting, because in the wake of growing civilization diseases, problems that will impact populational health, clinicians see that prevention is becoming more important. And this is a clinician speaking here about prevention. And one more thing, vaccination, I have to mention it. It's a great accomplishment of humanity, and we need to fight with this. In the sense, we need to position the knowledge about the role of vaccination in the society, because there's a problem with it. Hate that appears, and we need to work on that. In Poland, but not only. On a finishing note, I can say that when you read white paper, you can become convinced that the priorities set in the Polish presidency are quite unique. They are very modern, and they sort of sum up everything that's been going on so far. For example, digitalization, e-health, diagnostic tools, therapy, monitoring tools, leading to evidence-based policy. It's all very important. So that shows how mature health policy is. And health policy, yes, a huge challenge, populational health. So, on a final note, it's worthwhile reflecting upon these different points of views of different people speaking in the white paper. All of them guide us towards a common vision in health policy. And on a final note, let me say that we really want the white paper to also be in the hands of our students. Students should read it and learn, not just them, because the whole community of professionals, healthcare professionals, should actually read at least some of the chapters. Thank you. Well, thank you very much, Professor Bolesław Samoliński, and we are moving to the first panel. Before we do that, we'd like to ask you to take a look in your files. You will find there pieces of paper in different colors, and the one we need now is pink. Well, you can write down your questions on these notes, pink notes. If you have a question, write your name and surname, and then a question. And then you can raise your hand with a pink slip. Then if we have enough time, we will address your question on the stage.
Tę rozmowę poprowadzi Karolina.
So Karolina will be moderating the conversation. Polish presidency as the opening of new institutional cycle, discussion about health in the EU. So tell us, who are you going to talk about and what about? I think this is the right topic to open the panel, because the Polish presidency is happening in a very special point in time. So first of all, there's the new parliament, the new European Commission, and there are new health challenges in the EU. Well, partly for years, they are still the same, such as psychiatry, pediatric psychiatry, and the other things that we've already mentioned. But as we are having a new institutional cycle, maybe we've identified new problems and new solutions. And what is the impact of the political situation in Europe? I am going to talk about it with my guests. But before I do that, the person whom we mentioned so many times is there, Dr. Adam Jarubas, chair of the Committee on Public Health. Hello, ladies and gentlemen, welcome, and thank you for your invitation. It's a great honor for me that I can be with you in this very important point in time and co-create the document that the professor has just presented. The nature of such a document, namely the nature of white paper, is that it is a foundation for reforms. So we do hope that in this key moment, as the new institutional cycle starts, when the European Commission, the Parliament, the Council are presenting their strategic ideas, well, this is a great contribution of the Polish presidency to what's going to happen soon as a response to those great challenges. Ladies and gentlemen, paradoxically, we are not creating anything new. The European health policy is not a new concept. In fact, we are going back to something that's already been present in the development of the European Union. Like in the beginning of 1950s, there were these ideas to create European health policy and European defense policy. Please note that both these challenges are coming back in this unstable world. Comparing 2011, the then presidency of Poland, and today, you will see that we have totally new economic, social conditions. So today, the international order that has been in place for 30 years has been challenged. Transatlantic relations are being challenged. So this brings us to a search for new methods and solutions. Health security, well, security is not just about military security, but health security and others. So I think the initiative that you mentioned today, that was born 5 years ago, namely anchoring health policy in the European Parliament, so European health policy. Even before COVID, the first institutional committees, subcommittees were founded that led to the first Committee for Public Health, which was formed in January. Poland had a big contribution in it, so it wasn't difficult to have a poll chair that group. Today we are talking about the priorities of the Polish presidency. Minister Kacperczyk mentioned that this past week has been very intensive in the Parliament and in the Council. Yesterday we had a presentation of Minister Leszczyna, who talked about the Polish priorities, 3 priorities, but she held an intensive debate with MEPs. And a day before, in Permanent Representative Office, we had an intensive debate about a regulation to be published in March as a follow-up to the pharmaceutical package, Critical Medicines Act, with 13 representatives of 13 countries. Well, you can't always see this, but negotiations in the Council involve difficult conversations because the interests of individual states or sectors are different. And the pillar of that work is Minister Kacperczyk. Thank you very much, Madam Minister, because she held the most difficult conversations in the Council. The first priority seems to be very promising. So that's the digital zone. So at the beginning of our presidency, we adopted a document, European Health Data Space. It's important from point of view of data that follows you as you travel, when you have to take advantage of medical aid abroad. And hopefully we will soon be able to benefit from this regulation. Or disease prevention, that's another important issue. And also we talked about the ambitions of the Parliament and the European Parliament to use the experiences of the European Cancer Programme and to develop similar approach to cardiovascular diseases and neurodegenerative diseases and mental diseases. Promotion of health in the context of digitalization, and the Polish presidency has the ambition to complete the presidency with dedicated conclusions of the Council about it, and we in the Parliament hope to adopt an action plan that would operationalize the strategy adopted last year. And this was confirmed by Ursula von der Leyen. And a week ago in Strasbourg, at a session, we held a debate devoted to a silent crisis of mental health in children and youth. Well, apart from implementing the already adopted legislative acts, we also work on future legislation, and a very important issue is the pharmaceutical package. And we hope that with the involvement of the Parliament and the Commission, we will be able to start a trialogue, negotiations between legislators. So we need new innovative therapies. We want to deal with rare diseases. We know that more than 6,000 diseases do not have any drug medicine therapies, and we want to make access to these therapies equal. And in some areas, we only have access to 50 or 60% of those that are available in Western Europe. So for that we need balance. We need balance in regulations concerning the pharmaceutical market. We already have a declaration of Commissioner Olivier Bartoli that during the first 100 days of the of activities, they will release the Critical Medicines Act. And I was highlighting medicine sovereignty. This is something that we are all highlighting, because in recent years Europe became dependent on active substance deliveries in generics. More than 70% are imported from Asian countries. So today it's really hard to imagine. And COVID was the moment that confirmed that, but also Suez Canal that was blocked because of the failure of a container ship. So we were able to see what would happen if we had no access to these substances overnight. So this is what we want to do, among others, because one of the first reports is about staff crisis in healthcare. Well, healthcare workers are critical resources, and in many locations Access to a doctor is really very hard. So it doesn't only apply to Poland, it applies to whole Europe. We mentioned Churchill today, and I would like to finish with quoting Jean Monnet, one of the founding fathers, who said that the EU develops not in spite of, but thanks to crisis. So let's not waste this crisis. Let's use it to anchor the EU more strongly, making a creative contribution as Poland. Thank you. Thank you for your keynote speech, which was a great introduction into our panel. And now our guest, Professor Maciej Banach, President of the Polish Lipid Association and their Secretary of State in the Ministry of Science and Higher Education, Bartłomiej Chmielowicz, Commissioner for Patients' Rights, Professor Alicja Chybicka, member of the Sejm of the Republic of Poland, Chair of the Parliamentary Team for Rare Diseases, Katarzyna Lewczak, National Institute of Public Health of the National Institute of Hygiene, Paweł Łęgowski, Chair of the Health and Safety Task Force, SGI Europe, Beata Małecka-Libera, Chair of the Senate Health Committee, Maja Mazurkiewicz, President of the PZU Foundation, Marcin Nowacki, member of the European Economic and Social Committee, Vice President of the Union of Entrepreneurs and Employers, and our online guest, Andrzej Ryś, Principal Scientific Advisor, Directorate General for Health and Food Safety of the European Commission, DG Sante. And our second online guest is most likely Professor Piotr Czauderna, Chair of the Healthcare Section of the President of the Republic of Poland. I say most likely, well, discussions are important, but people are the most important, and the professor is at the operating theater. So if he can connect with us, we'll be grateful. If no, we fully understand it. Thank you. And let's start with the presidency perspective. Dr. Andrzej Ryś, if I could ask you for your first comment. Can we hear each other? Are you there? We'll start with the question. So the Polish presidency coincides with the new institutional cycle. Will it have impact on the implementation of health priorities? Dr. Andrzej Ryś, can you hear us?
I'm connected. I can see you, I can hear you. We don't have the visual. Okay, we can see you as well. Please answer this question. It's like in a TV show. In my statement, in the statement that we've heard before, we've seen the perspective shaped for the next few years. I would only approach it from the perspective of processes that will participate in. We are in the presidency trio, so we will also have representatives of the trio. In this discussion, we have to remember that the concept of free presidency countries is an important element, because Minister Leszczyna mentioned that you consult, that there is this cooperation, and this shows not only next 6 months, but actually 18 months. And there are also some processes like budget planning of the EU in the next financing cycle. It's an important element of all the action, because our program that has been established during the crisis period, EU for Health was pretty extensive. It was 9 times more versus the previous financing cycle, which provided much more capability for action. Other element that is significant in our work is concentration on implementing what was negotiated and agreed upon, often in a long process. Another important regulation that we start to implement, as mentioned, is the fact that the Parliament has adopted the final shape of the European health data space. Implementation will take the next 4 years, probably. So again, Poland is at the very beginning of this process. So we need to motivate all the member states, also EU institutions, European Commission, and we need to accelerate this process, encourage mutual support and motivate all the stakeholders of this process. Those will be key aspects. So implementing something what is already agreed, it's an important element. So not only creating or inventing new things, but also implementation is critical. And the last element is the element of innovation in approaching some processes. And Poland has implemented this element of health security as the security of the EU. Is something critical. I think it's an important contribution, not only because of what we have learned during the crisis, so necessity to cooperate, taking rapid decisions, gaining data rapidly, but also learning or drawing conclusions from this crisis or war in Ukraine. So I think that it's an important moment, and I think a lot is happening from the side of Polish diplomacy and Ministry of Health. I would like to thank you for participating in this entire process of reflection, because what Professor Maliński said is it's significant that we're building this knowledge about all that. Welcome, Professor. We're building this knowledge and we're extending the knowledge about EU and creating this group of experts, building the roster of experts interested in EU policy. It's a challenge as well. Thank you so much. And now I would like to ask about the perspective of Senate. We have Dr. Beata Małecka-Libera with us. We know that when it comes to the Senate, this year was under the prophylaxis and health education, which is in line with our priorities of the presidency. What initiatives are being implemented that can be an example of other member states? I'm sorry for my voice, but unfortunately this happens when it's colder. Ladies and gentlemen, first of all, I'm very proud of the fact that prevention prophylaxis is out of the shadow. It's not only out of the shadow, but it's everywhere. I would like to thank the minister that is one of the priorities of the presidency. It's a great area of health safety, huge area, and I believe that such a big and strong as we build it, and it will not be strong only during the presidency. It will remain strong. Ladies and gentlemen, the year of health education and prophylaxis is a resolution of Senate decided unanimously by the Senate. It's a number of conversations with experts. We have created a special council that includes all the clinicists from every specialty so that together we can work out the priorities. And those priorities have been created. And what's critical, it turns out that they are common for all the specialties, so the risk factors that cause increase of chronic disease, cardiological disease, pulmonological disease are common. So actions should also be common and very much strengthened. When we, together with the conference in January, we have invited to participate people that we dedicate all that too. So first of all, people connected with education, people connected to self-government, people connected with associations and NGOs, because we, ladies and gentlemen, we know what prevention and prophylaxis is. We know how important that is, but we need to reach out and change the awareness of the society. This is the greatest challenge, because the fact that people know doesn't mean that they use it or implement it. This is our most important objective. So shift the health education to the grassroots level. We have organized a number of 6 till now, but we can see that the interest is huge, so we'll probably organize more. So thematic regional conferences. We would like to invite everyone who in a given region is interested in health, but can distribute this knowledge. There's one more element, and this is the signal. Just one more thing. Apart from that, we have legislative changes, we have some indicators, recommendations, so we'll be changing the National Health Program in order to have it more focused on children, because everything starts with children. Thank you. Thank you so much. This sound is a suggestion that we need to get to the end of the statement. It's only 3 minutes per participant. Let me remind you. You can see also the timer here. And now the perspective of Sejm, of the lower chamber of Polish Parliament, because as I've mentioned, some things remain with us forever. Mostly the thought that it would be great if in Europe, doesn't matter how many borders we cross, we could have the same access to healthcare, have access to the same medical documentation. The European health data space is one of the tools for that. There is an area of medicine where we succeeded. We have Professor Alicja Chybicka, hemato-oncologist, and in chemo-oncology, we have the situation that all the kids in Europe are treated according to the same standards. How it happened, and can we use it in other specialties? Of course, yes. First of all, thanks for inviting me. It's not that difficult. However, we need to say that in Poland we have 1,200 children with cancer a year, and in Europe it's 35,000. So this is not comparable with rare diseases that I deal with right now, where we have 38 million adults, and in Poland around 2.5–3 million people, and those people are not well calculated, because we don't even know about many of them. And how it happened in the oncology, pediatric oncology. I've been working for 50 years in oncology. At the beginning, when I started, we had 15% children treated, and now it's 80%. In 2023, Poland in treatment of lymphoblastoma was #1 in Europe, and we had the best indicator of illness-free survival. This indicator should be the most important indicator in any disease. How we made it? We have 6 groups dealing with different cancers in Europe. We are connected with all the structures, but this is not EU structures. These are bottom-up initiatives. I can't even tell you what kind of structures are these because there's a lot of them. I don't have time for that. In every kid in Poland, treated in 20 centers, is treated equally as in the entire Europe. The UK has some separate programs when it comes to lymphoblastic leukemia, but the results are similar, and it happens that we have slight differences in programs. But this is our dream in rare diseases. That might be difficult, but if you visit any Polish clinic, there's a book, and from the beginning till the end, what should be administered, what happens when the patient comes in, the diagnostics, everything needs to be quick. We have European results, and Europe helps each other. If we have a problem in Europe, you can call someone else. Wrocław coordinates 6 cancers. That also concerns hematology. So all the diseases of blood coordinated previously by Warsaw. Professor Matysiak, if you have a problem, you can call the coordinator. He has a base. And okay, one more thing I forgot. The database created by the Foundation for Children with Cancer was transmitted to the Ministry of Health. These are rare diseases as well. So on the basis of this, we can develop more, because what we need in Poland is a database of rare diseases. So every patient needs to be listed. They need a patient archive. I could talk for hours, you know, but really, nothing is impossible. This is feasible. Life of these people, these 3 million people, is threatened in Poland because this system is not efficient. It's not organized like oncology and hematology and holistic patient care. Patient needs to be in the center. It needs to be centric program. We need psychologists, we need rehabilitation, physiotherapy. We need to have it also in rare diseases. We need to do it in order to make it as in oncology, in all the other fields. 8 up to 10,000 diagnoses. But we can do it, and EU can really afford it mentally and financially. Thank you so much. Thank you so much. When we look into specific areas of medicine, we have Professor Maciej Banach. It's a question about cardiology, because in the meantime, we had this topic of cardiology plan for Europe, mentioned by Oliver Ropke, and the question, because for years we've been saying that the prophylaxis, the prevention, let's take care of our health, let's live healthier, and so on and so forth. Are we doing enough? Maybe the plan is a good step ahead. What else can we do from perspective of Poland? Okay, thank you. Congratulations of organization of this very important conference, ladies and gentlemen. I really like the words of Professor Samoliński when he summarized the priorities. Only on 4th or 5th place we had prophylaxis 15 years ago. And now we know that this is critical when it comes to striving for health, because number of people that will get sick or die depends on prevention. Doesn't matter what kind of approach we have. The heart disease is 21 million deaths a year, so it's twice as much as cancer. We should not compete, but also what MP Jaruba said. It's the high time to create a European plan for cardiovascular diseases, just as in case of cancer. Why is it critical? because we are afraid of cancer. However, if you ask patients and people on the street, they will tell you, okay, you can have a stroke, you can have a heart attack, and you can still live with it. And some people said recently that Polish cardiology is so good that even if I have a heart attack, nothing will happen to me. It's not true, because after a heart attack, in the next 3 years, 26% of people will die during the next 3 years, and prevention is the only potential reply. Recently, I came back from Ljubljana, and part of prophylaxis is education. However, necessary health education will not fulfill its expectations. So during the presidency, this is critical. We should all be obliged to fight for obligatory health education, because this is the only chance to teach what a diet is, what is exercise, why should we take drugs, medicines, why should we participate in screenings, why only 5% of people take TB vaccine, not to mention other vaccines. So, TB. I said I meant flu, not TB. This is critical. Without that, we will never succeed without education. So I would suggest that very strongly. What's also important, we should not only talk about prevention, we should implement solutions. We have great things in Poland. In the obligatory of 6-year-olds test, we have lipidogram tests. We test their lipid panels. So we should test all the other diseases in the 6-year-olds, because we can invest early and prevent development of these diseases, and then cover all the families. Because if we diagnose a rare disease in children, then we can cover the entire family. If you ask me, I've been working in rare diseases for 15 years, and we still miss data. However, if disease is diagnosed early, we can decrease the number of deaths in cardiovascular diseases. Thank you so much. Thank you. In the meantime, we have connected online. I'm not sure if we succeeded. Let's get back to the discussion about the tendencies. And now Dr. Katarzyna Lewtak from the National Health Institute. We are talking about priorities, but we can see some tendencies locally, what the data shows, because when it comes to the local action, this is your field of expertise.
Yes, we have an online connection with Professor Czauderna. Okay, we will get back to the question, and the professor is very pressed for time. So, Professor, we do appreciate that you're with us. So, when it comes to priorities, health priorities in the Polish presidency, how do you see this, and can geopolitics have impact on it? Hello. Can you hear me? Yes. Apologies, I don't have a very good connection. I just left the operating room, so I couldn't be with you in person. I was doing a surgery on a cancer patient. So when it comes to geopolitics, it does have impact on medication safety, on drug safety. So I'm glad that you talked about the agenda for the Polish presidency that was developed much earlier. And we can learn a lot looking at other approaches, not only the ones in Poland. I'm glad that we are talking about a list of critical drugs, and I hope it will be compatible with the European list. But there are two different approaches. We have FDA approach and EMA approach, American and European. So since we are talking about a list of medicines, the American one is more adequate. It contains such substances as blood and materials that you use as dressings, so it's shorter. And the European list contains a lot of substances also for treating cancer. So I think Poland, as a frontline country, has a big role to play. And you need to realize that we have a private and public interface here. There are private companies who are manufacturers, and it's hard to impose certain things on them. So I think this is very important. And also supply chain is equally important, as well as access to active substances in Europe. For economic reasons, they were delivered from India and China. So I think European countries should specialize in manufacturing specific active substances. And I hope the Polish presidency will make its contribution here, because it takes a lot of investments, billions of dollars, to manufacture production capabilities of active substances. It takes several years before you establish such a facility. But there are countries who took on the challenge, and I'm glad that this is what we talk about in public. In the Chancellery of the President, we took efforts 2 years ago in this direction. We published different papers, and we will publish some more. We collected materials, and I hope that this will be foundation for action. Now the geopolitical situation is uncertain, so that's why that initiative is terribly important. So it is important for the European Union. Also cooperation, we talked about cooperation in the area of pediatrics. I participated in the Lisbon conference concerning reference networks that were being established in the EU. And back then, we decided to create a European consulting system. And it's now being applied. This is an international system. So these two things are important: drug security, list of critical drugs, and digitalization, streamlining consultations. And thank you. Apologies, I need to get back to work. Thank you. Well, thank you very much. And let's get back to the local trends that I asked about before we connected with Professor Czauderna. Thank you for the invitation of our Institute of Public Health to this debate. We analyze the health situation and conditionalities in Poland, as well as reduction of social inequalities in health and improvement of health level in Poland. The current health situation is a consequence of the fact that COVID is now gone. The life expectancy has been longest for years, longer than in 2019 from before pandemic. But we also see a widespread spread of risk factors. So it is therefore so important to increase health competencies among citizens. So like you said, it's not enough to know the threats in health. It's not enough. We need to be able to translate this knowledge into practicalities, into good pro-healthy choices applicable to your own health and health of people around you. So we want to develop health competencies among patients and on institutional level. In 2021, in our institute, we launched a Profibaza system. It collects information about all interventions of public health in the area of health promotion and disease prevention. So we collect different data because we want to know what's happening in Poland in this regard, what's happening at the lowest levels, because we receive reports also from municipalities in that system. So we have a very good overview over the health initiatives taken at the lowest level. So we observe it all. We analyze the reports of different authorities responsible for public health. And what we've observed recently is that there is a discrepancy. We don't see the connection between health needs of local communities and pro-health activities that are being implemented. To give you an example with cardiology, in Profibaza system, over a year, we only see 500 interventions addressed at cardiovascular diseases. That's less than 600 activities, which tells us that the risk factors are very important. So let's collect knowledge, let's do everything to give access to data, because this is key for building a public healthcare system that will be supportive of health competences of citizens. Yes, that's true. Since we are talking about patient data and initiatives for patients, I have to ask the Ombudsman for patients' rights. Health priorities during our presidency, do they answer the needs of patients? And what about the European Charter of Patients' Rights that you refer to in the white paper? Hello, ladies and gentlemen. Looking at priorities that were defined for the Polish presidency, health prevention and mental health of children and teenagers and drug safety. These are also key challenges for our healthcare system. As regards prevention and prophylactics, I only subscribe under what has been said. Lalonda, we've known it for many years. More than 50% of what we do is responsible for our health or disease. We talked about health education. And I think the first step, even though it's a small step, has been taken. Let's make sure that we take bigger steps. So obligatory health education is really very important here. So all these priorities correspond to the needs and challenges of patients' rights. So it's a matter of right to information, also availability and accessibility. Adam Jarubas talked about drug safety, and he talked about accessibility and availability of modern methods and medications. But I wanted to mention a concept of the European Charter of Patients' Rights. The concept has been in place for years, and it's a social document. That document was discussed at the level of the European Parliament and at the level of the European Council, but it's never been adopted formally. I think this is the right time, and this is the right moment to start talking about the European Charter of Patients' Rights. I'm looking at Professor Jasem and Madam Chairperson. Recently in the Senate, we were talking about the European Code of Cancer Patients' Rights. And you can join these two things together. And I think we should adopt some conclusions with reference to that patient's charter. I think this is expected because we want to implement a certain standardized framework for patients' rights and for monitoring those rights, and what's most important, how to follow those rights and exercise those rights. Thank you very much. Well, we are talking about trends and about plans that can materialize during our presidency. I have to mention fighting disinformation. Poland is planning to penalize authors of medical fake news. The EU is considering it. Medical fake news make it hard for us to operate on every level. So Maja Mazurkiewicz is with us, the president of PZU Foundation, the co-founder of Alliance for Europe. You've been fighting disinformation for years, madam. So implementing penalties for medical fake news, will it accomplish some goals? Thank you very much for the invitation. Well, first let's talk about the problem itself, because what you said, it's not just about fake news. If we are talking about prevention, and part of prevention is vaccination, and you need to look at the shrinkage of vaccination rate in Poland, because there are different agendas, among others implemented by Russia, encouraging people not to vaccinate, because the overarching goal is to destabilize the country, to challenge trust into authorities and polarization in the society. So health issues are key that are involved in disinformation, and there are a lot of fake news about health. We need to think about this problem, and I think disinformation and security is key, because we as people are fertile ground. All of us have our own sense of security, and we need it. For many years, fear from loss of health, your own and your relatives, is one of the biggest fears revealed in polls. And now we are looking at other things as well, but health is still very important. So, speaking about prevention, we need to clearly say that we need proper regulations to fight disinformation. The EU has implemented 2 acts on digital services addressed at digital platforms, but they are not enough anymore. So today, with Elon Musk and several other platforms which do not vet all those misinformation, we need to join our forces also in medicine and people dealing with prevention. We need to understand that it's not just about talking to people and they'll know, because others will talk better, easier and in a more accessible way, not at conferences and not through white papers. Sure, they are very important for reforms, but the others will change attitudes of people. They will speak through emotions that people understand and quickly change attitudes. And then we will have even bigger problems in the context of health, not only mental health, but stress and mental health is a huge medicine to cope with disinformation. I'm not in favor of implementing concrete bans, although we need to show what's true, what's not. We need to flag, and flagging is great, but education is key. Also, education as regards critical thinking, digital hygiene, and raising awareness that there's misinformation and that it has impact on us. Thank you. We're closing to the end of the panel. And before we move on to the last questions, I would like to talk about employers and businesses. And we have Marcin Nowacki representing them. And what are the biggest challenges in the area of health, especially in the next 6 months, and what is the perspective of the employers? Well, thank you for your invitation. I don't want to talk only about the presidency, because it's a stimulus to talk about the whole mandate of the European Commission and the European Parliament. And it is also a tool for us to influence institutions, to build a narrative. So that's why it's a very important tool. But it doesn't only, it's not only limited to presidency. It would be hard. Of course, there are some quick wins in some sectors, for example, security and defense, but I think health is not the area where you can accomplish quick wins. I wanted to address 3 main goals, and that, from our point of view, are really important as employers. So first of all, prevention, 2, financing, 3, digitalization. I am pressed for time, so I am going to talk about prevention, because, well, the Union of Entrepreneurs is very active. And, well, today I don't have a business stimulus to talk about it, but I'm outside the industry of prevention. But from point of view of employers, health of an employee is an investment. An employee who's not healthy is a gigantic cost for himself, herself, for the employer, and finally for the state. For years, we've been running campaigns with different companies dedicated to health. We have several editions of a program called Capital Health and several other workshops. It's really important, because unless you invest in prevention, unless you invest in availability of diagnostics, then you will have to incur even bigger costs. It's not like it's easy to show this cost in Excel spreadsheet and that it's fixed. It's dynamic, because we then see costs of treatment that you were talking about, engagement of the state, of institutions, cooperation between states. But it's worth adding personal costs of employee, patient, costs of employers. It has impact on the whole economy, on its competitiveness. And without employees, without competencies at work, today in Poland and in Europe, we won't be able to maintain and develop prosperity. Thank you. Thank you. Same question to Paweł Łangowski, SGI Europe, social partner of the European Commission. Hello, ladies and gentlemen. Welcome. Well, I wanted to talk to you about 3 areas, since I have 3 minutes. First, let me tell you that history can be tricky. A decade ago, I was in the corridor of Ministry of Foreign Affairs, thinking about great career in diplomacy and passing the office of Madam Minister every day. And I never would have thought that I would fall in love with health, and that so many changes would happen. But first of all, I would like to mention how important social partners are as also in healthcare in the EU. So reinventing the wheel in many areas of health. That will be the second topic, and the third topic, private medicine. We talked about the role of social partners, and and one of them is SGI Europe.
However, it seems to me that one of the key elements that we need to mention is the efficiency of the public consultation. So how many of those voices can actually be implemented in the final result of the consultations? And when we look at the statistics, it's not much. So the whole process is not effective because all the valuable voices or statements in the white paper are not reflected in the regulation. So I think we should reflect on that. Another issue is to reinventing the wheel. And in the context mentioned by Professor, I think the devil is in the details, and many things are filled in with a pencil and just taken into the shelf. So even if we detect something, no one will find out. We wouldn't even find out about the results of the screening programs of the 6-year-olds. So we want to implement digital solutions in the school medicine, and this is what the social partners request. So I deeply hope that digitization will be another step and a stimulus to analyze this data. And the third element that I want to add is the meaning of the private medicine on European and national level, domestic level. So the private medicine entities are sometimes a catalyst for change, but if their voice is not listened to, this potential will be wasted on European and domestic level. And with that statement, let me finish my speech. Thank you. I would like to invite Minister Kacperczyk. Paweł said that he's your fan, and I would like to invite you here for a reason. Bogi Eliasen made a statement here. In the Center for Studies for Future. So why Denmark and why future? In this recording, we'll be able to hear what was achieved in Denmark so far when it comes to digitization and protection for health, and what are the expectations for the Danish presidency. Bogi Eliasen first, and then Minister will be asked to comment on that, on this vision of future.
Thank you for having me here. I'm Bogi Eliasen, Director of Health at the Copenhagen Institute for Future Studies. We are here in the days that are extremely important on the future of our region, of our countries, and also the role of health in our societies. The presidency of EU that Poland holds now and Denmark next might be the defining points on what is our role and what is the role of health going forward for the many, many decades from now. I've been initiated the concept called Nordic Health 2030, where we started working across the Nordic countries with building sustainable health, and now also really want to push this to be a Baltic Nordic, so with Poland and the Baltic countries included as well. When we look at the challenges we have ahead, they're all the same, really pushed on NCDs and the long diseases, where knowing and using data to understand is crucially important. So what we can do here, bridging the presidency between Poland and Denmark, is really look at what has worked in Denmark with the huge investment over the last 3-4 decades of digital health and knowledge, and applying the use of data. For instance, with the health portal access that you have as a person, the good access that you have in hospitals, but also how you work with the secondary use of data and really pushing forward knowledge as a way to improve health and well-being in that way. We have successes, for instance, with a high uptake of mammography screening and HPV vaccine, but also using that knowledge really to tailor how do we work with this and what works when. On the next phase of the Danish health reform, another topic that we work quite a lot with, COPD, will be rolled out as the pilot for a disease that is really, really hard on many people, but we don't really help. So how can we work with that much better outside of the hospital, catching early and helping people to be as healthy as possible for as long as possible? And it also means that we could focus on these core elements of the Danish systems, which Poland could learn and apply quite fast for its big population and really move forward in health. And here I've been working quite intensively with the Danish embassy in Poland to bridge the Danish and the Polish presidency in that part, but also really to look at the synergies and how we can go and work together and move the role of Poland and Denmark, maybe working with Nordic health going forward, and what is the resilient role of health in the future society. So how do we build health as the most important societal pillar so that health becomes the resilience in societies, and we with that get more stabilities and better future for all of us. Thank you so much. I wish you a very good day.
Thank you so much. I'm really happy that we're able to listen to Elias. We stay in touch because he was our guest at the conference opening the presidency. I think it's a good moment to mention one more element of the presidency that we haven't addressed yet, because we focus on the priorities of Polish presidency. But we have to remember that in Europe we have the presidency trio. We are the first country that started this trio, but with us in this trio there is Denmark and then Cyprus. So the program ahead of us and the priorities are always agreed upon with the other presidency countries, with Denmark and Cyprus, and those priorities will be continued, followed up and overlap. The presidency is not only administration of portfolio for 6 months. We've heard many times that we have a new situation after the COVID-19 pandemic, and new situation concerning new threats and challenges. So we need to create a new model in cooperation within the EU. That's why the priorities and things that should be on EU agenda should be perceived in a wider perspective, in the perspective of strategic development of healthcare in Europe. If we look at medicine safety that we've addressed already, when we look at that field, we're trying to advance the negotiations on pharmaceutical package, but act on critical medicines that will be implemented to EU agenda during our presidency will require years for development and implementation, and also mental health of children and adolescents. It's a topic that will stay with us for next years, the same as prophylaxis and prevention. So we have to remember that presidency is not a moment in time disattached from future follow-up actions, but it's a well-prepared and well-planned agenda for the next years. Let me add one more challenge, one more thing that we'll have together with Denmark and Cyprus. These are multi-annual financing frameworks. Yesterday in the European Parliament and also here, we've been discussing the issue of financing healthcare from EU budget. This is something that will be working on within our trio, and we'll be also striving for bigger budget and also that health becomes more important in the EU discussion. Thank you so much. I would like to thank participants of the first panel that has implemented the trend and geopolitical context. Please take your seats and stay with us, because we will have several other panels ahead of us. Robert is on the stage, so we can announce the next element of the agenda, another discussion. We would like to thank all the participants, and now we will talk about prevention and health education as pillars of health security in the European Union. You can provide your questions on paper, on those green papers, and we have moderator with us, Dr. Jakub Gierczyński. Please join us.
Przed chwilką pan doktor tutaj był w okolicy.
Doctor was here a second ago.
Bez pana doktora nie zaczniemy.
We can't start without Dr. Gierczyński.
Idzie pan doktor.
The doctor is coming, Jakub Gierczyński,
który będzie moderatorem
who will moderate this conversation.
Chodź. Panie doktorze,
Doctor,
o czym będziemy rozmawiać?
What are we going to talk about? If you could please tell us. Prophylaxis and health education as the pillars of health security in Europe. So, keynote speeches, 8 minutes each.
Zapraszamy sekretarza stanu w Ministerstwie Zdrowia,
Secretary of State, Ministry of Health, Mr. Wojciech Konieczny. Thank you so much. I would like to welcome everyone. Thank you so much for the invitation. I would like to welcome Dr. Nino Berzuli. I would like to welcome the ministers, guests, all the representatives. I'm so happy to participate in this conference. Ladies and gentlemen, it's a great topic because education and safety and public health care is all interconnected and supplements each other. Of course, during the conference, during the presidency, we need to remember about education and safety. Of course, digital education. We need to talk about several things, like data security, the fact that a hybrid war is being conducted. There are attempts to steal sensitive data from computer systems. Those computer systems of the healthcare units are sensitive to those attacks. The other issue is that those systems need to be available for many people, for many stakeholders of the system. So this is their role. And we assume that this is not secret or confidential information. Military-wise, it's a tool that needs to help doctors and society to move around the healthcare system. And the security of data is critical here. So we are tackling this challenge here. So providing data security will be discussed during our presidency. Another issue from another perspective is that collecting this data should be somehow standardized, also in the EU, so that we can compare data from Poland, from Portugal, from Germany, from France, so we can create this system based based on data from different countries. For now, we don't have those systems. Another issue is the threat connected with dehumanization. We cannot run away only to digital medicine, forget about the patients and direct contact. These are very important things. Mental health of children and adolescents, another topic. Another thing is how to translate it into education. It's all interconnected. I think education and public health are synonyms. In education, we have something similar to public health. We perform some actions, we develop some programs, some topics, we focus knowledge and direct the knowledge to young people, and we will expect results in 10, 30, 40 years when they enter the age when the knowledge is most needed. So their lifestyle initiated when they are young, when education will make it safer for them, to safeguard them from addictions, improper diet, from the fact that their lifestyle is not in line with current challenges, and so on and so forth. So we have here a very coherent point, education, convergence between education and healthcare. Education can be very helpful for healthcare, and so I hope that health education will be obligatory in the future, because I think that for the health and security of many people that will be critical. I think that this element of curriculum would be crucial, and it could extend life to many people thanks to this knowledge, and the results will be visible later, because that's the structure of the public health. And there's also the issue of this symptomatic example. This is directed to healthy people, because we already have problems in teenagers and adolescents, but generally is to provide prevention prophylaxis to people that are still healthy, are not addicted. There are not that many threats. So in schools where the education can be provided, this would translate into providing more safety and health in the future. Another thing important from the perspective of safety, prophylaxis and public health. The situation is as it is in Europe. We have military threat. This is what we can say. We know that we need to invest in defense to feel safer from the military perspective. So what will happen in health? Are we going to limit spending on health to secure buying weapons? We cannot allow it, but we need to optimize spending, and we need to focus on things that needs to be understood. Investment today will allow us to save money in the future. And I think that the perspectives that we discuss, that we have some threats that can appear in several years, I think they should promote us to take action. Public health, social health means less spending on healthcare and better preparation for many other threats that can appear in the future. Then the healthcare will be more or less sufficient with those threats. This is extremely important, and I think it was mentioned many times and addressed many times, but in a theoretical manner. So it would be better today to invest in public health because it will pay back in the future. However, today we are not in a comfortable situation like before, that other spendings will not grow. They will. We will need to spend more on military security, on defense, and economy. So we need to focus on public health as well. What are we going to face? We are going to tackle the nature of the public health, which are the challenges or threats connected with addictions. We have new addictions, digital addictions, addiction to smartphone, addiction to adopting abnormal lifestyle as a normal lifestyle, so spending time at home without leaving your home because people work from home, they consume entertainment at home, they get food delivered home, so that can provoke that provokes unhealthy lifestyle, because it's all very easy. And we need to do something about it, so we need to implement public health education immediately, provide education to young people to prevent those problems in the future. Of course, another very important issue is that we assess how all those programs affect young people, if they are effective. There are many countries, also Poland has very good prevention programs available, however, they are not very much taken advantage of.
And as a result, they are not effective, even though they were developed by top specialists, and they cover a lot of areas. And we agree about their content, about their scope, about the goals. But we are not able to convince people to take advantage of them. And this is something that our presidency will focus on. We will compare why specific preventive programs are effective in some countries and not effective in others. What sort of parts of which parts of information are wrong? How should you improve them? How do you reach out to all people with primary, secondary preventive measures? How do you reach out to all those people, making the information attractive and implementable, because other pieces of information, so information that's damaging, it's usually more attractive, it's easily digestible, they spread quickly, and this is taken care of by people who are wishing to earn money on those wrong activities. And there are many examples from alcohol, tobacco industry, and junk food industry. So, yes, unfortunately, I think we are in delay and we are trying to catch up with those who are better than us. So that's why we will focus on those solutions during the presidency. So thank you very much. I wish you a good debate. Well, thank you. And now let me invite Nino Berdzuli, representative of WHO in Poland, Special Envoy for Refugee Response from Ukraine in host countries.
Dzień dobry, Your Excellencies, Minister Konechny, the members of the Parliament. I think they're not with us. But dear colleagues and friends, it's a great pleasure to be here with you and have the privilege to participate in these very important discussions and the debates. Immense leadership by Poland putting health security as one of the 7 security pillars for the presidency, because we've heard from many presenters from the previous panel that health security is very important for the national security, health security is very important for the European security, and we share the common vision for safe, secure, and equitable European region. We know that there are enormous challenges, public health challenges that we are facing today, starting from the various types of the emergency, war, massive displacement of population, climate change challenges. We talked about mental health crisis and the critical situation that we are facing, especially among the young people, and the data consistently shows that this is a worrisome trend that we observe regarding the mental health of children and the young people. Epidemic of the chronic diseases, which eventually will take the life of 9 out of 10 people in this room. But we know that there are solutions, and these solutions are well known. We know that Europe has successes to build on, and as you can see on this slide, the countries on the bottom left corner, they managed to reduce preventable and treatable non-communicable diseases, chronic diseases, mortality and morbidity by investing in coordinated public health actions, investing in smart behavior change and the health literacy interventions. But there are many countries that still need to catch up. But again, there is a need, it's a time to accelerate what is known, and we know that the best buys policies, they consistently show the effectiveness. We need to prioritize preventive measures, and we need to invest in preventive measures. And I'm very glad to see in the white paper, and congratulations to the authors and so many experts that produced this excellent report, that it prioritizes and calls for action to invest more in proportionate and balanced preventive measures. This is very important because both prevention and the treatment are important, but preventive measures, preventive interventions are grossly underfunded, and we need to pay attention to this. We know that individuals and the individual decisions for healthy lifestyles play a very important role. We hear the arguments many times that individuals must make the choices about their children, what they consume, what they purchase, and what they consume. But we know that the decisions of individuals are greatly affected by the affordability, accessibility, and acceptability of their healthier choices. And current marketing landscape, unfortunately, undermines the healthy population's behaviors by misleading the consumers, shaping the choice environments, constraining the ability to make genuinely free and informed choices about the health and the well-being. And the silent epidemic of chronic diseases that we all are talking about need immediately to address the commercial determinants of non-communicable diseases. And we know that the 4 commercial industries cause at least 7,400 deaths per day. And these are the industries from alcohol, tobacco, unhealthy food, and the fossil fuel. And they increase existing health inequities, especially among the social and economically vulnerable communities. We know what are the solutions, what are the best buy policies, and as I mentioned, they show consistently the effectiveness, but implementation of these best buy policies, unfortunately, not good. Only half of the member states are on the track of implementation of recommended best buy policies. And there is a delay in implementation of best buy policies, such as tax on unhealthy food and the tobacco, restriction of the unhealthy marketing, and the ban on sales, retail sales. So these best buy policies, that they are delayed in terms of the implementation at the EU level too. During the Belgian presidency, WHO, the World Health Organization, launched this very interesting report on the commercial determinants of health, which explains the harmful influence of commercial industry, explaining the common practices that are used by the industry and the practices used. And this, to counteract, the industry influence, we need to work together. We need to mobilize the stakeholders to recognize and taking the actions to free the policy environment from this influence. And there are 35 very interesting case studies that are presented in this report that illustrates effect of the industry and their influence on the policies. I would like to bring only 2 case studies, from this report to your attention. Lithuania's strong alcohol policies. They put forward very bold policies, increasing the tax on alcohol. Ban on selling alcohol, retail sale of alcohol, including in the petrol stations, ban of selling toys that mimic the alcohol products, increasing the legal age to purchase and consume alcohol from 18 to 20 years, full ban on advertising in TV, radio, and the internet. All this, of course, was challenged by the industry, by the alcohol industry, and the economic arguments were put forward for the financial losses, job losses, promoting and supporting the cross-border, etc., the campaigns and the messaging, anti-government messaging, etc. So it was quite the orchestrated attack. But we know that it worked well, and Lithuania has currently the very strong alcohol policy. And what worked well is building the stronger coalitions with the partners, with the civil society organizations, advocacy groups, implementing stronger laws and regulations, prioritizing population's health. And importantly, excluding the health-harming industry from policy-making environment. And we see and we know the impact of these policies, 18% reduction of the all-cause mortality among the men and 14% among women. Slovenia's tobacco legislation is another example which was put forward in 2023 to amend its tobacco legislation aligning with the EU directive with the key provisions to ban flavors in e-cigarettes, introducing the health warning on heated tobacco products. And of course there was the resistance from the vape shop owners, the vapers groups who advocated that the use of flavored electronic cigarettes is less harmful and is a successful smoking cessation strategy. But what worked well is harnessing the power of the civil society and the collective response to prioritize the health and the well-being of the population, including in bringing the European key stakeholders, key civil society organizations, writing the letters to the politicians, to the members of the parliament of importance of this bill. Dear colleagues, health is also fundamentally about the choices of the leaders, our leaders. It's a choice about putting health and the well-being first to ensure that they can live the healthy, dignified lives and play a meaningful role in the societies. More and more these choices are about health require the political savvy. We have technical solutions, we have the evidence, the obstacles are mainly political. And I urge all of us to be savvy, to be bold, and to prioritize health and the well-being of our population, and putting in the center the policies that benefits our population and not the commercial industries. Thank you so much.
Thank you, Madam, for your wonderful lecture. And now let me invite you to a debate in alphabetical order. So please take your seats. I will sit on the extra seat because we have a very broad panel. Professor Jean Bousquet, Professor Dominika Dudek online, Anna Fijałkowska, Professor Maciej Głogowski, Kamila Kadzidłowska. Yes, feel free and take your seats. on those beautiful yellow armchairs. Dominik Kuc, Aleksandra Lewandowska, online profesor Iwona Paradowska-Stankiewicz, profesor Miłosz Barczewski, online profesor Piotr Rutkowski, profesor Biorysław Samoliński, Stefan Szerek, profesor Piotr Henryk Skarżyński, profesor Bartosz Wielgomas, and profesor Andrzej Więcek. Feel free to take your seats, ladies and gentlemen. And last but not least, since the Minister Konieczny is with us only till 12, Minister, you're also invited to the panel. So let's start the panel. The rules are clear. 3 minutes for everyone with a signal, and then 1 minute to comment, and you can use your minute several times. We will make an exception for people who leave earlier, so they will have up to 5 minutes. So, of course, you have the right color for asking your questions. What is the color of the notes for asking the questions? I think you know. It's in your bags, in your folders. Green, yes. So now you're asking question on green handout. And now let us start the panel, Disease Prevention and Health Education as the Pillars of Health Security in the EU. So first, Professor Bolesław Samoliński, who's already started talking about it, presenting the white paper. Professor, preventable, so what can be preventable? What's the most profitable from medical point of view? So disease prevention and health education as the pillars of health security in the EU. You surprised me. I thought everybody knew what preventable was, but let me repeat. All civilization diseases risk factors are preventable. So healthy lifestyle, physical activity, and the right diet. So a diet where the basic food would be fruits and vegetables, avoiding alcohol or in excessive amounts. Especially oncologists say that every amount of alcohol is damaging on your health. Of course, smoking tobacco and these cigarettes, a huge challenge today. And that's surprising, actually, because if you look at statistics, how we've been coping with those risk factors in our country, for example, although many EU member states have similar problems. Well done. Unfortunately, we don't feel like we've won because alcohol consumption is on the increase, and I was taken by surprise by recent studies. We, as the faculty, we carried out some studies a few years ago, and actually traditional cigarettes were dominant, and now it turns out that initiation of smoking is when you're a teenager. When you 40% of teenagers start smoking cigarettes. So where does it come from? We asked this question in a questionnaire. So how come people are trying out new forms of smoking? Because if we have a heavy smoker, let's give him something, a way that is less damaging to his health. If he cannot simply quit smoking, we know quitting smoking is a huge challenge, and today it fails more frequently than not. That was the concept, that we substituted bigger evil with smaller evil, but then it became trendy. And what did we hear from respondents when asked why are they using e-cigarettes, vapes? Well, because it doesn't smell, and not because it's healthier. Well, healthier is a very bad word vis-à-vis this problem. Well, less damaging, I should say. And this took us by surprise. We're thinking about it. So there is some tradition, some form of social life in those micro-communities, not only micro-communities, use of teenagers, which is conducive to using this common good, e-cigarette. Thank you, Professor. You're perfect on time. I encourage the Minister to use 1-minute comments as well, because this will be very precious, Minister. We know perfectly well that every change can happen only when we convince politicians to it, including health politicians. And these are the rules. Oh, you're already benefiting from your 1 minute. Go ahead, Minister. Yes, sure. Ladies and gentlemen, as I observe the market and as I see what's happening, look at news and studies, and we've had more and more data because innovative products, nicotine, tobacco products are already available and we can study them. So I can say, well, first of all, I agree with Professor Somoliński. Yes, you are right, and it's very important what you are saying. Now, what would be our goal? What goal should we accomplish? Well, in my opinion, the goal should be to stop tasting anything, to stop adding flavors, because there are, for example, sachets with different flavors. So I'm looking at PhD Nina. This is an international issue. So it will be easier to do this if we had an EU directive that would ban adding flavor and aroma. So we are banning substances that make it easier to absorb nicotine. We are banning them, but the flavors or aromas, they in a way make it easier to absorb nicotine. Thank you for this comment. Professor Łogowski, you were nodding, and unfortunately you bear the consequences of lack of prevention in medicine. 3 minutes for you, sir. Thank you for the invitation. Yes, you indeed can say that I bear the consequences in medicine as clinician, but I would like our society to be free of this addiction, nicotine addiction. But you already mentioned that the statistics say that the number of smokers has been growing, but above all, the number of people who are initiating smoking has been growing among teenagers. Teenagers, young people.
Those anti-nicotine programs should be oriented towards young people. We should focus on education, awareness raising. I'm so happy that we'll have health education subject at schools. I hope it will become compulsory at schools. The other aspect is the tax policy, fiscal policy. It's going well that the fiscal policy is being implemented more and more, and also legislation. I think we should do a lot here, as the Minister mentioned, at least in the aspect of flavored tobacco, any tobacco products with flavor. However we call it, if those are e-cigarettes or cigarettes, and also flavors added to products that we call no nicotine products, there is still space that, in my opinion, is extremely dangerous. So this prevention should refer to all this. Another aspect is the issue of availability for young people of all the nicotine products. Both availability, direct availability, I mean, I'm not saying that they are being advertised, but they are available in every store, in every gas station, that everyone can just reach out. So maybe we could have some legislation based on ban of selling in specific distance from schools, for example. I think this is the greatest challenge right now. We can also think about some tests of all the products. Maybe we should have an independent panel or lab that would test all the substances that we sell in the nicotine or nicotine-free products. So there's still a lot of things to do. Thank you so much, Professor. When we talk about such issues, including toxins, I look at Professor Wielgomasz without any context, but I know this is your field of research and interest. So how can we build prevention and education when it comes to exposition to any addictive substances, including tobacco, but also others? Well, let me start from the fact that the definition of toxins is challenging, and we would refer to some areas that everything is harmful if we don't take sufficient dose. But let me refer to the previous statements and the concept of e-cigarette first. The concept of e-cigarette could have seemed right. So despite of nicotine replacement therapy in the form of patches, we have provided the e-cigarette form that was more accepted by the heavy smokers, chain smokers. However, we made another step ahead. The industry made another step to extend the market by adding those flavors, which on first hand, as first increases the risk and become risky because these are different substances that have never been tested for inhalation. It's really dangerous. That's why I totally agree in 100% that those areas should be limited when it comes to legislation. And we have to remember that from the perspective of toxicology and health risk, availability is everything here, because if we put a poison in the closed cabinet, it's not that risky. However, if e-cigarettes are available for young people, for children, without any scent, so this is attractive because they are undetectable, this is becoming problematic. And when it comes to all those aspects, additional aspects, analytical aspects, I fully support the previous speakers and the concept of creating an independent labs that would be able to test those new products on the market. I would like to address your attention to one more issue, one more legal aspect concerning nicotine. It's not only about nicotine itself, because we have analogs on Polish and US market and EU market that can go beyond any legal restrictions. So we need to be careful to also include those substances. They should also be in the package of legislation that would limit accessibility, availability, first of all, on the EU market. Thank you. Thank you so much, Professor. You have saved 15 seconds. We deeply appreciate, but you still have a minute. Piotr Rutkowski, President of the Oncology Association, Professor, also often says that 50% of cancers can be avoided through early prevention and education. Professor, thank you so much for invitation. I'm so happy that this is the subject of the Polish presidency and our domestic actions in the Senate and the Ministry of Health, because we have this national oncology strategy. 50% of cancers is preventable. WHO has been saying that for years, and the role of education here is the basic. This is very important. I think that common anti-tobacco lobbying, also including those new products that are called e-tobacco, e-cigarettes. This is critical in the entire Union, and Poland has a lot of things to do here. Another issue that was raised before, it's the percentage of investment in prophylaxis, in prevention versus GDP. We don't invest enough, and those actions are not coherent, and cardiology and oncology, they should go hand by hand. The diabetology, pulmonology, they all should go hand in hand when it comes to prevention. Another issue that was raised by my colleagues from Denmark that will take over the presidency is the direct contact with citizens. Through at least digitization of healthcare. We have very good examples because we have internet patient account. There are a lot of things, but no prevention. Maybe we can calculate steps, how many steps you take every day, but there's no specific indication. There are no reminders about the screening or prophylaxis tests. Oncology should also include secondary prevention. Poland has a very good system which is totally ineffective. Currently, we have digital mammographs. We have fantastic mammographs, great initiative of the Ministry of Health. We have DNA tests for cervical cancer. Fantastic tests are not used. Cytology, smear tests are not being used. And another thing, colonoscopy. We should implement screening. All the countries that have succeeded in prophylaxis in this type of cancer, they used FIT and colonoscopy. We have that many smokers, and we should also use prevention here because 3% of people tested detect lung cancer. So the scope of the action is extremely wide. So digitization. On the 27th of May, we opened this National Oncology Portal as a source of data for all the citizens, but there is still a lot of things to do. So, percentage of GDP to prophylaxis. Thank you so much. All right, thank you so much. And now I will ask the President as well, because we have received a letter now, but I think I was given a very important paper from the President. Professor Rutkowski has right to 1 minute, unless what time you need to leave? I still have 15 minutes. Okay, so Minister, do you want to use your minute for oncology? Ladies and gentlemen, yes, because I need to leave really quickly, so let me use my minute. Ladies and gentlemen, of course, we are just before huge changes when it comes to public health. Just a day before elaborating a new act on public health, where prophylaxis will be very well adjusted to what is happening now, what we observe. We have the national health program where we want to involve more prevention than before and keep the balance with the National Health Fund, because we cannot take away the prevention and prophylaxis from this institution, especially secondary prevention, because we need to have specific services offered to citizens. So we have many initiatives that we want to provide, and also the tests that we've mentioned that include the scope that we've been thinking to add to the prophylaxis, as it should be. Thank you so much. Thank you, Minister. These are very important panels, including representatives of the Ministry of Health, because you take final decision. So thank you so much, Minister. Professor Jean Bousquet, you are the pulmonologist how all those risk factors translate into lung diseases. This is one of the most important factors of death in EU. We talk about oncology and cardiology, and we forget about lungs. So what is your comment on prophylaxis and education as pillar of health safety in the EU from pulmonary perspective?
Well, I'm going to take something a bit different, because to me, what is important is shared decision making. If you want to apply something to the patient, you need to have a perfect shared decision making between the patient and the physician. This is why 10 years ago we developed an app for rhinitis and asthma, including pollen and pollution. And then, with the help of Bolesław Samoleński and many others in Poland, we developed this app in 18 countries at the same time, because we wanted something global. Luckily, OECD approved our app, and there are only 2 apps accepted by OECD. One is Polish, and the second is this one. And then we're also approved by the Minister of Health from Poland, France, Japan, and Ukraine, because we're doing something with Ukraine as well. So what have we done? We've used an app, very simple, 4 questions and medications. And now this app helps to improve, first of all, shared decision-making between patients and physicians, but also giving predictive information on pollen and pollution. So I think that digitally enabled, person-centered care is quite interesting. And we're adding now artificial intelligence through an EU grant in order to give information on what is needed before. And I think that this can be used eventually for other prevention strategies. Well, I was leading the Global Alliance Against Chronic Respiratory Disease of WHO, and I was perfectly involved in tobacco smoking. But tobacco smoking is, you should not do it. And we need to reverse this, probably by, well, with your doctor, you may have a different message in order to apply prevention strategies in a different world. Well, I'm not speaking about lung cancer but you know, but I think that we need this. And this is why we have done now other strategies. One is in a falls prevention initiative, and the other one is in urticaria. So we want, in fact, using digital health, artificial intelligence, and person-centered care to improve health prevention.
Bardzo dziękuję, pan profesor.
Thank you so much. You have said 30 seconds, so you can still use 30 seconds later on. If you want to comment on something, you still have time. Let me dwell on this topic and follow up of prophylaxis and education when it comes to environmental factors. Kamila Kadzidłowska, co-creator and vice-president of Parents for Climate. So we already think about next generations. Thank you so much. It's great to take the floor in the name of our movement, concentrated on the future and health of our children. For us, it's symbolic to be invited here because we talk about the future. We don't talk enough about environment so far. That's why I would like to thank the previous speaker and representative of the WHO to raise those issues, because in line with the saying, it's better to prevent than treat, the prophylaxis needs to include a climate policy, because we cannot divide health, public health, and the quality of air or environment or lifestyle that we have. What is key here is the fact that, unfortunately, we can reach out easily to everything that is harmful. From early stage, we can already say that in many countries, EU countries, not to mention many regions of Poland, clean air and access to nature is limited. And this is fundament of health, especially mental health, not to mention to access to healthy, balanced diet. Access to all this is difficult for people, for regular families. It's difficult, too difficult. what we can see on the plates of children in Poland is highly processed red meat. These are sausages, and WHO has been repeating that for years that we shouldn't eat that. And this is classified as carcinogenic factors. We talked about smoking, but our kids do not have impact that they are passive smokers, depending where they live and how our decision makers approach the issue of air pollution. This is critical for our health. So both oncology, pulmonary diseases, this is all connected with the quality of environment. It's still putting down fires that we all the time initiate. We have to eliminate the sources of diseases. I hope it will change in the future, because no system will be able to tackle that, and the costs are burdening everyone, and this is impacting our security and safety. Recently, we cannot forget about this huge crisis related to the position of the U.S. and changes in the U.S. So we need to remember that it's key to build resilient societies. And I would like to refer to Denmark. What is Denmark doing and other Nordic countries? We need very courageous climate policies. We have many ideas and many examples of prevention from many countries. And I hope that during Polish presidency we'll be able to review those ideas, and we encourage you to use EU for kids. If policy is harmful for children, it needs to be changed or not implemented. And the key here for Poland and the EU is the transponding the Air Quality Directive and also implementation of the and also preventing disinformation and greenwashing, because this is still harmful. And that's all from my side.
Yes, there is a great chapter by Madam President in the white paper where all those initiatives are very well described. We do have parents for climate who are active in the Polish Sejm, and we do need to think about the health of next generations and of our generation as well. 1 minute for Professor Ludkowski, 1 minute for Professor Samoliński. Yes, vis-à-vis what Professor Buzke said, yes, new ways of reaching out and prophylactics, yes, but according to our data, contact with the doctor is a very important element. So let's not forget about the role of GPs and occupational doctors, because this is a continuous potential for prevention, which should exist. And the second thing is right information campaigns. We talk about kids' education, but education of healthy adults should exist in every place and in every location. Data and information should be easily available. And last thing is to monitor data about prevention. It's key, because we still don't have good monitoring, and I have high hopes with regard to the National Oncology Network. Access to good data is key. Thank you. Professor Samoliński. Yes, well, Professor, you mentioned a topic that I would like to follow up, Professor Buzke, but I would like to follow you, Madam, as well, because it's all interconnected. Well, I agree, 100%. Nobody will replace a doctor, but there is some space between the appointment with the doctor, and this space should be filled. So if we are talking about secondary and tertiary prevention, so making sure that, taking care that patient doesn't have flare-ups, we want to monitor what's going on, and digitalization is indispensable and helpful. And the app that Professor Jean Buzke mentioned, that covered almost all all EU member states with 60 centers in Europe promoting activities in this regard helps us monitor how patients feel depending on the environmental factors. And that corresponds with what you said, Madam. So further steps in this direction, yes. We have it in allergy and asthma, but it could be equally well implemented in cardiovascular diseases, oncology, gastroenterology diseases, because the model has worked so well that the Polish Ministry of Health, as one of 2 apps, recommends it in its portfolio to be used. So maybe in the future we will be encouraging National Health Fund to also notice it as a medical procedure. Thank you. Professor Anna Fijałkowska, Deputy Director for Science, Institute of Mother and Child. Yes, Institute of Mother and Child. This is what actually we are talking about: education of children, prevention, health education, and education of mothers, because these are the generations that Madam President talked about, parents for climate, that have a chance of entering adult life with a new knowledge about prevention and prophylactics. Yes, thank you. Well, children, actually we're talking about children last, but we should start with them, in fact, because we keep talking about prevention, education, and security. We often talk about it, especially in the context of main goals of our presidency. And yes, these are the 3 elements that are inextricably connected. I'm not just talking about health security, but security in general. Remember, children today in 20 and 30 years will not only be working for your retirement, well, for my retirement, it's the current teenagers who are working, but they will be responsible for physical security of the state, not just intellectually. So prevention, which in fact is trendy, when we talk about it, when we are supposed to do something, then there's a problem with financing of prevention. Let's ask any of the doctors. So how much money would he give away from his contract not to have patients in 10 years with oncological or pulmonary problems? So the decisions have to be taken centrally, and they have to be, and there has to be more money spent from our funds on prevention. And you need to realize that it's hard, because politicians think in the short run, and preventive measures bring outcomes after a longer period. Now, education. I hope health education will be in place in schools, but health education in Poland is supposed to start in class 4 of primary school. But we need to remember about younger children. We need to remember to educate the whole environment. Educating just children and teenagers is not enough. We need to educate parents, their teachers, and healthcare workers. And this will translate into security. And the main directions, yes, of course, digital hygiene and security, because it's not just that young people use digital world too long, but it's also disorders in relationship building. On top of that, we don't know what advertisements children and teenagers see, not only with regard to food, but also availability of different substances which might potentially be toxic, and then they generate risky behaviors. So education about diet, out of discussion, absolutely yes, and physical activity, because indicators from European and Polish studies tell us that there is no basic physical activity among children and teenagers, and we need centrally organized programs for that, to activate youth and to prevent them from involving in risky behaviors. Dominique Kutz. You present yourselves as Generation Z, a generation of change. In Polish, change starts with Z. So as you listen to us as we speak, and you are involved in different debates, what can convince the next generations to get involved in prevention, to get educated, to be self-educated? Because we assume we need to prepare everything. But you, as a young generation, what do you suggest?
Tak, to znaczy dziękuję oczywiście za to zaproszenie i za to
thank
pytanie,
you
dlatego,
for
że
this invitation
istotą
and for your
edukacji
question.
zdrowotnej
The
jest
essence
też
of
to,
health
że oczywiście
education
ta wiedza, która
is
jest
to make
omawiana
sure
tutaj
that the
bardzo
knowledge
często w gronie
we
oczywiście
discuss
wybitnych
among
ekspertów stała się taką
distinguished
wiedzą
experts,
też
well, this
powszechną
knowledge
i
should
taka
be common.
podstawowa wiedza zdrowotna była
Basic
też
health
wiedzą powszechną,
knowledge
którą
should
ma
be
wiele młodych osób.
available
Ja zacznę od
to
tego,
young
że
people.
edukacja zdrowotna, jeżeli
So
mówimy
health
o
education,
tej części,
if we are
która
talking about the
powinna
part
znaleźć się w
that
szkole,
should
moim
be
zdaniem
available in school as obligatory subject, well, it cannot be education about symptoms of concrete diseases. It has to give you knowledge, yes, but it has to generate pro-healthy attitude that the given person will go through life and certain skills. For example, mental health skills. For example, how you respond to different difficult situations. So I agree, it's related to digitalization and using digital tools. And in my opinion, we need legislative solutions here as well. We see a lot of influencers in health. They simply talk about lies that work in TikTok, in virtual space. I don't want to put the baby out with the bath, because there are positive examples of people who spread reliable fact-based knowledge. But indeed, in the case of young people, and this is what Professor mentioned, the space between a young patient and the doctor. Well, in the case of young generation, the internet is used and health disinformation, which is damaging. So if a young person is watching TikTok, reviewing content on Instagram, and comes across false information about physical health, mental health, well, they will take this knowledge, which is not reliable. And in my opinion, what is key here is legislation. And you talked about education of healthcare workers. I agree. Health education is also about education of teachers, teachers who will be teaching, and it's education of parents. For example, on the example of mental health, where a lot of crises could be prevented, for example, through contacting a psychologist and not necessarily psychiatrist in the first place. It's also related to using the right pathway for the patient. So a young person shouldn't start with a consultation of a psychiatrist. Maybe at this stage, psychosocial support and psychological consultations would be helpful. And most of such cases could be then avoided. Thank you. A minute for Professor Samoliński. Yes, I agree. I'm impressed by how nicely you put it. This is the essence of health education. Well, when I think about a health education curriculum adopted by the Ministry of Education, what is missing there are the elements that are related to professionalism of educators, because given it into the hands of teachers who are not prepared in terms of content, who are not prepared to hold such classes in schools, it can only damage. It can reverse the situation. And last sentence, that's also related to what you said, and it's worth highlighting because you mentioned pro-healthy atmosphere. Yes, I support support it 100%. The mission of health educators in schools, those who will be having those classes, is not just about teaching, but creating a pro-healthy atmosphere. Well, thank you. I personally would dream for such a person like Dominik to be such educator, who speaks the same language and who follows the same vibe, as young people say. And this is convincing, because what you said, Professor, there's nothing worse than someone who is boring and falls into certain routines during classes. Professor Samoliński, when he was presenting the white paper, he said that Polish health priorities were very well chosen: prevention and digitalization. And you also mentioned it. So I wanted to ask Dr. Aleksandra Lewandowska, who is with us online. Minister Kacperczyk signalized a report, Impact of Social Media on Mental Health of Children and Youth, and you are one of the co-authors of the report, and that's also a health priority of the Polish presidency. Today we are talking about prevention, and we were talking about mental disorders, but Dominik has just shown this pro-healthy atmosphere, what it could be like. So what could be prevention like with regard to mental health of children and youth? Well, thank you very much for your invitation, and congratulations on the white paper. And I fully agree with what was said before by Professor Fiałkowska and Dominik. And I often keep repeating that also with regard to mental health, the slogan, the motto that we often use, better prevent than treat, is working 100%. But we all know that when we talk about mental health, we cannot only focus on one module, because mental well-being is very much related to all areas that we talked about today. So physical health, physical activity, food, lifestyle, relationships, what's happening in digital space, the internet, and all the things that young people are addicted to, but also the environment. And we often neglected it, and we know it does have impact on mental health and also sexual health. So when I talk about prevention, I often repeat that this is really very important: synergy and cooperation, both with regard to primary prevention, and a big role here will be played and is played by the Ministry of Education, but in cooperation with the Ministry of Health. I think without it, prevention will not be fully effective. And when curriculum is created for health education, well, the curriculum was developed by an interdepartmental team with members, specialists from different ministries and areas. And this is how the next stage should look like for implementing this class and this subject. And I believe it with all my heart that this subject will be obligatory and that we will talk about health in a serious way. So what Professor Samoliński said, we as members of the team, we focused a lot on making sure that health education is organized in an interesting way for students and by people who are well prepared for this subject. And when I speak about synergy, I think it's also important to invite people who will be organizing these classes in an interesting, engaging way, who will be engaging kids about health like that, also in the context of preparing future teachers. So When it comes to cooperation between different departments, when we talk about secondary prevention, as a country, I think we are simply one of the leaders because our new model of psychiatric care for children and teenagers rooted in the community provides a lot of secondary prevention measures, because the possibility of being admitted to a specific specialized center without referral in the case of problems of a 13-year-old prevents mental disorders, which are often related to environmental factors. And we can cover the whole community with that, because prevention should be addressed not only in 14-year-olds, but maybe even above all at adults, parents, because we can see a crisis of parenthood, but also people cooperating with children and youth. And the new psychiatric care model provides such cooperation. There is a lot to be done in the context of legislative changes, exchange of information and cooperation, but we really have made a very big step forward. Thank you, and congratulations. I'm glad that Polish psychiatry of kids and teenagers can inspire the European Union, especially in the context of community care. It's a great success of your measures and decision makers who are involved in the process. So to follow up, Professor Dominika Duda, also online, prevention and education of mental health of adults, also covering addictions. We talked about it earlier. Sorry, we can't hear the speaker.
Hello, hello. Tu studio.
This is the studio. Can you hear us?
Za chwilę się będziemy próbowali połączyć z panią
We will try to connect with Professor Dudek in a moment again.
Czy jest z nami pan profesor Parczewski?
Professor Parczewski, are you with us? Online.
Tak, jestem.
Yes, I'm
witam
there.
serdecznie, panie profesorze.
Welcome, professor.
W takim razie przejdźmy do tej części
profilaktyka,
edukacja zdrowotna w zakresie chorób zakaźnych, bo one
prevention in communicable diseases.
So
it is associated with vaccinations, but what is your take on prevention and health education as a pillar for health security in the European Union? Thank you.
When it comes to prevention of communicable diseases, first of all, we think about vaccination. First of all, vaccination in the context of what is affecting us right now. We have flu epidemic, and among hospitalized people with complications, only 3% is vaccine. These are all people over 70 years old. Among people that died, practically no one was vaccinated at all. And so we talk about vaccinations in the context of other diseases, like other communicable diseases, also in the context of migrating populations. This is the basic of prophylaxis. But I would like to discuss HIV with you. HIV and prophylaxis of HIV is early detection. And early detection allows for quick treatment, and quick treatment causes that people living with HIV are not communicating the disease anymore sexually. And people keep forgetting about that. And also what was mentioned by the previous speakers, in Poland, we don't have program of prophylaxis for both HIV as well as STIs. Unfortunately, we do not talk about it, we do not take talk about sexual health, so in consequence, 50% of people diagnosed with HIV, these are people diagnosed too late, and unfortunately, we don't have biomedical action plan, we don't have prophylaxis, pre-exposition HIV prophylaxis, which is often financed by the state. In Poland, it's not, and currently we have problems with access to PrEP. And for example, in Africa, this prophylaxis reduces the risk of HIV infection to 0. So this 0 risk can be achieved. So it's in our reach to have full elimination of HIV infection with proper early testing and use of PrEP and education for people that would require such prevention and prophylaxis. And my 3 minutes is over. And now a quick comment of Professor how the diagnostic and treatment model in Poland can be compared with EU, because I think we have a pretty good model. It's pretty effective and modern and fulfills the objectives for years. When it comes to diagnostic and treatment, it needs to be understood in the context of the objective UN-AIDS 95. So 95% of people living with HIV should be diagnosed, 95% should be treated, and 95% of treating people should be undetectable viremia. So we are doing pretty well with this last 95%. All people in treatment become free of risk of infecting others, but we have problem with diagnosis. The amount of people is 80–85%, so we are a bit behind the objective, but please note that Poland supported a huge number of migrants from Ukraine when it comes to treatment of HIV infection. And here we talk about 3,500 patients who entered our system and are effectively treated. So there are reasons to be proud, but there is still potential for improvement. So Poland is so effective that they provided diagnostics and treatment not only for the Polish people, but was effective enough to treat also patients from Ukraine, from abroad. Yes, but please remember about testing. Testing is critical. Let's remember and let's recall about late diagnosis. Thank you so much, Professor. Professor Iwona Paradowska-Stankiewicz, vaccination. We've already mentioned that. Unfortunately, we don't have vaccination against HIV, but we have vaccination against other pathogens. So we were used to vaccination of children, newborns. However, it was not very popular to talk about vaccination of adults. The floor is yours. Thank you. Thank you for the invitation and for possibility of taking the floor in this very important issue which vaccination is and its impact on the health of the entire population. As you've said before, actually for years vaccination was connotated first of all with children. Vaccination was in the daily picture of development of each of us, every child. However, current challenges put vaccination in totally different light, different position. It's more connected with the fact that vaccination is becoming a new paradigm referring human health, so health that should accompany us, or would be great if it accompanied us throughout entire life. I don't think it's a flu this time.
I właśnie, proszę Państwa, ten nowy
And ladies and
paradygmat
gentlemen,
to jest
this new
paradygmat
paradigm
mówiący o tym, że poza
says
prawidłowym
that
żywieniem,
beyond proper
prawidłowym stylem
diet,
życia,
lifestyle,
zapewnieniem prawidłowego,
providing
właściwego
proper
snu,
amount of
kolejnym
sleep,
elementem
another
są
element
właśnie
is
szczepienia,
vaccination,
które wpisują
which
się
are in
również
line
w tą profilaktykę
with the
osób
prophylaxis
dorosłych,
of
młodzieży i
adults.
osób dorosłych. I myślę, że tutaj
And I
kluczowe
think
jest
that the
to,
key
że to
issue here
utrzymanie
is
zdrowia przez całe
the fact
życie,
that staying healthy
poza
throughout
oczywiście
the entire
innymi
life,
elementami, narzędziami, którymi dysponuje
together with
dzisiejsza
other tools that are at the
ochrona
disposal
zdrowia,
of modern
musimy
healthcare,
pamiętać,
we have to
żeby
remember
szczepienia
that
stały się jednym
vaccination
z tych
needs to
dodatkowych, ale
become one
bardzo
of those
ważnych
additional but critical
elementów, które również
elements
kształtują
that
nasze
also
zdrowie.
shape our
Bo
health.
tu z jednej strony, proszę
Because
Państwa,
on one
nie chodzi
hand,
tylko o to,
it's not
byśmy
only about
zapobiegali chorobom
preventing
zakaźnym, no bo to jest
communicable
oczywiste.
diseases, because
Szczepienia
that's
temu
obvious.
służą.
This
Ale
is
warto
the
również podkreślić
vaccination
nowy
for,
fakt,
but let's
który od
also underline
pewnie już
another
jakiegoś czasu
fact
jest
that
także
is
dyskutowany
also
i
being
mówione
discussed
szeroko, mianowicie
widely,
to,
which
że
is
szczepienia
that
to
vaccination
także
is
walka
also
z antybiotykoopornością.
fighting
Dzięki szczepieniom zyskujemy
antibiotic
właśnie
resistance.
to, że
Thanks to
możemy
vaccination, we
ograniczać
gain that
antybiotykooporność,
we
a
can
więc,
limit antibiotic
ten problem zdrowia
resistance.
publicznego,
So this
który
problem of
w
public
dzisiejszych
health,
czasach,
which
można
currently
powiedzieć, że
is becoming
stanowi jeden z
critical
kluczowych na świecie problemów.
globally.
I jeszcze krótka kwestia,
And one more
mianowicie
issue,
szczepienia to
namely
także
vaccination
choroby
this
nowotworowe, proszę Państwa,
also
czyli poza tym, że zapewniają
cancer
ochronę przed chorobami zakaźnymi,
illnesses. So
ta ochrona jest szeroka, to
So
także
vaccination prevents
dzisiaj,
protection
to
against
także
communicable
możliwość
diseases, but
unikania
vaccination
chorób
today is also possibility
nowotworowych.
of
I tutaj,
avoiding
oczywiście
cancer.
pierwszą taką
And
szczepionką,
the
którą
first
od lat stosujemy,
vaccination
jest
that we've been
szczepionka
using
przeciw
is the
WZW typu B, która także zapobiega przecież nowotworom wątroby,
hepatitis
ale
B
drugą, o którą
vaccination,
cały czas
and the
teraz
second
walczymy,
one that
cały
we are
czas promujemy
striving
i
for,
musimy te wysiłki,
and
myślę,
I
cały
think
czas
this efforts
to
should
jest
be
szczepienie
strengthened is
przeciw
vaccination
HPV, bo
against
tutaj w stosunku do Europy i do
HPV,
świata mamy
because
duże
we still
opóźnienie.
have a lot.
Dziękuję bardzo.
We need to catch up with the rest of the world. Thank you so much, Professor Andrzej Wiecek, professor of the Clinic of Nephrology. He's going to join us online. We talked about oncology and cardiology, health of the brain, and now kidneys. And we often forget about kidneys in the public domain. And this is a very important organ for us. What about prophylaxis and education when it comes to kidneys, nephrology? Thank you so much for the invitation and presentation. I'm sorry that I'm online, but I couldn't travel to Warsaw. Practically, when we talk about prophylaxis and education, we talk about oncology, heart diseases and communicable diseases, but there's also another problem. These are kidney diseases. Thanks to very simple and cheap tests that can be done in every lab, we can diagnose a chronic kidney disease. I can surprise you with numbers. This chronic disease is in 10% of general population. In Poland, it's even 12 million, so it's almost 4 million people. So when we test population over 65, then it's over 30% of people who, on the basis of this simple test, can be diagnosed with kidney disease. Does it have an impact? Yes, because this chronic disease can lead to terminal stage where patients will require dialysis or transplant. But there is another thing that we forget about, the education education in prophylaxis chronic kidney disease is a serious reason for cardiovascular disease like hypercholesterol, hypertension. So disease of kidneys increases the risk of complications. So prophylaxis, testing, education is very important. Currently, we have coordinated nephrology assistance headed by the first contact doctor. When this kidney disease is detected, we can provide nephroprotection. We have many drugs that allow to stop this disease. So it's worth being detected early, but we need to know how is it being implemented. We need to know the percentage of patients. So we need to use this coordinated nephrology service, and we need to take advantage of nephroprotection. And just one more aspect, when we talk about education in nephrology, let me mention the education concerning donation of kidneys. And transplant is the best way of treatment, and donation of organs is not equal to other countries. We have less donors, especially less donors, donors after death. Without organs, we cannot treat people. So it's a huge challenge. So we need to develop this awareness of society. On the other hand, we want to prepare people, so we want to simplify the qualification procedure. Just as in oncology, patients with kidney disease have less perspective than oncology patients. So we need to remember about that while organizing prophylaxis and healthcare. Thank you. Thank you so much, Professor. I saw that Professor Dominika Dudek is already with us online. I'm not repeating the question. Professor, the floor is yours. Good morning, everyone. Thanks so much for inviting me to this panel. I was present all the time. I'm sorry for the technical problems. Let me start with the fact that there's no health without mental health. Indicators of mental disorders in Poland are very high. The recent research shows that around 8 million people in Poland have problems with mental health. That's why the prophylaxis is critical. Let me address several issues. Let me start with addictions first. We look at the States, at the US, the addiction to opiates has increased dramatically, and during several years, the death related to opiate addiction increased by tenfold. We are not going to avoid this problem, but these are not only narcotics, but also alcohol. Polish data shows that during the next few years, almost the amount of deaths caused by alcohol increased by 40-fold. And nicotine addiction, we've talked about it before, and so from our perspective, in order to combat addictions, it's critical to cooperate between ministries. That's Ministry of Health, Education, Finance, Agriculture, and because I represent Polish Association of Psychiatrists, I wanted to praise our association because we've participated in elaboration of the national strategy for control of tobacco smoking and nicotine products. This proposal was already presented to the government, and we hope that that will include the issues of public health as well. Of course, in psychiatry of adults, we deal not only with addictions. We have to remember that people often at the early stage do not come to the doctor because they are limited not only with accessibility of experts, We are trying to implement a reform of psychiatry already in children and in adults, but we are also reforming psychiatry of adults. But there is still a barrier of stigmatization, and I think in the prevention, these anti-stigmatizing activities are very important when it comes to mental disorders. And once again, I can say that we have very good cooperation of this Psychiatry Association with You Can't Tell Foundation, where we are working in the area of stigmatization of patients with schizophrenia or other depressive disorders. And in the end, one thing that was raised by Dominic, quite often, not only the psychiatrist, but a psychologist, a psychotherapist can be also of assistance. But let me say one thing. It needs to be person qualified. It needs to be someone with specific certificates of scientific associations or specialization. And this cannot happen that anyone can be of assistance with patients. That's why we need to regulate the act on psychotherapists. And the last sentence, optimization of the patient care, elderly patients, because many social problems like loneliness of elderly people, social exclusion, so-called ageism, is affecting the mental health of elderly people, and mental and psychological disorders impact the elderly population, which is a huge challenge. So I have signalized the problems which seem to be key. Professor, there's a question from the room. Mental Power Foundation, only 13% of Poles, according to the polls, knows what mental health means, hygiene of mental health means. If you could summarize in 30 seconds, summarize what is brain hygiene. I think that hygiene of brain is pretty extensive. In our discussion, we have mentioned several aspects like healthy lifestyle, physical exercise, proper diet, but also sleeping, hygiene of balance between looking at digital screen and contacts with the nature that was already mentioned by one of the professors. So I think these are the basic issues that we need to remember about, and everyone should remember about. Thank you so much, Professor. 1 minute for Dominic Kutz. Thank you. Just to add one thing, I'm so happy that you have mentioned some additional challenges that young people are facing. For example, such issues as stigmatization of people that need help in the area of mental health. That's also connected with many stereotypes that young people going to the psychotherapist or psychiatrist will be indicated or stigmatized, or such information is given that if you will not behave, you will go to psychologist, or if you are depressed, just go and jump around, and you'll be fine. So I'm very happy that this issue is being addressed also, because this should be the basis of health education. I'm aware of the delay, but we still have 2 people to take the floor, but I'll be the host of the next panel as well, so don't worry. In the next panel, we have only 9 panelists, and here we have 17 panelists, so I think it's a record.
Pan profesor
Professor
Piotr
Skarżyński,
członek założyciel Światowego Forum
founding
Słuchu
member of
przy
the World
WHO,
Hearing
ekspert
Forum
WHO.
at the
Mówimy o profilaktyce i
WHO. We are
edukacji
talking about
zdrowotnej.
prophylaxis and
Nie powiedzieliśmy
education.
chyba do tej pory
We
o badaniach
haven't heard
przesiewowych, więc
about
proszę
screening,
też,
so
skomentować
maybe
to,
you
panie
can
profesorze. No i
comment on
sztuczna
that.
inteligencja.
And AI.
Tak. No ale przede wszystkim
All right.
jesteśmy również
So
jako Polska
we
bardzo
are, as
dumni,
Poland,
że
we are
jesteśmy
proud
liderem w
that
tej
we
dziedzinie
are
medycyny na poziomie Europy i
leaders
świata.
in
Bardzo
this
proszę.
field of medicine.
Oh, thank you so much. At the end of the panel, you can always take a perspective of other people and screening tests. Well, I'm glad we changed the perspective. A lot of specialties offer different screening tests, and the awareness differs. I don't think we have the same situation in schools as before. When we were offering screening tests, headmasters said, yes, today you're checking nails, tomorrow feet, the day after tomorrow hearing, then allergies and other things. So AI and the progress that has been in place in screening is connecting specialization, because often we have some disorder of hearing. That's why we want to include AI to check holistic health. Professor Samoliński said it. For example, we don't do hearing tests in April or March because this is the period of allergies. So people who are allergic, they have otitis, and then we have false positives, and we want to avoid that. So I'm glad you talked about it, that it's not just about AI. I could talk long about it, but also other specialties could be connected. Very often people who have problem with food, well, they too have problem with hearing because of reflux. So we want to connect things, connect specialization, and what Dominic said, people who convey this information, who teach young people, who should be the right people, but they also should teach senior citizens. Often, when you look at your relatives, look, how many seniors have had problems with hearing? Often, they require mental, psychiatric help, because when someone has tinnitus, they tell them, they say, please speak louder, but in the state, psychiatrists have much higher budgets. So I really liked what you said, Professor Fiałkowska. You asked how much of our budget are we able to spend on prevention, because in the future we will lose patients. Please don't talk loud about it too often. Well, we had representatives from Hanover here 10 years ago, and they said, why would you need screening? Do you not have enough patients? You have more patients? You want to have more patients? No, we want to make them realize that the sooner they come, the better we can help them, so that there is no stigmatization, so that they don't have to wear a hearing aid. So a lot of things, slightly mixed things, but cooperation between specialization, digital medicine, and we want patients to come to us earlier, and then everybody will have enough work. Yes, this was a synthetic summary, and I wanted to comment on it. Professor Samoliński talked about it. Then in the Polish presidency 2011, we focused on hearing disorders among children and youth, but also senior policy. So thank you, Professor, for paying attention to that population of Europeans. And now it's time for Stefan Schreck. Last but not least, apologies, and mic for you, sir. Last, but I did it on purpose for you to have a comfort, sir, that everybody else, every stakeholder has already said something. So these were cross-sectional opinions, and you're an advisor for relations with stakeholders. Santebi, the floor is yours.
Yes, thank you very much. And also thank you very much for being here, for inviting me. And what interesting stakeholders I've seen already. This was really a super interesting discussion, really across the board of public health. Yeah, so if I really wanted to comment on everything, I would need more than 3 minutes, actually. But I will just make some points. The European Union's role in health is very specific. We are not supposed to replace member states, but to help them to do things better than they could do it on their own. And in many of the areas you have been addressing here, there is already something which is done by the European Union. And I would like to mention one general principle that is very useful here, which was actually also mentioned by Minister Konieczny and also by the Danish expert, Mr. Eliasson. That's how can member states learn from each other? Because we have 27 member states, many of them have invented very interesting things, and other member states which could benefit from it just don't know about it. And for that we have a best practice portal. Anybody who is interested could contact me after the meeting. And there, everybody can actually submit practices which are assessed by experts if they are really best practices. And then we organize conferences where experts from member states can learn what other member states are doing. I wanted to mention that in general. So, specifically on what you discussed, one thing are the non-communicable diseases. I don't need to say anything about their importance, but we are actually working on an initiative on cardiovascular disease. And I know you in Poland have already one adopted 2 years ago, so congratulations for leading the way also there. I will not go into the details. What is important, I think, is actually known by the experts around here. Then I need to say something about tobacco and related products, because there we have EU legislation. And I just mention one aspect. In Europe's Beating Cancer plan, we set the goal of achieving a tobacco-free generation by 2040, where 5% of the EU population uses tobacco products compared to the 25% in 2021. That's obviously quite ambitious. So, and then maybe my last 30 seconds on some other comments. On cancer, we have the cancer plan which I just mentioned, and there is a cancer screening recommendation which was just recently updated to help member states with quality cancer screening. And maybe the last thing to mention is mental health, because this was actually mentioned several times. We have also an initiative on mental health which focuses in particular on Generation Z and young people. And also a very important aspect there is anti-discrimination actually and anti-stigma. And this is also a very complicated subject where we depend on best practices which member states are already carrying out somewhere, and we should better know about it. 1 minute more. Yeah, then I could also mention, I found very interesting the link with climate and environmental policy, which is also quite important. And there I would like to mention the Green Deal, which we are having, and which President von der Leyen has announced will continue also in her second term for the next 5 years, which is also very important because environment is also a very important determinant of health. So this is very high on the agenda. And yeah, another half minute maybe on this use of digital tools and social media by children and young people. This is also recognized as a problem at EU level, at the highest level by the President. So there will be a new initiative to find out what can be done about that. This is obviously a very complicated challenge, but also a very important one. I think I stop here.
Coś te mikrofony. O, już słychać. To troszkę pan, dziękuję bardzo za ten komentarz.
Thank you so much for this comment, because we had a comment by Olga that environmental pollution is one of the biggest challenges. The Council for Public Health said that it's necessary to involve health sector in prevention in the area of environment. What can we do to put health in the center of our climate policies? I'm looking at Professor Somoliński. 1 minute. Well, Mr. Konieczny is not there anymore, but we cooperate with him on changing the law on public health. And he mentioned it. This new law provides that there is going to be a committee which will comprise people who are at least under secretaries of state or higher, and they will be managed by a proxy of the Prime Minister. And this council, or actually a committee, will have a form of an executive committee for managing interdepartmental policy, because the problem is that we work in silos of ministries. So Ministry of Health hasn't got the possibility of penetrating other ministries, and we need to change that. Health is involved in all policies. So we are hoping that also the Ministry of Environment will have its duties and competences in the new national program of health. So to be supervised by the Secretary of State at the Ministry of Health under the mechanism that I just mentioned. Thank you, Agata. Women in the center. Let me read out very briefly this short comment. It's very to the point. We talk a lot about pro-health education of young people. So what happened when we introduced health education in schools? Doesn't it show that first you need to educate parents? And the last comment, Aneta, what sort of measures will be implemented to massively inform young people about damaging effect of e-cigarettes? Talking to them at school is not enough. What measures will be implemented to make sure that we don't have more and more points of sale when young people are buying e-cigarettes, vending machines, for example, or measures to counteract e-cigarettes? Maybe we could influence packagings and names that e-cigarettes have, because the current names are very tempting and encouraging younger and younger consumers. And I promised President Helena Rey a short comment on the letter that you gave me at the beginning. And yes, I read it, but everybody should hear about the initiative. So, Madam, hello, thank you very much. As Polish pharmacy, for 2 years, we've been taking the floor about it and saying what needs to be done to curb or eliminate the problems with e-cigarettes. And I've been talking about it for 3 years. Nobody wants to listen, even though it's trivial and simple. So what are we proposing? We know yesterday the Sejm proceeded a new act that will enter into force that eliminates certain things. But, for example, we paid attention to the provision in the act that a salesperson can ask for an ID. Can ask? Has to ask. She should have a duty who she sells the cigarettes to. One word is enough to change nature. And the other thing, we asked those shops with e-cigarettes to be far away from schools. Take it away and make sure that e-cigarettes are not located next to chocolate bars. And the next thing, institute under the Ministry of Health, and the Institute of Łódź, which deals with chemical substances. So we talked to the institute and we asked, why do you not respond if the number of e-cigarettes has increased 1,000-fold? Why are you not asking what's inside e-cigarettes? And they say, we don't have a duty to do that. So what are they doing at all? Whenever we introduce something, it has to be studied. I pay thousands of zloty to register a medicine, but for e-cigarette, you pay nothing. So this is the way for them to have fun, and they are having fun, the producers of e-cigarettes. So yes, I give the floor to the organizers, to the moderators. Thank you for this panel. And now panelists are kindly requested to take their seats among the public. And now another panel, Jakub Gierczyński, will moderate it, and he gives us a feeling of security. First he talked about prophylaxis, and now we are going to talk about drug safety of the European Union, and we will try to answer the question, will EU citizens have secure access to medicines and medical devices? So the first keynote speech, Dr. Grzegorz Cesak, President of the Office for Registration of Medicinal Products, Medical Devices and Biocidal Products. Sir.
Dzień dobry.
Dzień dobry.
Zapraszamy.
Potrzeby dyskusji, wypicia kawy.
I understand you need to discuss and have some coffee, so let's do it the British way, because we are starting the lecture of President Cesak.
Halo, szanowni państwo, bardzo prosimy na górę podejść sobie. Pan prezes Cesak, bardzo proszę.
Czy dobrze mnie słychać?
Can you hear me all right? Yes.
Dzień dobry, dziękuję
Yes, hello,
serdecznie za
and thank you for your invitation. Well, I'm a bit in delay. I came from Kiev, from Ukraine, so this was a big challenge for me. Alive, but there was a bombing. Over the last 2 days it was very intensive, but we managed to meet the Ministry of Health, the Minister of Health of Ukraine, and agencies, and actually the colors today are very Ukrainian, and the topics we discussed in Ukraine were actually very similar to what we talked about this in this panel. So I will be repeating the same thing in a different context. Well, maybe this is not going to be a lecture, but an introduction, a few words about drug safety from point of view of regulators, head of central agencies and the European Drug Agency, where I'm on the management board, and drug safety is one of the greatest challenges of today's Europe. Pandemic, COVID-19 pandemic, which we experienced, has made us realize how fragile supply chains can be and how important it is for the European Union to ensure access to indispensable medicinal products or drugs. But in the wake of hybrid challenges and geopolitical crisis, what's happening behind our border, the Polish presidency in the EU Council, as you know very well, is focusing on health security. So you know all about it. Digital transformation, cyber security, that I would like to discuss in the context of medical devices. Mental health of children and youth will be mentioned at our meetings with the European Drug Agency, Medicines Agency, our representative Dr. Migdał from PTCO, from Pediatric Committee of the European from EMA, and we will be talking about these things, and of course promotion of health and prevention. I have 18 meetings, more than 1,200 people invited from all over Europe, and we are one of the biggest state institutions inviting the most people to the presidency, so the challenge is huge. Now coming back to drug safety and medical devices safety. Regulators, but also our presidency, want to highlight the need to reinforce production of active substances in the EU. The panelists will talk about it, to make Europe independent of deliveries from outside the continent, to monitor, counteract out of stock, and implement early warning and intervention mechanisms. These are very precise and well-defined attempts at equitable right to medicines, to make sure every EU citizen can benefit from therapy regardless of where they live, regardless of their financial situation. Working out a system for collecting data, this is also important. And also, what is equally important, this is an important element in our presidency, we will be talking about the drug safety safety and about early access, shortening the period of data exclusivity to accelerate access of generics and lower the price, but we need to find a compromise for innovations where new molecules will appear in the EU. So we need to balance this access.
Development of e-product information, this is super important. That will increase availability of product information and temporary to in crisis situation, temporary access to trading. This compromise is critical, but implementation of all those means, regulatory means, is the conclusion of the European Commission on critical medicines. It should be discussed on March 2025 because it's my 50th birthday as well. And that's why this date is critical. That's why it's about critical medicines. During Polish presidency, there will be also discussion on the potential financial instruments or regulations oriented towards diminishing dependence of Europe when it comes to drugs and active substances, which are critical. I don't know if Minister Kacperczyk mentioned that, but on February 19, in the permanent representation, there was a high-level conference. This is when I was in Ukraine, but my representatives participated in it, so critical drugs for safety, health safety, and of course there were associations. President Kopecz was there, and experts from pharmaceutical sector and patient organizations. What else? In the framework of health safety and security, we have the office, European Office for Readiness and in case of emergencies. It's a valuable asset when it comes to availability and accessibility to drugs in Europe. Moreover, the European Commission has created a list of critical drugs that includes 200 active substances that are necessary for healthcare in EU. There's an alliance for critical medicines that should strengthen those deliveries. From perspective of the EU drug agencies and head of medicinal agencies, we have created groups for deficiencies of medicines, and since 2022, so during the pandemic, we are providing direct reaction to problematic issues concerning drug availability caused by serious events or emergencies. Today, those emergencies are geopolitical, not only the pandemic. Another group, this is the working group on medicine deficiency, and we have one contact point responsible for monitoring and reporting events that might have an impact on availability of drugs in the EU, and also task force for availability of medicinal products, strategic support, and also counseling on coordination in the network of regulators when it comes to availability of medicinal products. Let me proceed to medicinal products. Cybersecurity. Apart from medicines or development of the key tool when it comes to integrated tools on availability of drugs, and here cybersecurity would be so important. On the 27th of May, until the 27th of May 2027, the Commission is supposed to implement the regulation on medicinal products and in vitro diagnostic products and prepare a report in evaluation of execution of its objectives. An aspect that I would like to underline is the cybersecurity of medicinal products. This issue evaluation from the perspective of cybersecurity is based on guidelines when it comes to cybersecurity of products. It's a document which substitute all the other documents for cybersecurity evaluation, but it is an indicator for producers. And all those issues seem very important because of new EU acts like Artificial Intelligence Act or Data Act or Cybersecurity Act, which indicates the importance of cybersecurity for those products. And planned presidency action in cooperation with Registration Office, which makes a questionnaire in the EU responsible for supervision of medicinal products, of course in the framework of presidency. All the bodies will come to Warsaw and will discuss cybersecurity here. At the very end, Polish presidency in the European Council concentrates on medicine security, digital transformation, mental health, prophylaxis and cybersecurity of medicinal products. We are working on a Medicine Act and strengthening production in Europe. These are things which are key, in my opinion, in building stable and resilient healthcare systems. Medicine security, these are not only challenges but common responsibility. We can jointly build healthier and stronger Europe. Thank you. Thank you so much. So that was the first keynote speech, and now the second keynote speech.
Wystąpi w tej chwili pan
Lech Pilawski, member of the European Economic and Social Committee, advisor to the President of the Leviathan Confederation.
Dzień dobry, zapraszamy.
The floor is yours.
Dzień dobry wszystkim.
Good morning, everyone. We are supposed to discuss the medicine safety once again, because we've been discussing medicine safety for years. The European Social Economic Committee in those issues is pretty active. For years, we've been addressing European Commission that the regulation on medicines, both European and domestic, would foster EU independence from third parties that would strengthen the production capabilities and accessibility of patients to those drugs. So issues related to prices, and it's not only about medicines, because we often talk about substances, critical substances or drugs, but also very simple things. We are not producing bandages, needles, personal protection devices or substances, and we are in times where we constantly talk about threats, threat of war, so we need to change our perspective on that. I'm not going to supplement the statements of the previous speakers, but let me tell you something else. There is a sparkle of hope, a light of hope, because Critical Medicine Alliance has prepared a strategic report which includes 100 recommendations which are directed towards all the interested parties, but first of all to the EU. And last week we had a discussion on that in Brussels. Very extensive discussion. At the end of the discussion, when we talked about our expectations, how it should look like, representative of the EU Commission said that they support all these recommendations, but he was not able to tell us when the Critical Medicines Act will be published. The date is known, but we still don't know the details. What is in the strategic report, what the European Social and Economic Committee is paying attention to, because not all the aspects were recommended, and not everything was taken into account. So some comments. First of all, the committee is satisfied with work of the Critical Medicine Alliance. It's important to strengthen dialogue between institutions, the industry, social partners, NGOs, civil society, patient associations, and so on and so forth. Better communication is necessary to deal with potential disturbances and optimization of pharmaceutical sector in Europe. Another issue is that the committee thinks that we should implement incentives, like in previous opinions, to support European capabilities, production capabilities, to improve access to key medicines and avoid deficiencies, especially API and also biotechnology. Committee thinks that investment in public health should be under the golden rule of the EU. EESC supports proposal of creating new complex mechanism of the EU oriented towards supporting production of active substances and products, medicine products in the EU. EESC supports creation of the financing mechanism in the form of European Fund for API and basic drugs, managed by the central body of the EU with the support of the member states, European Investment Bank, and also private entities. EESC supports public partnership to drive innovation, invest in supply chains, and so on and so forth. The committee supports wholesalers and pharmacies through regulation that facilitates managing deficiencies within the competitive provisions. And when it comes to PATH for skills, we underline the necessity of improving skills in the area of health and care. That's why we should promote courses in EU. We think that projects key should have a status of strategic action. Same committee suggests that the European Center for Disease Prevention, European Drug Agency, and so on and so forth, and academic community would be involved in emergency planning to react efficiently to challenges in the supply chain. Those recommendations are multiple. I'm not going to read all of them, because there wouldn't be enough time. However, it's important that we have one common path that we should follow towards medicine independence of the EU and improve drug availability, because we know that not in all countries the prices are accessible to EU citizens. We have to remember about that as well. So without strengthening the European pharmaceutical sector, we won't be independent in terms of medicine. So this is our path. Thank you so much. Thank you so much. And now President Lech Pilawski, please stay with us. Please take your seat. And now Dr. Cesak, please join us. And also Łukasz Andrzejczyk, Michał Byliniak, Justin Gandy, Arkadiusz Grądkowski, Iwona Kasprzak, Krzysztof Kopeć, Sybilla Quilici, Irena Rej, Ms. Danko Relic. Please join us. I think that's everyone.
Nie, jest okej. Ja sobie na tym narożnym siądę.
I will sit here. at the corner. I would rather sit here so I can see everyone. Okay, thank you. Ladies and gentlemen, we have time until 2:10. You know each other, you meet regularly, so every one of you is an expert in medicine safety, so I think this panel will go smoothly. So let's talk about practical solutions. Lech Pilawski said that we have market availability, and another issue is reimbursement availability. So if it's on the market and available to the patients, another issue is medicine safety when it comes to functioning of the drugs. So pharmacotherapy and adverse events and crisis and emergencies. President Kopecz was in Brussels yesterday, and you are in Brussels all the time representing Polish industry, and I think discussions about medicine. So let's start with President. How this medicine safety is being shaped right now? How is it doing concretely? You've mentioned that already. We have several documents and several stages that we went through. We have the stance of the European Social and Economic Committee, which clearly stated that making us resilient focuses on production in Europe that needs to happen, that pays off for the economy, and first of all, when it comes to resilience from the perspective of citizen safety and medicine safety. Another issue is the stance of the Parliament, and now we need to go to tangible steps. In Poland, we've been discussing for years, and now we have a national list of critical drugs. And now we succeeded. Same in the EU. We have a list of critical medicines, and from this list, 92% are generic drugs and off-patent drugs. So this is the basis for EU safety. 7 out of 10 drugs in Europe are off-patent. Both elements are important, on-patent and off-patent, but for population and for public health are the off-patent drugs. And the question is, what can we do? We are ahead of a critical moment, 11th of March. It's important not only because it's his birthday, which is critical. Let's remember, I was born on February 9, so important events join us together. So it's an important moment when we will find out if Europe is strong enough or not, if Europe wants to do a good job or just talks about it. And we will still need to cure ourselves with herbs. So or we do something concrete or we just talk about it. So this is the moment when we need to decide, because on March 11th we need to find out. We might be disappointed, so that's why we need to follow up. That's why we need to meet. That's why we need experts to be here and in Brussels to indicate what can be changed or improved. From our perspective, from Polish perspective, EU perspective, we are part of Europe. We are the 5th biggest market when it comes to drugs in Europe. We are Europe. Europe is in us. We are part of Europe. So we need to be aware what we as Europeans need. We need stimulation. It was discussed also at the high-level meeting 2 days ago, where we listened to statements of many ministers and vice ministers from Europe. it's also needed. I think it was said by Minister of Health of Estonia, we need to improve production and have more flexibility, because we can't produce everything. Press Pharma Sequence calculated that a factory of API is around 1 billion zloty. It's an investment that we need in order to produce. So this is something that we can do, but it needs to be flexible in order to produce exactly what we need. And the challenge is that the instruments that we create will not only refer to stockpiling or reserves, because if someone is hungry, we shouldn't send a fridge, because after 1 week, it will be gone. We need to be more cautious. Same with stockpiling. If we send a full warehouse, it will be full until it's empty. So all those elements need to be provided. The most important element is production. Production is safety. That's simple.
So we need to consider how to produce in Europe and how to do it regionally, because we are on the front line. We are could be a hub for production. We could be cooperating with neighboring countries, but there has to be a decision and a solution on the project. If no, it should be followed up, where EU funds support relocation. For example, fixed assets, capex, could be reduced for the producer so that the final price and the product can be available on our market. We can lie to us and say that if you produce in India, it's cheap, and we can pretend we don't see the pipe flowing discharge into rivers. But I would like us to think about production that first and foremost focuses on a reasonable solution. Wastewater Act is great, but it's like with everything. Something's great, but the devil lies in details. So if you look into details, it will turn out that billions of euros are shifted to cosmetic and pharmaceutical industry, which could kill competition. We cannot make a green Skansen out of Europe. It will be green for 20 years as long as we have money, and then it will just be a Skansen. So we need to consider how to bring back production and stimulate economy, and then implement standards. Thank you very much. And they used to say that the generic industry would say, and now innovative industry will say its mind. But this is not how we talk about it right now, because you are simply talking about access to drugs from perspective of patient. So President Michał Bieliniak. Thank you. Well, let me start with reminding you what drug safety is for patients. This is the foundation, the right drug for the right patient at the right time. And I'd be very cautious saying one drug is better than the other. To patients, it doesn't matter. If a patient needs a drug in the situation of threat of life, they won't be thinking whether it's drug A, B, or C and where it comes from. The patient wants the drug to be available and save his life or health, because this is what we are talking about. So we also talked about it 2 days ago in Brussels. So drug safety is a very broad topic, and you need to remember that there are very diverse approaches to this issue. A representative of Estonia is developing its ideas only based on reinforcing supply channels. A representative of Germany talked about the need of globalization, the need to look for friends outside. So same discussion, same topic, but individual representatives have a different take on it. And indeed, different drug groups have different levels of security. Innovative drugs, the most recent information tells us that 77% of active substances for European patients are produced in Europe and 12% in the United States, which means only 9% is produced in Asia and 2% is left for other locations. So the relationship or the the ratio of Europe-Asia production is reverse compared to generic drugs. This is not a situation where, of course, where there are no challenges. On the contrary. So Critical Medicines Act is a draft act. The authors know what is supposed to be inside, but there are certain risks related, for example, to what we have here and now. Because we keep talking about long-term plans. We know that developing a factory takes years. We're talking about years from the moment of entering provisions into force. And EU provisions take a long time. Pharma package, the work on it has lasted for more than a year now. So we expect that it will work in a few years. And if the crisis happens today, we will have to base on one we have today. And we are basing our activities on secure supply chains, because if supply chains are broken, there will be no drug safety, regardless of the products that we are talking about today. It's worth reminding you that more than a dozen substances from the Polish list of critical drugs are produced in Poland from scratch. So today we are basing on outside deliveries. And yes, Krzysztof mentioned stockpiling. It's a perfect example of how you have to be cautious. We shouldn't break things that are already working. Today we managed to deliver drugs, and if we follow certain rules, and if we make them too strict, then it may turn out that, just like in Belgium, the Minister of Health said that they had the first out of stocks for drugs, because in some countries there is a duty of stockpiling drugs for many months. So we can see that Critical Medicines Act will have a broader scope than we thought at first. There will be new challenges we will have to cope with and at least discuss them. It might turn out at the end of the road the shape will be different. And I wanted to highlight one more thing. It's important to approach and this topic in a sustainable way, remembering that patients who are taking tablets at home are equally important as those who take injections in hospitals, and we need to make sure all these drugs are available when they need them. Thank you. Time for Irena Rey. We have been talking that we are talking about the drug safety, but pandemics has shown us a lot of challenges, especially supply chain challenges. In pandemic, we managed to do that. And Europe actually develops thanks to crisis. We said it today. Crisis helps us look for new solutions, and a lot of solutions were implemented in pandemic. So looking at the perspective of Polish pharmacy, well, EU citizens have such security, medicine security? Yes, I think so. Because a crisis helped us look at how we can reverse unwise provisions that were developed virtually by some officials. So if we want to do something well, first and foremost, we need to look at how it's been done so far. So if the analysis tells us it's okay, leave it. Don't change it. Don't try to implement a 3-month stockpiling, because as a result, some will have too much, others will have too little. We've already discussed it. Unfortunately, the reimbursement law includes this provision. It will be changed, but it just shows one thing. So let's ask people who deal with it. Let's ask people who are working with all it. Because I look at it from a side, from a margin, because I'm looking at production and distribution. Because that's the nature of my institution. We have different members who have different activities.
And often, when we hear about API production, well, we are thinking, will it be possible for us to cope with bureaucracy and with permits? Well, when we apply for a concession for a warehouse and we are waiting for a long time because the door is in the wrong wall, if at the level of such small investments we have such huge problems, if we start building API factory, it will turn out that we have different laws, waste law, sewage law, water treatment law, and we will have to follow all these laws. We perfectly know that we have to take into account our nature, environment, and so on. But again, there are certain things there are certain solutions which protect the environment. It's all related to costs. So we talked about the money that will be invested, that we can get from the EU. Well, it's mainly money that should be spent to make sure that our European production is safe and secure, so that it's not damaging the environment. And here we need a lot of money. So this money, yes, you can do certain things, but if there's money, there's both a will and a need, and it's easier to build something, but we have to think along the same lines. It has to apply to everybody who wants to be involved. We have this critical list. Okay, let's wait for it to be definitely published, and we'll look at it. I saw many critical lists developed here, and we were surprised in some cases that something was on that list or something wasn't. So let's wait and see. I think we are going in the right direction. Now, to go in that direction, we need to consider how to make it easier. Justin Gandhi. Security and competitiveness. We are talking about the European Union, production of drugs in the EU, in Poland, but we are not saying who's supposed to manufacture. We are just talking about production of drugs in the EU. So what about competitiveness? What is the perspective of global, what is the global perspective? EU, where is EU here, and where is Poland on that map, which also has a lot of directions of development.
So thank you very much for the question. And again, it's like you said earlier, it's a pleasure to be with everyone, and it feels like we've been on an incredible long journey. And just before Christmas, we were having the final discussions, and now we're actually sitting in the moment where Poland is in the presidency. And I reflected for a moment in terms of how this transition has happened over the last 2 years, over the last year, and even the last 6 months. And it doesn't take long to switch on the radio, to switch on the TV, to see what has happened in the world just in the last 2 months, never mind the last 6 months, and what has changed. And that's why Poland is in probably the most precious time in the EU. And this is the time the EU really has to stand together. And when you're talking about drug security, you're talking about innovation, you're talking about access, you cannot talk about those things without saying what is the access to drugs in Europe and in Poland, and where that is going. And what we've just seen over the last, at the turn of the last century, more than 50% of the drugs that were actually being investigated and looked at was in Europe. Now we're looking at less than 20%. So that has changed. So when you're talking about competitiveness, you've seen how that landscape has changed. And right now, the biggest reform in this policy is under Polish presidency, where we're looking at these reforms. And these reforms are really to make sure that all patients get access. And I think that's what we can all agree on across Europe and Poland, is access. Now, any change and any rule change and any law change that provides that, we will all stand on. When you're talking about access and manufacture and production, that's all part of the discussion. But when you're looking at trying to attract that innovation, not just to a country, but to the EU, we have to look at what can change in this policy. In the opening discussion, it was around what type of protection, what type of patent protection, and that's going to determine what is the future of Europe in that. So right now, mistakes have been made in the past that can be corrected for in the future to make sure we're actually attracting that investment. Because if you're looking at everything now, Europe is being forced to make decisions based on the future, based on what's happening around. But the time is now for Europe to actually make decisions for the future where we have the say, where Poland has the say, where the current aspects around that are actually really in the hands of those that are making those decisions. So I would strongly say that when we're looking at competitive, we have to look at what are we attracting, What innovation are we investing in and how are we investing? Because if we look at the countries around us, when we look at the US, China, and Japan, they have outstripped us in the last 10 to 20 years. It was very close in that investment, and that has changed. And as we can see, the world is changing, and they are taking their decisions. And that we are watching Poland, we are watching Europe, what is the decision going to be to make sure that, one, we are investing in innovation, and more patients than ever are going to get access to innovation. And that's what we really want to see.
Thank you very much, ladies and gentlemen. I encourage you to use your 1 minute right of follow-up. Also, I encourage President Cesak and Director Pilawski, who had lectures, but feel free to make comments.
My często zapominamy, że leki to również
We often forget that drugs are also vaccines. Well, not we, but our message forgets it. Vaccines are drugs. They are registered. And a similar question to Sybilla Quilici. Vaccines Europe, European Federation of Pharmaceutical Association Industry Employers. So how do you make sure that vaccines are available to every patient in every situation in every country and on time?
So thank you, first of all, for inviting us for this important conference. I think listening to the whole conference about the importance of prevention and the role of vaccination has been mentioned several times. And indeed, ensuring access to these important medicines is absolutely critical. Just going back to why this is critical, I mean, we mentioned geopolitics, we mentioned antimicrobial resistance, we mentioned aging to come soon, because today we have all of that to manage is climate change. And all of that is in relation with infectious diseases, increasing burden of infectious diseases in healthy people, but also in patients. And we have witnessed actually what we are witnessing today, the impact of aging, the impact of increased burden of non-communicable diseases, etc. All of that we knew for decades. We knew for decades because we know that we needed to invest in prevention, and we haven't done so. For decades, we say we don't have enough budget dedicated to prevention, 3% dedicated to prevention, etc. And today it is still the case. Despite the COVID, we still have not enough money dedicated to prevention. And this is a barrier to the access to primary prevention, secondary prevention as well. So we need to address this barrier to access, because funding is critical to support innovation to access the people, but also to ensure that your innovative medicines reach out to your patients. And for vaccines specifically, you need to have these innovative vaccines getting into the arm of the patients. It's not sufficient to have a product. You need to ensure that you can actually administer that product. And in relation to, it was mentioned in the previous panel about the importance of childhood vaccination. We have dropped in vaccination uptake. We need to invest in the immunization programs to ensure uptakes. But we also heard from the previous panel the change in immunization policies with regards to adult immunization. When you prevent actually infection, it's not only about preventing flu, it's not only about pneumococcal or etc. It's about preventing the impact that an infection have on a person, whatever this person is, healthy or unhealthy. Flu, for example, if I look at influenza, it does increase by 6 times the heart attack in patients with cardiovascular diseases. 31% of patients hospitalized with bronchiolitis, mainly naming respiratory syncytial virus, have cardiovascular disease complication. All of that is a cost and is a burden. And in fact, when you actually prevent infectious diseases, especially respiratory infections in adults, you actually ensure a population that is healthier. You ensure that you prevent actually the burden of these diseases in the active population, and ensure that the family is actually also well-being. So the return on investment, when you invest in adult immunization, when you prevent actually this economic and social burden, is 19 times. 19 times the return on investment for every euro that you actually put in that specific areas. So now the issue that the member states have is budget. I mean, everybody is under severe constraints of budget. So how to actually invest in prevention, especially in immunization, this is a big question. And we need to ensure that Europe, but also the member states, adopt what we call the golden rule for health to boost high return on investment initiatives. And this is where, so we have the multi-annual financial framework we can look at and see whether we can actually position healthcare and prevention as strategic social security investment. But we also have the new economic governance framework as part of the Stability and Growth Pact that was adopted in April last year. And here we need to look at this very specifically because this is where the member states can actually position prevention and investment, prevention and immunization as an investment in economic and social security and resilience. And in order to do that, I mean, this makes complete sense because if you do invest in prevention, you contribute to a healthier population, you drive economic growth, and you also generate long-term return on investment, which is completely the objective of the new economic governance framework. So what we know that out of the 27 member states, 22 member states have actually submitted their fiscal plans. 5 of which did not because of elections, etc. All of them, but 1 actually included investment in healthcare system in their plans, but very few actually mentioned prevention, and immunization is actually largely absent. So this year, 2025, is absolutely crucial to ensure that those draft budget plans for 2026 actually include dedicated investment in prevention and immunization. We need central level actions, but we need also a coordinated approach between the member states to actually make this investment. And this needs to go with a detailed analysis of the impact that prevention and immunization has on the population at short term, mid-term, and long term. And this is the beauty with this type of medicines as well, beyond other preventive approach that you can have, because they are firstly evaluated on safety and efficacy, but once they are actually implemented, you can actually evaluate as well their impact easily compared to other like healthy lifestyle, etc., which are critically important, but hard to measure the return on investment in the short and medium term at least. So for member states, the call here is for the EU member states to really look at the opportunity through the new economic governance framework to start investing in structural reforms that are needed for immunization and prevention.
Bardzo dziękuję. Wyroby medyczne.
Thank you so
Patrząc
much.
na rynek leków,
Medicinal products, when we look at the medicines, which is so much regulated map, we know how much we spend on reimbursement, drugs, we know different forms of reimbursement, but medicinal products are evolving. Medicinal products assist us on a daily basis, and we forget about it. But when it comes to product safety, we talk about medicine safety, vaccine safety, and medicinal product safety.
I teraz jeszcze drugie pytanie, w jakim kierunku idą regulacje unijne, jeżeli
where
chodzi o
the
MDR,
EU
czyli regulacje
regulation
wyrobów
is
medycznych i IVDR, czyli
striving
tych
for
wyrobów medycznych do diagnostyki.
for
Czyli ten kierunek, który
in
rysuje
vitro
się w Unii
diagnostic.
Europejskiej, żeby zabezpieczyć również
So
dostępność
where
do
is it
wyrobów
striving
medycznych.
for? How to
Bardzo proszę.
provide the safety access to
Dla
medicinal
mnie dużym
products?
sukcesem jest to, że
For me, a
za
great
mną jest taki
success
wielki telewizor
is that
i już te
I have
wyroby
a big
medyczne to już
screen
nawet dłuższy
behind me.
napis niż leki. To znaczy, że
So
to już
medicinal
wszyscy
products are so
zaczęliście
long, so
zastrzegać te
everyone
wyroby medyczne, które de
mentioned
facto
medicinal
są,
products, which in
bez nich
fact
nie ma
are
teraz leczenia, nie ma diagnostyki,
necessary.
nie ma
We can't
rehabilitacji.
provide diagnostics
Moja
without
wypowiedź:
it.
Europa,
My statement:
Polska,
Europe,
będę przeplatał ludzi.
Poland, and world.
Europa.
Europe.
Prezes Grzegorz Cesak,
President
IVDR,
Cesak,
rozporządzenia europejskie w zakresie
regulation
wyrobów
concerning medicinal
wymagają
products
rewizji.
requires revision.
W czerwcu jest posiedzenie EPSCO,
In June there's
ministrów zdrowia,
EPSCO
polityki społecznej.
meeting of ministers
I
of
można zmienić, jest to czas na
health,
zmianę tych
and
rozporządzeń.
it's time
A
for
dlaczego je
changing
zmienić?
this regulation. Why should we
Dlatego,
change
że
it? because Europe is a great place where we drink wine, we eat volleys, we have Eiffel Tower, Colosseum, and China and US are developing strongly they develop technology. 2 out of 3 medicinal products are being produced there. Maybe it's time to change it. And this regulation blocks development and inflow of technology to Europe, including Poland. We advocate for several changes, and now we need involvement of ministers of health and social policy. We need to implement some changes. For example, facilitate recertification, so a product that is once registered does not need to be registered once again in 5 years if it's the same product. And here we have meetings, and Poland will be one of the main countries asking for change. So we are going to elaborate which aspects need to be changed, and I hope that Polish presidency will implement that. Second issue, Poland. In Poland, to be in a safe situation, there are 2 aspects. We have an MP from head of the Senate Commission. Thank you very much for promoting innovation in Poland, and there's a big gap in healthcare. It's not 20 billion, but 200 billion missing. It's time to change Polish healthcare system and talk with courage. We need to focus on prophylaxis, diagnostics, to decrease the costs of treatment, maybe even strengthen. When it comes to new medicinal products, great EU funds that are used to buy a lot of equipment, but we still need to facilitate the strength for financing services. I'm visiting consultants and professors. They show me great devices and they say we have great equipment, but we would like to use it not for few people, but for many people. We can do it in diagnostics, in treatment, so we need to streamline the process. It's not that we want the country to cover those costs. We want in Poland to have clear, transparent pathway to create new guaranteed services, and that concerns medicines and medicinal products. We want the national consultant associations to apply to the Minister of Health to create new service, and the minister would be obliged to give a competent decision. Thank you so much. President Cesak talked about registration of drugs in the EU and also national registrations. In drugs we have this central registration. And now let me address Łukasz Andrzejczyk, because there's an issue of common joint clinical assessment in the EU as the strengthening of access to reimbursement to the medical technologies. These are not only drugs, but also products, applications. So that should be treated in a comprehensive manner. What is the perspective of Polish Agency of Assessment of Medical Technologies? President Ray says the best one. So we can say one of the best agencies in Europe. You have many products, so what is the perspective of medicine safety and product safety and vaccine safety in the EU? Do citizens of the EU can feel secure when it comes to reimbursement? Ladies and gentlemen, it's difficult to reply from the perspective of the agency. We are not a regulator. We evaluate what the minister orders and what is registered in Poland or in EU. It's true that recently we have organized quite well when it comes to JCAG, so this clinical assessment. For us, it's an element that facilitates not only work at the level of entering into reimbursement of given product, but also limiting the amount of work in the agency, which means that if we prepare clinical analysis at the central level for many countries, on our side, in the agency, there will be less work to be done unless this documentation fulfills the national requirements. Of course, what we want to achieve is that we are in consortium with Germany to perform this evaluation. We are still before this process. So we focus on clinical evaluation, but the finances, our GDP, and financial resources are different in other countries. So this might be impacting the pace of this process. Apart from JCA, we have access to innovative technologies. And here we can accelerate some processes and limit resources that are used by the agency. When the common joint clinical assessment is done at the early stage, when the materials are prepared and the final points selected and adjusted to our needs and our assessment when it comes to innovativeness, we are able to limit this process also when it comes to preparation of lists. So now we have one register, one list is being constructed, and at the end of March we will have another list of innovative technologies, and we hope that this contribution will will allow for including more technologies and also reinvestment capability. But the last decision is on the side of the minister, because this is the minister that tasks us with preparation of those evaluations. So this is our contribution to this process. One more question to the director, because for our foreign guests, but in Poland, the agency also needs to provide verification of the services. It goes hand in hand when it comes to availability of products, diagnostics, because these are the doctors, pharmacists that need to order those drugs and dispense those drugs and medicine. So how it will keep up with tariffication? We all wait for tariffication when it comes to drug programs, and how this process of tariffication that supports reimbursement to medicines, vaccinations, and so on. So, please remember that these are three aspects of the agencies: drugs, services, tariffication. All those elements should be joined together. But please remember about the role of the regulator that tasks and defines the schedule and direction when it comes to tariffication. As every year we have a tariffication plan, but we have a lot of additional work. We know that the system is not efficient when it comes to services availability. Anyhow, tariffication do not block work on the side of HTA. Minister has underlined that the main element that impacts time and scope of tariffication is the annual recommendation concerning minimal remuneration. This is an aspect that impacts not only the tariffication of new areas, but this annual change destabilizes the system in all of the services under tariffication. So we take it into account at the level when the tariffication schedule are being updated but all those changes are challenging. Thank you for this reply, but let's remember that it goes hand in hand. Tarification of services around drug market and vaccine market is very important. Now question to Iwona Kasprzak, Director of the Department of Medicine Management, so national payer. We know very well unvaccinated population is hospitalization. We hear about epidemic of flu, huge number of excessive hospitalization, many deaths among seniors and young people because of flu, but also in the interest of the public payer, there is to promote access to good drugs, good vaccines, good medicinal products. What is the perspective of the National Health Fund? Who wants to pay for the result? Thank you so much for this question. There were many issues raised that concern the regulator, which is the Minister of Health. So it's worth mentioning several aspects that will shortly be published when it comes to the draft on amendment of Reimbursement Act for payer, for the minister, for the patients, for everyone. Accessibility to drugs, availability of drugs, and safety is extremely important. So this is what we focus on, and what we have. This is something that we have mentioned in this discussion. One thing is to issue a decision on reimbursement. Availability is something else, and the schedule of availability is another. We want those technologies to be available as soon as possible, and continuity, which is challenging in our daily work, because it happens that we have problems with availability of drugs. And I think what we've mentioned before is the issue of different initiatives to produce those drugs in medicines in Poland or in EU, because when we have problem with API in Asia when it is produced, because 80% active substances is produced in Asia, so automatically all the drugs are becoming unavailable. No, we can not only substitute them. Another issue, as you've mentioned before, were addressed. Reimbursement from the perspective of payer notices the role of Polish producers of medicines. We can see that those Polish producers are top when it comes to reimbursed drugs, so I think it's a good signal. When it comes to innovative drugs, as I've said before, we're trying to provide availability as soon as possible. We have 140 drug programs, so it's showing that the patient safety and access to innovation is at European level. Some areas like hematology or oncology are very innovative, very modern, and available at the same level as in other EU countries. So I think that's the voice of the payer and of the regulator, because on the side of the ministry, director couldn't participate in this panel. So I think I've mentioned the most important things. You have addressed the issue of the drug programs. According to the president of National Health Fund, it's 141. Unfortunately, there were some signals last year that there might not be enough financial resources in the National Health Fund. There was a lot of concerns when it comes to continuation or qualification to treatment. We are waiting for the financing plan of the National Health Fund. And the question is, if you take under consideration this financial aspect of securing with medicines the patients that are already treated or the ones that should be included in the therapies which are life-saving or increasing the chances of survival. Thank you so much. It's a difficult question because, in fact, the situation related to financial resources is challenging. Let's be honest. The resources are limited, but the situation with access to drug programs, the new ones and continuation, is diverse in the country. It all depends on the region of the country. And we have some signals that in some regions there are some challenges when it comes to availability and sometimes even for continuation of the therapy, but we are trying to solve it. And we often discuss with the regional authorities, and we underline that those services are critical, so expenditures need to be organized that, first of all, we secure drug programs because they are dedicated to oncological illnesses, so it's critical to provide those people with life-saving drugs. So the situation is diverse, and we're trying to do anything we can to mitigate these risks. Financial plan currently was not accepted by the Minister of Health, but we are doing all we can to safeguard the patients, to provide them with treatment.
Thank you for your declaration, because I think as we talk about drug safety and patient safety and patient health, I'm really glad that the National Health Fund has made this declaration. And on a final note, we started with and we will finish with Mr. Danko Relic, rapporteur, eliminating drug out of stock in the EU. We talked about vaccination, about medical products, and we know how active your organization is, how everybody listens to it, how valuable its positions are, and what is the perspective of the debate, your sum up from the perspective of European Economic and Social Committee.
Thank you. Thanks a lot. I'm really glad to be here today. And it's really all that was said today, and especially in this panel, is like good music from my ears, from perspective of medical doctor.
Chopin music.
Exactly, and from the perspective of the member of European Economic and Social Committee member. But we must be aware of that we are so specific people that we are here. We are dealing with this really specific topic. But we must be aware of that average MEP member of European Parliament, average member of our committee, I must be honest, average politician, they are not so aware of this topic, of health in general. During the COVID pandemic, health was the top priority topic on agenda. Today, unfortunately, it is not like that anymore. But let me be very clear, Europe that cannot guarantee essential medicines for its citizens, that is dangerously exposed Europe. We are see what every day going from day to day, from hour to hour, what's happening in the geopolitical context. And how did we allow this happen? For too long, we treated medicine as economic product rather than a strategic research. We outsourced manufacturing, we cut costs, we ignored warnings. We had a lot of environmental and green laws, and now in times of crisis, we find ourselves vulnerable. We must be aware that did we learn something from COVID pandemic? Did we learn something from energy dependency of Russia? Must we wait for another crisis before we act? So what will happen in another crisis? It should be like that hospitals will run out of life-saving drugs, patients with chronic illness conditions will be left helpless. The most vulnerable will suffer the most. And the urgent actions that should be done, and that was mentioned a few times today, not only in this panel, but also before, we must start producing our own essential medicines. We must establish a real-time EU medicine tracking system. If we track oil, if we track gas, if we track financial markets, then we should be able to track and to medicine shortages and in general to sharing data between member states. Of course, transparency and accountability from pharmaceutical sector and industry is something that must be present. So this is not just a healthcare issue. This is about European survival in one broader context, and we have to choose. All decision makers, all politicians have to choose. Do we want the Europe that is resilient, independent, and prepared, or do we want Europe that's scrambling in the next potential crisis? So in that context, I'm pretty sure that we have resources, we have expertise. You can see these expertise here and in a lot of other places all around Europe. But what we need now is political will. Thank you.
No, tak szczerze mówiąc, to nawet
Well, honestly, even for us Poles, 1 billion PLN that President Kopeć mentioned, to invest 1 billion in a facility, production facility, is not a big investment, not mentioning the European Union. I need to give the floor to Jarek Frąckowiak and ask him to ask a question, and please tell us who's supposed to answer. This was tricky. You can treat it as a rhetorical question, but I think it's still valid. The Polish list of critical drugs contains 301 molecules. That's more than the European list. 142 molecules are different than on the European list, so there's a difference. 159 are common, so some 50% of molecules, and 115 molecules are present on the European and not on the Polish. So I'm not going to analyze it because there's no time for it, but I have the following question. Is there a chance to extend Polish list and or European list? And let me explain to you why. Because all measures that we hear today that are related to investments that could be allocated into API in Europe, all that is somehow related to that list. So being on the list of molecules increases the chance for production here. And from a business point of view, you need to consider whether it's profitable for a producer or not. Isn't it better to have a broader list? And what is a chance to extend that list? I don't know who should answer. Who would like to answer?
Krzysiek już bierze.
To najpierw pan prezes Cesak.
First, President Cesak. Well, the European methodology is being worked out till the 28th of February. The list of critical drugs methodology was collected, and on the 11th of March, a draft of the act will be published. And the European Commission will be responsible for that. And I think it's important to participate actively in the work, because it all depends on all parties, both here in Poland and in every member state, because every member state will submit their remarks. So from the European point of view, for sure the list will be extended. And so it's a very dynamic process, and this is what it's going to be like. As regards our national list, it all depends on the Ministry of Health, but all parties are very strongly involved and they submit their remarks. And it has to be different because Polish specificity is different and the drug shortages are different depending on the country. And also our specificity is related to a lot of people from Ukraine.
też są troszeczkę
1.5 million people.
Ja jeszcze dodam, panie prezesie, zaraz poproszę pana
Before I give the floor to President Kopecz, and there's another question, current revision of the pharmaceutical law, pharma package. There's no clear approach to shortening exclusivity. Exclusivity period in the EU is the longest in the world, so how can it support drug security in the EU? That's the question from the public. Yes, but I understand. Yes, but since you have the floor, you can continue. Just a minute. Because we have a lunch in a moment. Very difficult situation. I can't let you into the details, but we are looking for a compromise. Remember, we're all working on shortening data exclusivity period. We all want to make sure that generic drugs are available and more disseminated in the European Union. But we have to find a compromise so that clinical studies do not go to the United States outside Europe. So we can expect shortening the data exclusivity period, but whether that was the original draft, I can't tell you. So Poland will be chairing the negotiations. We represent all member states vis-à-vis the European Parliament and the European Commission. So it's not just our position. President Kopecz, you have 1 minute. Yes, RRP, reason, balance, and I forgot what I wanted to say. Decency? No, reason, planning. RRP in Polish. Anyways, we want to bear in mind what we want to accomplish in 10 years to avoid a situation with chemical API. My colleague said it, cheap, competitive, but then we became not cheap and not competitive and not cool. So planning is at the end, but we have to have planning at the beginning. So reason and balance. Reason tells us that we need to have production to be safe. We also need to have safe supply chains, and we need to have warehouses. But the foundation is production in areas that are friendly for us and where there is no risk that the drug will not be available. So balance applies to exclusivity periods. If something's too long, we will cut the branch we are sitting on. We won't be innovative. But if it's too short, we will demotivate for innovation. So it has to be as short to allow implement innovation, and as long so that the money can be earned and motivating, and they have to be clear so that there are good products, good generics, so that patients have more drugs available. I love panels like that we can't part with each other, but we have lunch. It's being served right now. If you're impatient, you can go and grab it, but we need to continue. Director Lew Pilawski, Director Lech Będliniak, the floor is yours. Yes, I wanted to make a declaration. There are members of the committee here, and I say that, again, the committee will deal with the list of critical drugs, because it's the task of the committee, so you can count on us. And 2 more things. In my opinion, we need a common health data platform. And the opinion about rare diseases contained this recommendation. And one more motive, wastage of drugs. And it's also a problem we need to solve, because it's terrible money, a lot of money, and also terrible costs for producers and the environment, and clinical centers, because the fund only pays for the drug that was used, and the drug that was wasted, then the fund doesn't pay for it. So yes, that's the direction you need to check, and you need to estimate. There was this estimate in the report 2 years ago that it's about 100 million. Dr. Beliniak, Director Beliniak. The exclusivity periods are the longest in the States for biological drugs, the one being invented now. So remember that, it's not Europe. And the geopolitical situation has changed significantly from the moment when we started talking about pharmaceutical package. Now all rules we had so far can be thrown out. And we need to think about the situation in a month, 2 or 10. And we create provisions and rules not for tomorrow, but for the next 5, 10, 15 years. So I encourage you to think in terms of building the future of medicinal products, that the system has to work. Modern drugs have to be established not because pharmaceutical companies want it, but because patients need them. We have a lot of diseases, a lot of health challenges, and cutting the branch we are sitting on, because maybe we will need those drugs in the future. This is not wise. Last 2 minutes, I promise, but we have to ask it because there's a question. Yes, Vox Populi, Vox Dei. What will you do to prevent a situation where patients with diabetes cannot buy a drug or drug is not available and it's indispensable for their life, but because other drugs are missing, which are applied for other diseases? So I understand it's about availability on the market of drugs that have indication for reimbursement, and they are in this indication available for patients, but there are other indications. There's a different form of payment. So there are different approaches of different countries. Would anyone wish to comment? Because it's about availability. It would be best if production capacities were so big that there is adequate availability. RRP, again, reason balance planning. You need to plan it. There is such a drug, it's a success, and you have to sort of bear failure and also bear success. Let's not talk about names, but I have to say that both failures and successes have to be somehow born, and we need to cope with that in the system. Unless we think about balance, reason at the beginning and planning, indeed, it will leak where it's not indispensable. And the system, well, we used to reimburse and to a limited number of patients, then we extended it, but we still have to manage it and increase production capacities. If production capacities are sufficient, it will be sufficient for both groups. So again, production. Production is about safety. Remember that. So there's nothing more important and more reasonable that we should remember from this discussion, from years of experiences. Thank you to the panelists. Thank you. We have lunch and we meet at 22. It's 20 to 3.
After lunch,
za chwilę kolejny
in
panel,
a second
kolejna
we'll
dyskusja.
have another panel, another discussion.
Tym razem, przy czym krótka informacja organizacyjna
A
dla
short
Państwa, którzy być może teraz
organizational
do nas
update
dołączyli.
if you
W
just
zestawach
joined us
konferencyjnych
now. In the
otrzymali Państwo
conference
różne kolorowe
sets you have
karteczki.
different
Mamy taki system,
sheets
aby w
with
trakcie
different
spotkania
colors.
zgłaszać
During the
pytania
meeting
na
you
tych
can
karteczkach.
report questions on those
Tym razem kolor
papers.
żółty mogą
Now
Państwo
it's
wyciągnąć z tych zestawów
yellow.
konferencyjnych. Jeśli ktoś z Państwa chce zadać
If you
pytanie
want to ask a
panelistom,
question,
można napisać to
please write
pytanie na
it down
kartce
on this yellow piece of
i
paper.
koleżanka, która nas tutaj wspiera,
And
będzie
our colleague
pani w
will
czerwonej
collect,
sukience
this lady
będzie
in red
odbierać
dress will
w
collect
czasie
those
spotkania te
questions
karteczki i przekaże do nas na scenę, do
and
osoby, która prowadzi rozmowę
forward them
i
to
te
the
pytania wówczas
stage
zostaną
so we
zadane.
can ask them.
Osobą, która poprowadzi rozmowę,
The
będzie
next
redaktor
person
Karolina
is
Chytrek-Prosiecka, a przed nią rzecz jasna,
and
jak
but
zawsze,
before
keynote
her,
speeche.
the
Naszą
keynote
pierwszą
speeches
mówczynią
and the
będzie
first
Marina
keynote speaker
Dawidashvili,
is
kierowniczka do
Marina
spraw polityki i badań
Dawidashvili,
europejskich,
Head of
Forum
Policy and
Parlamentarne na
Research,
rzecz
European
praw
Parliamentary
seksualnych i
for
reprodukcyjnych
Forum for
EESC.
Sexual and
Zapraszam.
Reproductive Rights.
Good afternoon. Can you hear me? Good afternoon. It's a big pleasure and honor to be here today with you. Thank you so much for inviting us. So I'm coming from EPF, European Parliamentary Forum for Sexual and Reproductive Rights, and we're a parliamentary network that brings together members of parliament who fight for sexual and reproductive health and rights locally and also globally. And here in Poland, we also have very active members, for example, Wanda Nowicka, who also contributed to the white paper, where I'm very happy to see sexual and reproductive health very well included. So today I will present to you the study that we've done, and we just launched it actually 2 days ago, but it's an 8th edition, so we do it every year. And first of all, just the first thing that we can establish for ourselves, why do we even look at contraception? Why is it important? So, of course, when we have effective contraception, it contributes to fewer unintended pregnancies and so to fewer induced abortions. And Europe has one of the lowest unintended pregnancies in the world and also one of the highest use of modern contraception. However, these numbers, even though they are good, political progress in this area in Europe is not equal. So today I will present to you the map that you can also grab there. I brought some copies. And this is our methodology that we created to score policy. So the map that I will show you in a minute, it's not contraception prevalence rate. This you can find on UN websites, but we are really scoring countries on their policies, and we are looking at the whole geographical Europe, and we look at coverage of supplies of contraception, access to counseling, and also availability of online information. And we have 17 criteria that we look at. We do it with experts from different stakeholders, professional societies, doctors, politicians. And what we score exactly are access to supplies, access to counseling. These are, so you get answer yes or no, or a middle answer, and then there is a score. I will now present to you the map, and we can have a quick look at it. But what maybe you will see straight away is that there is a very clear divide between East and West. And so also there is yellow countries that are medium countries are in the south, and also Finland. Again, you can get the maps there. So who are the countries that are the green ones? So the champion countries are France, Luxembourg, UK, Portugal, Belgium. Then you have the next ones, which are Ireland, Netherlands, Slovenia, Albania. So mainly still is Western Europe. You have Central Europe in the center in yellow. And then, unfortunately, the score reduces to the countries that perform very poorly and so do not provide women with their bodily autonomy within the context of the insurances and what is publicly available. So let us see, what do best countries have in common? these countries have actually been on top for quite some years and going up and down, but staying in the green. They have coverage system for adults. That means if an adult goes to the doctor, they will receive free consultation. They will also receive covered contraceptives. They don't have to pay for them. There are very good governmental websites. So if you go on Google and something pops up, you will first, if you put contraception, you will first stumble upon a good website which is hosted by the Public Health Authority. And emergency contraception is either partially covered or it's fully covered. So it's free of charge and also without prescription. Then worst performing countries are unfortunately 3 EU members, which also shows us that it's a political decision, because in EU, any country can support women in this regard, and especially on information. So when you have a website which doesn't cost a lot, already that would improve the situation. So countries in red have no coverage for adults, no special coverage for young people, vulnerable groups. Young people, it's very important to support them. Consultations with gynecologists are not covered sufficiently, and there are no public health information on contraception. I will skip this, but I will rather talk to you about the trends. What has been happening in the trends within the past 5 years, because trends are more indicative than every year yearly changes. So the big trend has been countries extending coverage for young people. This year, for example, Ireland has increased the age to 35 years. That means in Ireland, up to 35 years, young people get contraception free of charge. They go to the hospital or to the doctor or to the pharmacy, and it's free. France was the same. Also, they cover condoms, and emergency contraception is also free. And Belgium, the same also, partial coverage also for adults. And Luxembourg last year announced universal coverage. Universal coverage we have also in Portugal, in Slovenia as well, and in very few countries, but these are really exemplary countries. Then on the contrary, the negative trends in Eastern Europe have the countries either stalling or nothing is happening. So no changes in the worst ranking countries. Unfortunately, Poland was on 40%, but then when the emergency contraception became available with prescription, the score really went down, unfortunately. And actually last year, when the government came to power, we did a simulation. So if Poland would, for example, include supplies, so contraceptives partially covered, free coverage for young people, revoke parental consent for contraception prescription, provide emergency contraception over the counter, already the score would become green, so they would really move into good category. But we will hope that maybe it will happen at some point. So you can see here the key findings. Out of 47 countries, half cover contraceptives, 14 cover, so it's only 30% for young people. Counseling is good almost everywhere. 11 countries only, so 23% provide very good websites. And 8 countries provide emergency contraception free of charge. Finally, some societal trends that I would like to mention is there are more and more studies in Western Europe coming that women are starting to critically view hormonal contraception. So, for example, in England, there was now a move to use fertility tracking app. And of course, these are not very reliable methods. So we need to look into why this is happening, why women are moving away from reliable contraception, using calendar methods, then they fall pregnant. So you can see the amount of women who use fertility awareness, who asked for abortion, went to 2.5% from 0.4%. And the same in Germany. More and more women view contraception more critically. So it went from 48 to 61%. So this is a phenomenon we need to take very seriously. And so I will move, I have only 3 seconds, recommendations. So we call for coverage for contraceptives within national health system, ensuring accessible counseling, information provided by the Public Health Authority, and monitor the emergence of new technologies to avoid that they create misinformation and then resulting to poor health. And what I want also to mention is that today, as you know, Europe is preparing a roadmap for women's rights. And it will set also the political tone and on gender equality that the EU wants to take in the next year. So it will also become a base for EU strategy on gender equality, including funding. So what is very important that we keep this high on the agenda, so that we keep contraception, sexual and reproductive health rights, women bodily autonomy, overall gender equality, which is today is the topic of this event, high on the agenda, especially considering current global developments and the difficult times that might be coming soon. Thank you very much for your attention.
Dziękujemy bardzo. Oddajemy mikrofon.
Thank you so much. We put the microphone down. It was the first keynote speech before the panel on women's health security, and now the second keynote speaker, Violetta Skrzypulec-Pinta, Head of Department of Women's Health and Department of Reproductive Health and Sexuology at the Medical University of Silesia in Katowice. And we can reveal that the topic of contraceptive will come back, but briefly, because you only gave me 8 minutes. It's like in Silesia you would show a very good traditional meal, but it would be inaccessible. But I think we can manage. Okay, let me start. Shortly, I wanted to show you how important is the role of a girl, women and seniors in our life. We are the most important, we know that. We know that the world and the earth is female. We know there's no sufficient women everywhere, because if there were enough women everywhere, all that terrible things wouldn't happen. But everything starts with a fetal programming. We are programmed that we, women, are programmed to act in a specific way. And this programming stays with us until the end of our days. That concerns not only fetal development and genetic disorders, but please remember that on every stage of our life, something is happening, even during puberty. In different phases, we mature quicker, and we know a bit more about it. We know, unfortunately, that we don't have sufficient health education. We have the most obese teenagers in Europe. 50-something million kids are obese in Europe, so let's do something with it. Maybe instead of 3 hot dogs, maybe 2. Maybe we should reverse it. I had a question about contraception. Ladies and gentlemen, professors, how can we say that we don't have contraception in Poland? We have some contraception as in Denmark or Germany, but we don't have education. Maybe these kids need to see what are the consequences of lack of education, what are the consequences of behavior, sexual initiation. Maybe we can see, they should see a penis with syphilis, because that's terrible. 40% of vaccination. There's not that many of us. There are some people in front of camera. 4 women will die because of cervical cancer today. This is terrifying to me. So we know already that we have problems. We know that we should talk about education. We need to talk about puberty and disability. Intellectually disabled women have the same rights as others. They need contraception. Let me only say that a girl with intellectual disability has equal rights. She should know that she will get her period, and we need to... Who's talking about disability and contraception? We should. But I don't think anyone else. So global issues and education, teenagers, are we really able to do something more? I live very close to the mountains. We can call Szczerka and Wisła mountains, and I can see a mother, father and kids, and they don't enjoy skiing. They just look at the mobile phones. Is everyone crazy? They just making pictures and selfies. And then we have so many accidents in Szczyrk. If they just take pictures, that's terrible. Let's give a break to transsexual people. They have rights like everyone else. So let's just leave them alone. We are making a lot of fuss about something that we should support, we should be supportive. Our perspective is abnormal, so we as women, mothers, understand everything better. I mentioned vaccination. I talked about eating disorders. We have anorexia or obesity. There's no one in between. As gynecologists and endocrinologists, I see girls that have critical body weight, and mother realizes after 2 or 3 years because she wants to be slim. We have a young woman, we have a plague of endometriosis and thousands of sources of false information. Thus not everyone has metriosis. We need to accept the world as it is. They are women. Let's remember about contraceptives. We have great contraceptives, but we don't know how to use it. And the question is why? Everyone has signed the conscience clause, so there's no education. What education is? What education is? I was going out. I'm a senior. I was going out as a girl, and it was difficult to find me outside, so we were sitting outside, and in the evening, it was difficult for parents to get us home. And we were eating very simple things, and we were enjoying and playing. And of course, there were some priorities. Of course, someone was fat, someone was slim, but we were able to make a decision, group or individual decision. Tell me, can our students make any decision? I can tell you that it's not good. If you see a pregnant patient, of course, go down to the store, buy me chips, buy me cucumbers or something. But we are not going to provide a miracle that we will have more kids until the system will not change, because we are now time when people don't want to have kids, and we have to accept it. It doesn't mean that we are going to have an epidemic of C-section. 38 weeks of pregnancy is nothing else than 38 weeks. And who gets pregnant immediately? And then kids have ADHD. There are no normal kids in the classroom because they have dyslexia, dysmorphophobia, and you name it. It's coming from somewhere. And my favorite period, menopause. Let's not make menopause a demon. It's a normal stage of life, and each woman needs to be prepared for puberty and needs to be prepared for menopause. But this is not something terrible. That's not the end of the world or life, because sure, our guys will also have andropause, and they will be crying when they see Billy Jones or when they see a car that is inaccessible for them, and they won't be able to make any decision, and they will be 70, and they will just consider the existence of their lives, and we're going to have to support them. We live 10 years longer, so we still have 10 years off. And something about oncology. Oncology in Poland is great. We have great oncology diagnostics, but maybe the prevention, the prophylaxis was lost on the way. Why do we provide the same services to Kowalska that haven't done her smear for years versus someone who goes to get tested? Let's do what needs to be done. So we need to change the system, support each other and help each other. And in senior policy, which is not transparent for me, there are ladies coming to gynecologists when they are 70 years old, and we need to teach new generations. Let's look at the patient as our grandmother. We need to take care of the seniors as well. We need to remember about this stage of the life. Thank you so much.
Thank you very much. And now over to the moderator of the next panel, Karolina Hydra-Kościecka, and her guest. Yes, I'm also from Silesia. I can confirm that we also were playing on the so-called Klopfstange, but I don't have as much charisma as Madam Professor. So thank you very much. Thank you very much for an interesting introduction into our discussion, and thank you for showing us some perspective of women. But now we will also have men on this panel. Mr. Debko, consultant in the area of sexology, Agnieszka Gorgoń-Komor, Senator of the Republic of Poland, member of the Senate Health Committee.
Jak sobie pani senatorka życzy. Pani
Adriana Lamaczkowa, Associate Director for National Legal Strategies in Europe, Center for Reproductive Rights. Krystyna Kacpura, President of the Board of the Federa Foundation for Women and Family Planning. Hello. Phil Krzyzek, Managing Director, Merck Poland.
There he is. Hello, Phil.
Anita Kucharska-Dziedzic, a member of the Sejm of the Republic of Poland. Gabriela Morawska-Stanecka, Senator of the Republic of Poland. Are you with us, madam? Hello, welcome. Małgorzata Rozenek-Majdan, social activist, MRM Foundation. Wiesława Rybicka-Bogusz, Deputy Director, Faculty of State Medical Rescue Services, Mazovia Provincial Office, President of Mazovia Regional Branch of Women at the Center Association. Martyna Wyżykowska, Managing Director, Sext PL Foundation. Pleased to have you with us. I'm glad that we are so numerous here. With some of you, I saw a year ago, and as we were preparing for the presidency, but still we have 4 months of presidency. And after us, it's going to be Denmark. In Denmark, this topic is particularly important. So what we work out today might be continued for another 12 months, because then there's Cyprus taking over. So before we start the discussion, I have a request. Let's define what we are talking about at all, because the slogan of the Polish presidency is security, and we are talking about health. So I wanted to ask you the following question. All of you have 30 seconds. So what do you define as sexual health of women? For me, sexual security in women. For me, this is the basic pillar. Without the feeling that you have impact on your own health, on your own future, you can't think about taking care of others. As Sexed.pl, we deal with security in many areas, and one of the areas is Bye HPV, and in cooperation with the Ministry of Health, we managed to implement free vaccination program in schools. Thank you. Well, when we say about security, we talk about emotions. And in fact, we are talking about lack of fear about your future, about your health, about your security, and all the plans you might have in life. But also we are talking about decision-making, about the fact that we do not depend on someone else's decisions, but decisions about your own health are taken by yourselves. And that's a key question. Thank you. Well, I think that security of women is a secure hospital and a secure doctor. So it's really important that a doctor should focus on health of a woman. So this should be his ideology. And the feeling of safety and security in hospital for a woman and for a doctor, a gynecologist, is a priority to provide health security in women. Thank you. And thank you for time discipline.
Thank you. For me, women's health security means that every woman, regardless of where she lives, she has access to reproductive healthcare services that she needs without barriers, fear, or discrimination. It also means that it's about recognizing that reproductive rights are human rights and that governments have a legal and moral duty to uphold these rights and their obligations to ensure that all women can access reproductive health care services.
Thank you.
Thank you for this question. Women's health security is men's health security and child's health security. And as a secure woman, man and child is secure Poland. Sounds very patriotic. The ill will not fight for their country. The healthier we are and we live in such conditions as we live, all areas of life will move forward. We have to be healthy, and it's not just about prevention, but also good care.
Good afternoon. So for me, it's about the protection and the promotion of health rights of women, access to treatment, not about just overall health, but I think particularly with a strategic focus, reproductive health, I think, is particularly important as well.
Thank you.
Well, I have no doubt that women's security is about the right to choose the method of treatment, the pathway of development, but the way she's going to live her life according to her own choice. And I feel like in recent years this has been the most difficult to implement. That's why I'm glad we are coming back to sort of welfare state that allows women to follow their lives the way they dream of. Well, women's health security is a very broad concept, and it concerns both individual aspects, where we are talking about prevention, education, access to medical services, but also it's a systemic perspective, where we are talking about protecting patients' rights, equal access to medicine, to doctors. So women's health security is not just about medicine, but also about health policy, social policy, education and culture. Please remember that an investment in women's health security equals a healthy woman, a healthy family, a healthy society, and a strong economy. Doctor. Well, I could reverse your question. What does it mean, security of women? Well, it's first and foremost being conscious, being aware of risks. If I'm supposed to be safe, I need to know what is my risk in life. Well, life carries a lot of hazards, and we should know about them from childhood on. So investing in health, in women's health security, is investing in their awareness. We're starting from scratch, from health education. Health education, because unless you learn it at school, you won't be able to take care of yourself when you're adult. Thank you, doctor. Well, I was afraid this is how it would end, that it will turn out that it's such a broad discussion that we could organize several panels about it. And this discussion is sort of profiled. We are mainly talking about reproductive health of women, but I wanted to stick with you, doctor, because during our conversation a few days ago, you said a very interesting thing. Before we start talking about sexual reproductive health, we still have a few other steps to take. So what sort of steps are these? Well, if we are talking about health security, we are talking about health in broad terms. And health is not a uniform concept. It's based on 4 basic pillars: health, somatic health, mental health, sexual health, and reproductive health. All of them are strictly interrelated. You can't talk about sexual health and reproductive health if there's anything wrong with somatic and mental health. So taking care of your health, the ability to take care of your health, and knowing how I should live, how I should function, what should I avoid, what sort of prevention I should use to ensure good functioning. Well, lack of education, doctor, we talked about it quite often. Both you talked about it and the keynote speakers. So how come there's not enough education in Poland? Because, yes, lessons about health, it was a political decision that they are not going to be organized in schools. But school is not the only area where you educate. Well, yes. Also, the media should deal with it. But for the media, it's not really an interesting topic. Ladies and gentlemen, to give you a simple example, diabetes, a social disease, a disease which each year increases its impact, negative impact on our society. Each year we have a problem of new patients. We haven't managed to stop it. The consequence of diabetes involves complications, neuropathies, angiopathies, hormonal disorders. And what follows? There are health consequences. Consequences related to, for example, mental problems, because you don't accept yourself and the way you feel. And why do I have diabetes at all? Maybe because there was no education, health education at the right time that would teach me, for example, how to take care of my diet. My parents might not know about it, but I will know about it, and I will be able to implement some new elements in my life in the future. Yes, but today, and I'm looking at Sext.pl, that the social media offer a lot of education. Does it work? Are the social media sort of like school, parents, friends, grandma, grandfather, or are they harming more? Because you are educating. Yes, but social media, it's just means which we use. You can use it to communicate in many ways, just like you use traditional media or school. You can have responsible classes or not responsible classes in school. We reach out to millions of people. The recent statistics tell us that it's 70 million people a month through social media. And this is a way to convey knowledge, what the experts are saying, using a language that's understandable. But there are people who lie in the media. Yes, but it's a matter of responsibility. So it's an element of education that should be present in every home. Cyber security, teaching young people how to select content, how to recognize fake news. It's hard to require that of parents who themselves don't know how to do it. It's hard to expect it of teachers, and experts in new technologies come in and help. Tomorrow we will have a new platform, Lessons Without Taboo, and you will be able to download materials from that platform. So this is something that you're replacing lessons about health? No, it's not a replacement. Simply, we have the right tools, the right knowledge to support schools, and you will find materials there developed by specialists, because these topics are really hard. So all of us here deal with different areas, and it's difficult to require of people who are not professionals to teach their children about some aware consent. If you don't know it yourself. But we were in Brussels this week. Atlas results were being published, and our social media started. In our social media, we talked about horrible result of Poland, and the comments were shocking for us. They're like, you can buy a condom in each store. What's the problem? So we do not even realize that we are in a bad situation. Professor Skrzypulec said that there is no limited access to contraception. There is limited access to knowledge in Poland. Yes, absolutely yes. That's the first and basic problem, and the simplest one to address. Yes, the problem related to lack of knowledge applies to people who are like disabled or who are victims of violence. They don't know that their rights have to be respected. And I'm addressing Anita Kucharska-Dziedzic. What do you do with such a problem? Well, if we are talking in the context of the Polish presidency, what is the most important, because we are talking about health goals and the plans of the Ministry of Health, and contraception did not appear in the plans. I guess it's something normal, right? So diseases. The white paper talks about HIV and AIDS because we are going to talk about it today too. It's a very interesting and broad topic. But I'm also talking about prophylaxis and prevention for people who experience sexual violence. This is the area I deal with. So informed consent, you mentioned, was included in the program of sex education, but sex education, health education, was withdrawn, but maybe people will become convinced in the future that it's a good thing to offer it in schools. But we have a problem with standards of care over people who are victims of violence, victims of crime, regardless of whether they are people with disabilities or without disabilities, intellectual, physical, or others. So the Ministry of Justice has announced directly that the goal of the Polish presidency is going to be to design and extend directive on minimal standards in force for rights support and support of victims of crimes. So this is key for me, because we all know for years, and I remember when 10 years ago, Mr. Bodnar was spokesperson for citizens' rights. Back then we were trying to do a lot of things, but there was not enough budget. There was never enough money. But now we are talking about a person who goes to a police and experienced violence. This person has to be covered by post-exposure prevention. It's not just about HIV, AIDS, but also there are many other big things she could be exposed to. Who's going to pay? It's a decision of the doctor, and the doctor has to consider whether the hospital has a contract for that. Well, doctors know that they should do it because there are WHO standards and other decisions, but still it boils down to financing. And two, post-coital contraception. Well, in the case of post-exposure prophylaxis, I keep hearing that the risk is not big, but the risk in the case of police officers is not big, and there's no problem with that. But victims of rape have problem with that. In the case of post-coital contraception, we have a problem with it in Poland because people think about some strange things, that namely right after coitus that you already have a baby in your belly. So we have a problem in Poland with post-coital contraception. But this was very visible. The problem appeared and nobody knew how to approach it. When it turned out that during war in Ukraine, that we cannot officially offer help to women victims of rape. Our prosecutors did not cope with that well. They didn't find a single victim. They found 300 witnesses, but not a single victim. And I tried 3 times in the parliament to adopt a law that would make it easier for victims of rape during war to be able to, for them to be able to terminate such a pregnancy. But it's a serious problem. In our country, we don't have the right solution because a decision of a prosecutor is required, and the prosecutor has to run an investigation, and it takes a long time.
So women for years have learned that they don't even need to search for help at the prosecutors, and they just do it in the underground. So we need to solve three issues, and I hope it will become a standard of protection concerning protection of people harmed with crimes or post-coital contraception and termination of a pregnancy as a result of crime. So it's a medical procedure, and it became ideology, so it makes it very difficult. And we don't talk about it in medical terms. We keep on searching for a solution, but the Canadian system for me is normal. It's just a medical procedure, and no one has a problem with that. However, the standards of care for victims of violence are very difficult to be implemented because, unfortunately, everything related with sexuality, may it be contraception or pregnancy, this is burdened with such a level of ideology and politics that it's difficult for us to be rational. When it comes to standards, we'll talk about it. Also in vitro, those standards require change, and also assistance to women with disability. But also what you've said leads me to Adriana Maćkova. When we talked on the phone, I've realized that you talk about women's rights as human rights, but this is standard, right? Why this should be standard, and you talk about it as human rights, and this presidency should be used to voice it, to resonate it.
Yes, it's a standard. Health is a human right, and reproductive rights are human rights. And Poland and all other EU member states have international human rights obligations to ensure that everyone and all women can have access to healthcare services that they need. And upholding these obligations is crucial because it ensures access to essential healthcare services. It protects women from preventable health risks and promotes justice and equality and human rights. And these are the very principles, fundamental principles that the EU is built upon. And failing to uphold these principles does not just harm women, but also it weakens entire societies. International human rights treaties like the Convention on the Elimination of All Forms of Discrimination Against Women establish the obligation of the states to provide access to comprehensive reproductive health care services, including contraception, maternal health care, and safe abortion care. And upholding and implementing these international human rights obligations means taking legal and policy measures that remove barriers in access. They also ensure access to rural and undeserved areas, so non-discriminatory access to care. And also these measures should also ensure that states invest in healthcare infrastructure to ensure that reproductive healthcare services are affordable, accessible, and high quality.
Everything sounds great, and it's sad that we talk about it after 20 years in the EU, but the times are as they are, and this is difficult when we think what is happening to the budget of the National Health Fund. However, you've mentioned that this is access. The right is the access. But let me think about these women with disabilities. And every year we have the same discussion. These are women who do not have care of gynecologists, sexologists, reproductive health. Do you agree? I encourage, if you want to intervene, if you want to say something, that's fine. You can discuss between each other. You don't have to wait for me. Wiesława Rybicka-Bogusz. Thank you so much for giving me the floor. I'm a woman with a huge deficit. I'm a woman with a disability, and I'm happy to be able to speak up. I'm a member of Association of Women in the Center. Thank you so much for inviting me to this panel about women's health. And I would like to thank you in the name of all of my colleagues who came here for this conference. That means that the voice of women resonates and is appreciated. I'm sure everyone listens to women, but is it really taken under consideration? We know that we resonate more and more. We have something to say. People and decision makers address us, ask us about opinion, and we have many discussions, panels, and workshops. This is what we do. So what can we say in the context of our panel to support women with disabilities? Women with disabilities are women that require specific care, specific help, thanks to very long experience, because I was the spokesperson of patients. I can say that it's a huge problem, because please imagine women that come with speech dysfunction or hearing dysfunction. They come to a doctor, and who do they come with? They come with children. They come with children that hear or are able to speak, and they need to provide a diagnosis to their mother. And let's imagine that the diagnosis is the cancer. It's a great burden for a kid. Of course, we talk about hospitals being obliged to provide the sign language interpreter, but for planned procedures. And if we have an emergency, how are they supposed to do it? Other thing, women with mobility dysfunction on a wheelchair. Do you think that there are many gynecologist offices with lifts? It's one in several thousands. Organizing gynecologists for women in a wheelchair is a huge challenge for the healthcare personnel, because they need someone to come with her to help to put this person on a chair. So we cannot allow that in 21st century. And how does it look like in other countries? What's the experience when we looked at this map of contraception? We are in the very end, just next to Hungary and Russia. So, in case of taking care of women with disabilities, do we also stay in the very end? I can tell you that we are at the very end of this list. That's very inappropriate. That's very, very sad. That's very unfortunate. We work in this area. We reach out to women from small villages, small towns, rural areas. And women tell us, they give us feedback, do something, because during workshops and debates, women underline that we need to implement some changes, to do something for women with disabilities. I've been hearing for that for 5 years. There were special ambulances organized by foundations going around the country. It seems to me that I've heard about it for the first time in like 2015. We have specific ambulances. And there are so few for people with disability on a wheelchair. When you talked about prophylaxis and prevention, we've lost a huge group of people. Please remember the regulations. When we had the act on health centers, we're supposed to promote health. We had health promoters, and it was obligation education of each hospital. When we had another act, this element was lost, and there is no education, there's no knowledge dissemination. This is performed by NGOs, associations, and organizations, which really focus on women's health. Just like us, during our events, during every event, we mention the aspect of health. We reach out to these women, and we are very happy to do so. So please listen to NGOs. Please listen what we want to say, because we're really next to those millions of women. Thank you. Before we proceed, I think you wanted to reply. Yes, I totally agree. I couldn't agree more. However, I think that something is really off. It's not the NGOs, foundations, or civil society that should be responsible for direct action, because we are working for the state. We are doing the work of the ministry. We substitute state structures, we substitute political structures and governmental structures. An NGO foundation is to monitor how the law is implemented, to look at the state's hands. And in our country, there's a paradox that NGOs or foundations is at the same time the executor of the obligations, is the service providers to provide direct assistance to women. This happens, for example, when the law is changed. We had decision of the Constitutional Tribunal. There was this premise of lethal dysfunction of the fetus for legal abortion. This happens from one day to another, and on the next day, in the morning, these were the NGOs and foundations that received phone calls from doctors, hospitals, patients, their families. What are we supposed to do? How do we proceed? So, of course, prevention and prophylaxis is extremely important, but prophylaxis is just education. In a way, we can shape the direction for education. We issue thousands of leaflets concerning health, prophylaxis, prevention, contraception. I think we are one of very few organizations that do it, because we perform sexual education, not only for young people, but also for parents who come and ask for help, because I don't know how to discuss those issues with my kids. Can we do it? They come on Saturdays, Sundays, they bring their children. But we are not able to do it by ourselves in such a huge scale. Of course, all the places are booked until the end of the year when it comes to sexual education workshops. One last sentence in the end. One of the main topics of Polish presidency is the mental health of children and adolescents. How do you imagine mental health without sexual education? At least 50% of different mental disorders are the result of lack of sexual education. It's the clash of young persons with internet and information found online. We know it from our own helpline and workshops. These are 12 or 13 years old. They have no place where they can balance and verify the knowledge they get from internet with reality. Thank you. Doctor, I just wanted to reply to what Member of Parliament said when it comes to assistance to victims of sexual violence. So if we should consider health of women, we need to be aware that sexual violence refers to women in every age, from childhood to seniority. So health safety in this area for women is connected also with prevention programs, prevention of sexual violence, sexual crime. Sexual violence can not only be limited to the role of penalizing the perpetrator, because the perpetrator just leaves the prison one day and he is still dangerous for women. The fiction, it's fiction, because we can call it fiction if we have sexual therapies in prisons or after they leave prisons. No one does it in Poland. Those preventive means for perpetrators just make them, just allow them to go around everywhere. They are just ticking bombs. These are perpetrators that can become dangerous for women in every age group. If we don't solve the problem of assisting the perpetrators, we will always deal with the fact that women will be threatened. Thank you so much. I think you wanted to say something shortly, because I have a long list of comments and I still have some other issues to address. When we talk about greatest problems, sometimes we might become super pessimistic because all those issues are so challenging. I wanted to refer to the problem of women with disabilities. Yes, we all often close this problem in a group of people with disabilities. So let's not address this problem this way. We had a helpline for people with disabilities and everyone with questions. And we're overwhelmed with a number of phone calls. I met a boyfriend, he's on wheelchair, we are before the date. What should I do when we'll go to bed or we'll have sex? I don't think there's any space with such an info. If we don't know anyone with a disability, we don't know how to deal with that. If we won't start educating people, if we don't start building bridges like basic sign language, we will never introduce any change. So I think there is a necessity of not only with dealing with needs of people with disabilities, but we need to work with the entire society, because we live with people with disabilities. And I hope we'll get more and more questions and it will become a topic of public debate. Thank you so much. Here we go. Thank you so much for inviting me. While I'm listening to all those subjects, I'm thinking, why do we talk about health safety of women? Women are humans, are people. As a cardiologist, I had lectures like women's heart because it's a bit smaller. But there is one striking thing, that women needed to prove that they have heart problem. In emergency room, people were saying she's hysterical on someone. So from what I understand, doctors focus on men, and someone needs to believe us that we are sick to start with. So let's talk about women as humans, not women as women. We are just beginning to address this topic. We talk about women with disability and people with disability. We are at the very beginning. We have no ambulances. We have architectural obstacles. There's one more disease, which is obesity, lack of bariatric ambulances. As a doctor, I'm very much interested in this topic, and I've noticed how blind I was as a doctor. That's my testimony. It's another aspect of the disease. It's not just weight and diet, although those aspects are critical, but those women do not have aspect to gynecologists, for example. If someone is obese, those women are not able to go to gynecologists, even though they are young, and they should have access to prophylaxis. We talk about it, and I think we are at the stage where we should be implementing romantic solutions already. However, in public space we talk about deregulation and we want to regulate it. So I think this kind of discrepancy. Should legislation regulate everything? Do we need legal provision for everything? If we have guidelines, if we can already implement it? And now let me help you, Senator, because I know that there is an area. Deregulation always refers to economy, but in medicine there is an area that needs to be deregulated.
Often you raise issues that definitely require necessary but long-term intervention. It's about education. It's about equipment, how to equip ambulances or offices, doctors' offices. But I have some simple ideas on how to increase health security. In the area of infertility, this is a topic that is of interest to me. So we have an outdated worldview. We said it before, that for some reasons we talk about medical procedures as if they were religious procedures. And there are a lot of emotions around the dialogue about medical products. In vitro fertilization was criticized because it was put into the basket of worldview disputes. And we were fighting for it, for making sure that in vitro can be talked about as if it was a medical procedure, which it is. And there's one more aspect. Access to keeping fertility for women without medical indications. So exactly what I mean is freezing egg cells of women who, for example, who aren't at risk of chemotherapy, who don't have any disease that would tell them they should do it, but simply for social reasons, mainly because of growing age in which women have their first child. So they want to keep their fertility for later stage because they expect it might be necessary. So do you know that now it's not legal? It's not available. You cannot just go if you have a husband or if you are in a partnership where both partners have this declaration of will. She can't go to a fertility clinic and even pay for it and freeze her egg cells for a while to keep her fertility for longer. Well, you can do it if you change the law, and it could be implemented quickly. But remember that the law has to be signed by the president. I know, but I feel that the social pressure and the fact that this is the campaign year, maybe that's even more difficult. Well, I have the impression it might be an interesting topic since we are talking about keeping fertility and the social discourse. If the social discourse goes in the direction of streamlining, making it easy, just like we did it with in vitro. So I think this is a possibility, but then there is another step for single women, maintaining fertility, prolonging fertility of single women. I'm thinking about changing the law. Let's adopt one good law. It's doable, it's possible, and I think it's a process that would reinforce health security of women, because now the state is interfering into how women want to realize their personal life. I know the arguments of opponents of prolonging fertility for single women, because a lonely woman cannot decide about how she wants to lead her life, because it is said, the opponents say it, that this will open doors for single-sex couples and for introducing the possibility of having a baby in such a couple. I'm a proponent of small steps, and maintaining fertility in women should be easy to implement. Well, thank you for this discussion. discussion. I have been listening to it with great interest because this shows you how many areas in Poland still need order and how important NGOs are and MPs are to keep this dialogue. Not excluding or actually thanking medical personnel for making this discussion possible. Okay, I'll ask your neighbor for taking the floor because Phil knows the topic of in vitro fertilization. We talked about it often, and you have your own experiences from England. And if you were to compare it to the Polish market, would you be able to compare the processes of changes that are happening with regard to health security in women? Maybe you could have some good examples or good practices.
Okay, well, I'll try.
Thank you, I appreciate it.
Just sort of by way of introduction, really, why am I here? The company I work for has been involved in IVF for decades. We were involved in the very first IVF baby back in England, and something like 50% of all babies born through IVF have come through our products. So, we know a little bit about the field.
Oh, yes.
We operate globally. Before I came to Poland, I actually myself managed the fertility business in the UK, working with clinics. And actually, over 20 years ago, I was also, with my wife, a patient. So I've also sort of got that sort of personal perspective as well. I think the first thing to say is congratulations. Because, and I know it wasn't easy coming, but now Poland has probably the most generous IVF program in Europe, which is a complete turnaround. Okay, so that's the first thing to say. It's a very positive thing. What I'd like to maybe just share is maybe some improvements or some recommendations and thoughts about how to take things further. We work obviously with clinics in Poland very closely, and just on the budget aspect, obviously the budget that's been put in place is generous, absolutely. Roughly speaking, it will fund 35,000 cycles of IVF every year. However, if you look at the benchmark, which is something like 1,500 cycles per million population, probably the true demand is around 60,000 cycles, sorry. Yeah. So maybe there will be a need to increase funding in the future. There are some problems that we're seeing in terms of how the funds flow through different clinics, because some clinics seem to not have a problem at all, and some seem to have a budget deficit. But what I would say is the feedback is still that patients are coming for consultation way too late. And why is that happening? One
Education.
Yeah, absolutely. And what I would like to make a point about here is that it's not the target of the education isn't just the people involved, the people who have the medical problem. It's also for society in general, because we're social animals. The IVF journey is incredibly stressful and emotional, and actually the way people react to you in society is also very important. So actually the education is for society as a whole, because there's still huge taboo about the subject. The other reason is a medical system reason, and definitely we see that referrals from gynecologists are not as efficient and effective as they could be, and definitely there's a need to look at pathway development and standards. And I think the other very important aspect is currently there isn't, let's say, an outcomes register of IVF procedures in Poland. For instance, in the UK, every clinic has to submit their data, so which is very important because the state is funding this. The state should be looking to make sure that they're getting the right delivery. Patients also need to have informed choice of, well, which clinic do I go to? Yeah. And of course, the other thing is it's important for research to understand, well, which procedures seem to be working better than others. So I would definitely say that that's another development that's important for Poland for the future. So for me, education, obviously there's issues around the funding flow and the healthcare system itself.
Thank you so much. Czyli Małgorzata, wygląda na to, że
Małgorzata, it looks like in vitro program that you are very much associated with and that you fought for. This is not a finished project, is it? No, it's not finished, but it was a great success for Poland. It was a really great success. And also we were able to point to certain priorities for the current term of office, very clear priorities. And I hope reproductive security was tied with the general vision of statehood. And I think we can still keep implementing other things. And like you said, Mr. CEO, it's a very rich budget program, but introducing these two changes would significantly improve birth rate in Poland, because more children are dying than are born. Yes, we have really very bad data. In 20 years, if we keep going like that, system of social security will fall apart. We will all have huge problems because of that. Not just those who are fighting for in vitro, who understand IVF, but this is very important from social point of view for the whole country. So it's so important for us to talk about infertility, about people who want to have kids in times when people don't want to have kids. So we should take care of them in particular, because they are going to be taking care of us in the future when we are retired. So I'm a mother of 3 kids, so my glass is half full. And I encourage you to follow. Let me comment on that, because you see how important it is to live healthily and our health security, prevention and prophylactics, because we have such a shrinking birth rate. It's really hard to answer to challenges.
I forgot to mention one really important statistic, actually, just supporting what was being said then. If the current fertility rate continues on the trend that it's at, then by 2100, the Polish population will be 30% lower. So, you know, that's a huge, and that's aside from the aging problem.
That's challenging. Actually, ale może to jest też tak, że
well, maybe we have a problem with planning family.
Jest tak czy nie?
Right? Just one more comment. It's not just about access to medical services. It's not just a matter of access to a doctor. There's a big role of politicians to be played. They need to create economic security. There is no reproduction, there is no growth if women, families do not have economic security. Tax system should be changed. I know nobody is going to change it overnight. It's not the right time to do it, but I think we need to change the approach to reproductive policy, extending our thinking about it. We shouldn't only think about it as the outcome, pregnancy, but outcome society. Yes, family planning. Maybe let me ask you, madam, is there a problem with planning a family? Because there's this thinking starts much earlier. Well, in Poland, there is no family planning at all. Oh, it's so bad. Yes, there is not a single institution that would be dealing with it. There are no centers for family planning that are in place in almost every European country. The only such center is our clinic, Federa Health Center, where we support women. What should it look like, madam? Well, it has to be a place where a woman can come in and find out how to prevent unwanted pregnancy, when to stop, when to discontinue contraception, what tests to do, when to get pregnant, so that she has all the data. And a woman comes to a gynecologist who is a gynecologist for everything. He's an obstetrician, oncologist, gynecologist who deals with pregnancy. But as regards family planning, he has like a minute or less. us to discuss. Are you done? Okay, then next, please. And that's the way it looks. There's no family planning. There are no centers for family planning. There are no such locations where you could obtain information. I will give the floor to you in a moment, Doctor. Minister Leszczyna mentioned it, didn't she? Yes, she did. And at the Ministry of Health, there is a committee called Health Security of Women, and this is where we talk about it. We are involved in the work of this committee, but for now, we are just talking. It's not what we should have. I worked in the administration, so I know how long these processes take. It's not as easy. Doctor? Oh, just one more comment. When it comes to family planning, imagine. Well, sure, economic security is incredibly important, but also health security is important. Many women today are afraid of getting pregnant. Why? They are afraid that if there are any complications, she will have to deliver a dead fetus or a baby who is critically ill. There are some guidelines, yes, but the guidelines are also apply to victims of sexual crimes. So, and gynecologists call us up and ask us, do you have Ella-1? Because she has to give it and she can't buy it. It's not available in hospitals. Let me comment on your answer. Why there is no family planning in Poland? Well, all political classes consciously destroyed the concept of family planning. Regardless, we have a political class here. I have to refer to 1989. In Poland, we have the transformation, social, political, economic transformation. But at that time in Poland, we had 49 centers, Society for Family Planning, they were called. And there were more than 16 centers, consulting centers for teenagers, all in all around 80 in Poland, such consultancies. And all of them were shut down. So it was shut down on purpose for different reasons. So building it now again, rebuilding this potential is terribly difficult. And on top of that, there is no political will in this direction to do something like that. So in the years to come, we will face different problems. So in each voivodeship, and now we have 16 voivodeships, and there is no single voivodeship consultant for sexuology, because voivodes, heads of voivodeships, are not interested in having such consultants. So how can you rebuild the foundations if you don't have such possibility at all? So for me, I'm pessimistic. Yes, I'm also thinking about human rights. Well, it sounded very negative. I need to comment. Yes, this is the way it is when we talk about health. We keep diagnosing, but I think we need some optimism. We have fantastic NGOs, fantastic women and men who are working on the gaps. The institutions that were dealing with family planning did disappear, but these are the times we are on a totally new level as a country. Everybody coming here from outside is thrilled by how we developed. Of course, good practices, we can implement them, sure, but as you said, as Małgorzata said, taking small steps. It's also about education. Education has been neglected. We don't know who's supposed to educate, and we have prevention experts who could do some, who could learn how to be pedagogues. But we have a plan. Today, we talked about sorry, they are talking over each other. Sorry. So, yes, HIV, syphilis, a lot of people simply don't see even these risks. So, but education should be in place. You can't divide a human being into parts. But for 18 years, we haven't been preparing for that. And we have optional subjects, and now we have to do something as politicians, doctors, to make sure these young kids want to learn this optional subject. How are they supposed to choose if they can't choose? If it's available for as an option, we should encourage them to use this option. We say that people have a choice, that they don't have to be forced to anything. Yes, but a doctor from your coalition was against that. What do you mean? What coalition? I don't want to point and blame, we all know why, but the element of education in schools is important. But if we see that this is a controversial topic, whether it's good or bad, it's up to you to decide. But for sure, I encourage you to stop demonizing the social media. The lady representing the foundation, she said that the social media were a really good place for education, and they are. And it's really, school is very important, but parents should be the most important, in fact. But whenever we feel the deficit in the families at school, because school again became a politicized place for sexual education. So really, focusing on valuable content in the social media would be like addressing the youth directly. This is the place where they consume content. Dr. Debko would challenge that. I think so, because I know his opinion. Yes, I would challenge that, because we have a very serious problem right now. The social media took over the consciousness of young people. They create a parallel world of young people where they function wonderfully, and they don't have the basic tool, namely, how do you differentiate good from bad? Unfortunately, the social media have a lot of bad things, and in order to find a reasonable information, concrete information, you really have to be well prepared for that. So in fact, we have a lot of pseudo authorities who are creating a lot of content and who are creating false content, and thus they are lost. Young people are lost. They go, they follow likes. So you can be the biggest idiot, have a lot of likes, and right away people will follow. Doctor, it's like if you were offended by the reality. Our grandfathers say that if TV comes in, it will ruin our brains and our head, and sort of it happened. Maybe it did.
But the world is progressing, so we can keep on thinking that it's another medium that is changing the consumption of knowledge about the world. But this is what it is. This is the reality that we need to face. So if we, in the internet, if have those people claiming to be knowledgeable, it's more and more important so that medicians, doctors, physicians are always also there in social media, despite all just passive observing that we are flooded with stupidity, leaves people helpless. I will give you the floor shortly, but let me add that Minister Leszczyna, while presenting the priorities of Poland in Brussels, she said that there is a negative impact of social media. We need to discuss about prophylaxis and healthy lifestyle. We are working on some solutions. So Ministry of Health notices that. Michał Janczura recently, when he published his article, he discussed this medical misinformation as well. MPN, then we have 3 minutes. The priorities of our presidency. Cybersecurity is one of the priorities. In this framework, the ministry that deals with that will work on misinformation online. I've said today that the issue will face health and money, so who's going to pay for that? Same with social media. All those influencers, they make money on that. They will not make money on proper knowledge. They they benefit from misinformation. I'm an influencer. It's not. Can I finish, please? Thank you. This is the issue of the fact that there are many people that benefit from supplements. There are influencers that make money from explaining people that if they take vitamin C, they will be healthy. So there's a lot of money made from this information. But when we talk about education of young people, I think this is the obligation of school, and this is one of the objectives of our president, is to verify where young people should get information from, also from social media. It's important so young people use information from influencers that do have the competencies and knowledge. And just one sentence. Yesterday, there was an information from about two gynecologists that were influencers that were saying that when we talk about sex, the consent is nothing cool. Because women should consent every time, because that's for the health of their husband. It was not a secret. It was Mama Gynecolog, that's her name. So this is ridiculous. MP, let's pass the floor on. So let's verify the info. I pass the floor to Brussels, because we've been discussing about priorities of the presidency. So, Director, maybe.
Thank you. Just on misinformation and information, and going back to state human rights obligations, these are very clear. It's about ensuring access to education on sexual and reproductive health care in schools, in public as well as addressing and ensuring access to evidence-based information on reproductive health care, as well as addressing misinformation, including in online spaces on reproductive health. I want to briefly just say, when we speak about women's health security, I think we also have to talk about abortion care and restrictive laws. And as we know, restrictive abortion laws inflict great harm on women. They, not just on their physical, mental, and emotional health, but they also threaten their lives. And Poland is an example of that. Poland is just one of 2 countries in the European Union that have restrictive abortion laws, meaning they do not allow abortion on request. Legalizing abortion turns illegal abortions to legal abortions. It enables women who are forced by restrictive laws to travel abroad to other countries to have access to legal abortions, to have abortions and abortion care and being taken care of in their home country. This is important for ensuring women's health security inside of our countries.
And we absolutely are aware of that, here in Poland especially. Panie prezesie, bardzo proszę i drodzy państwo, bo ja będę miała
President, the floor is yours, and then we need to finish. The floor is yours. The last man about women's health.
I just wanted to say that part of the reason that we're in such a mess as a world is that it's not just children that can't define what's true and not online, but
adults.
and actually, you know, if we can educate kids on how to properly use social media, maybe they can help us.
Yes, that's a good approach. Bardzo dziękuję.
Thank you so much, ladies and gentlemen. It was pleasure. I wanted to ask one question, one last question, so I was happy that you have raised your hand. So what is the role of men in taking care of women? But I think it's a challenge for another debate. Or maybe we can reverse this question. However, I have one question only, short. Małgorzata, how are you planning to implement those three regulations? I'm planning to stay in touch with people that have the will and legal instruments to implement such a change. You have also mentioned the commission that was created, let's say, several days ago. So you want to put this topic to Mr. Brzoska, who was indicated by the Prime Minister as a person responsible for this issue. And I think that understanding of the shortcut, which is typical for business to solve some political problems, is surely needed in this case. But I wanted to refer to this previous statement. I don't want to borrow. I don't want to be. I want to just add one thing about social media. We know how many threats there are in social media. Everyone is aware of that. But it's not that it's only negative. Moreover, for our kids, it's the main source of information about health. And we should all look at this place with understanding that this revolution has already taken place. ChatGPT is a new browser, but we have tools. Everyone has an account in social media. But, Senator, I don't know how many of those active accounts are there. 8 million. But we need to do something. We need to do something. I'm a great fan of all the solutions. When we talk about health, everyone's saying there's no money, there's no money. Enter IKP and check how much your visit costed. And then you'll be aware that even if you pay several hundred zloty a month, then you suddenly need 1 million zloty. So that gives another shade. So thank you so much for this discussion. I can see Carolina and Robert are waiting. Thank you so much. Adriana Lamaczkowa, Krystyna Kacpura, President Filip Cyzak, Dyrektor Mark Polska, Anita Kucharska-Dziedzic, Małgorzata Rozenek-Majdan, Wiesława Rybicka-Bogusz, Martyna Wyżykowska i Karolina Eterek-Prosiecka.
Dziękujemy bardzo. Widzimy, że tutaj dużo jest kuluarowych rozmów, więc
discussions, a lot of topics
na widownię, tym bardziej,
so
przed nami
please take your
ostatni
seats. We are
również
ahead
bardzo wartościowy
of the last
panel.
very
Plany dla
valuable
zdrowia
panel.
Europy, czy Europejski plan walki z rakiem, o którym wszyscy świetnie wiemy i znamy go, powinien być inspiracją dla powstania podobnych planów w poszczególnych dziedzinach medycyny.
In different sections of medicine. So we have two keynote speeches ahead of us. The first one is Professor Jacek Jasem, Head of Department of Oncology and Radiation Therapy, Medical University of Gdańsk. The floor is yours.
Dziękuję bardzo za zaproszenie na konferencję. Jestem zaszczycony.
Thank you so much for inviting me to this conference. I've been here since the morning and I'm so much interested in those discussions. They were so interesting. Let's allow everyone to take the floor.
Dajmy głos naszemu keynote speakerowi, profesorowi.
Pass the floor to Professor Jasson, once again, good morning. Thank you so much for inviting me. I'm an oncologist, and I'm going to talk about the European cancer, beating cancer plan. I participated in the preparation of this program. I was also part of the scientific part, Mission Cancer, as one of the advisors. And today, I would like to reply to the question if it should be inspiration for similar plans in other fields of medicine. Ladies and gentlemen, we've mentioned in the morning the Europe's Beating Cancer Plan in the context of today's debate. Just 2 words about it. In 2021, it was presented, and the target was to reduce by 2025 70% cure rate for cancer. And I think it's pretty realistic. Why cancer? Because 3.5 million cases, 1.3 million deaths, increase in incidence. In 2040, we'll have more deaths from cancer than cardiovascular. Great cost, great inequalities. Fighting inequalities is one of the objectives, and of course, cancer is an example of a disease where prevention and prophylaxis is super effective. So here, with our behavior and proper health policy, we can do a lot. And of course, when we talk about cancer, everyone's afraid of cancer. So if we talk cancer, we have to do something about cancer. This social support and political support is pretty large. 4 pillars of the plan. 4 plans, pillars, very logical. There's no much philosophy. Prevention, early diagnosis and detection, better treatment, and improving quality of life, recovering of patients, reintegration, quality of life, and things like that. So to anticipate the next steps, I think I can show them during those 8 minutes. Please understand, if those 4 pillars, they do not fit to all the other diseases. I think a disease is an incident in your life with a beginning and the end. There's life before the illness, during the illness, and after the illness. In oncology, sometimes it turns out well, sometimes it doesn't turn out well, and we always need to remember that once we would try to enjoy our life, be without the disease, want to get back to our work, family, society. Many people think that if they have a cancer, there's nothing is going to happen in our life. Nothing good is expecting us. It's not only those 4 pillars, because apart from that, we had several projects like European Network, Horizon Europe, European Cancer Database, use of artificial intelligence, of course, European Network of Digital Cancer Centers. So creating common database, which has a great impact. Ladies and gentlemen, cancer, because today we've said, I think Professor Banach said, why cancer? Because cardiovascular disease. Professor Stępińska is also with us. Why cancer? I told you why cancer. Because we need to start with something. And someone says that it should be a cardiovascular disease or some other disease. I will tell you, it's like treating leg or hand. All diseases are important. And we can't choose our disease or illness. All the diseases, all the illnesses are significant. From the perspective of every patient, his disease is most important. As a doctor, I can tell you that for me, all the illnesses are equally significant. However, we can imagine that such plans
mogą powstać, ale powinny powstać. I Unia
not
prowadzi
only
również pewne działania. Może nie są to
should be
działania tak
created, but must be
usystematyzowane jak w
created.
odniesieniu
Maybe
do
not
nowotworów,
as
ale na
systematized
przykład
as in case
choroby
of
rzadkie,
cancer,
zdrowie
but
psychiczne
rare
czy choroby
diseases,
zakaźne.
mental health, or
Mieliśmy zresztą niedawno
communicable
przykład
diseases.
bardzo dobrego,
They are very well
skoordynowanego
managed
działania w
on
czasie
European level.
To,
For
że
example,
szczepionki
during COVID,
kupiła Unia
the fact
dla
that
wszystkich krajów
vaccines
członkowskich,
were purchased by
uratowało,
Union
myślę,
for all the
bardzo wiele
patients, I think
ludzi.
it saved a lot of people.
I jeśli będziemy mówili,
Once again,
co jest
if
wspólnego
we
i co można
discuss what we
naśladować,
have in common,
kompleksowe
what can be
podejście,
copied, comprehensive approach, prophylaxis, diagnostics and support,
każda choroba.
like in every disease, coordination of research, financing and innovation.
No, trzeba trochę zainwestować.
I think we should invest a little
No i
bit.
oczywiście
And of course,
te wszystkie duże
all those
choroby
big
mają
diseases
bardzo
have
duży wpływ na
great
systemy ochrony
impact
zdrowia
on the
we wszystkich
healthcare
krajach. One czasem są tymi
budget in
lokomotywami dla ochrony zdrowia.
every country.
Teraz, proszę Państwa, moja subiektywna
And now
lista
my subjective
chorób,
list
o których możemy
of
mówić.
diseases that we should
Proszę nie
discuss.
traktować tej listy jako
Please do not
listy
treat it
zamkniętej,
as a
bo
closed
zaraz
list,
być może są jakieś
because
osoby w sali
there might be
reprezentujące
people
inne
over
dziedziny
here that
medycyny i powiedzą,
represent
ale to
other
też jest
areas of
ważne.
medicine, and they
Muszę
will
się
say
do
this
jednej
is
rzeczy
important as
przyznać.
well. I need to admit one
Przewlekłe
thing.
choroby płuc kazała mi dopisać żona i rzeczywiście to
My
było moje
wife told me
przeoczenie.
to add
Jak
chronic
ty
lung
mogłeś nie
disease.
wpisać
She told me,
PHP tutaj,
how could you have
który jest
forgotten
ogromnym
about
problemem?
chronic
Ma
lung
rację,
diseases? It's a
dopisałem.
huge problem.
I
So I
tutaj
have added
krótko
that.
napisałem, dlaczego
And I
uważam,
have
że te
shortly
choroby,
stated
jakie są
why these
argumenty,
diseases are important.
żeby
What are
takie
the
plany
arguments
tworzyć.
to create such plans?
Korzyści, lepsza
The
koordynacja,
benefits, better
większa
coordination,
skuteczność profilaktyki,
better effective
korzyści
prevention,
ekonomiczne,
economic
wsparcie dla
benefits,
innowacji,
support for
zmniejszenie
innovation,
nierówności,
reducing
gotowość na
health
przyszłe
inequalities,
kryzysy.
and
Ale są
preparedness for
i
future
bariery.
crises.
Są
But there are
różnice
also
w
some
systemach
barriers,
ochrony zdrowia, jak Państwo
differences
wiedzą,
in healthcare
to nie jest
systems.
przedmiotem
As you
unijnej
know, this
wspólnej
is not the
polityki.
subject of common
Koszty
EU policy.
długoterminowe to nie jest
Cost,
to, że się
long-term
zainwestuje i
financing,
to
it's
się
not that you
będzie toczyło.
invest
To
and then
to
it's
trzeba
going.
też policzyć, ile to będzie
So
kosztowało.
we need to calculate how
Koordynacja
much it's
między
going to
politykami
be,
na poziomie
coordination
krajowym
between
i
policies at national
Podsumowując,
and EU level.
Europejski
To sum
plan
up,
walki z rakiem to
European
przykład
Cancer Plan is an
skutecznej
example of
strategii. Już
successful
mamy tego efekty.
health
Potrzebne
strategy.
są podobne
We
plany.
need similar
W innych
plans in
dziedzinach
other
Unia
fields of
Europejska
medicine,
powinna
and European
dążyć do
Union should
stworzenia
strive to create
kompleksowej
a comprehensive
polityki
health policy
obejmującej różne
covering different
obszary.
areas. I've made it in 8 minutes. Thank you so much.
50 lat praktyki
50 years
dydaktycznej.
of pedagogical didactic practice.
Dziękujemy bardzo,
Thank you very much, Professor. And this is the last keynote speech. Professor Esther Trost from radiotherapy and radio oncology at the University of Dresden. And she prepared a recording for us. She wasn't able to join us online, but we have her presentation on video. Szanowni Państwo, przedstawiciele polityki, drodzy koledzy, koleżanki, przyjaciele.
The aspects of radiation oncology linked to the European Health Plan. My name is Esther Trost. I'm chair of the Department of Radiotherapy in Dresden and also dean of the Faculty of Medicine. As you know, Europe's Beating Cancer Plan has a lot of things it strives for. First of all, and I think also very importantly, comprehensive quality cancer care for all. This means multi-professional care needs to be put into action. We need to enhance the delivery of comprehensive cancer care as a goal. Furthermore, unlocking the potential of digital for cancer care is of importance, as well as equal access for all patients in Europe. Europe wants to also enforce the oncology workforce, which is currently in crisis. So we need to have more highly qualified experts in the field. And last but not least, the healthcare systems and the treatment that is delivered needs to be optimized for patients. I'm a radiation oncologist, as I said, and for me, radiation oncology is therefore also one of the most important parts, and it is indeed one of the core pillars of modern oncological treatment, apart from surgery and systemic therapy, including chemotherapy or immunotherapy. Approximately 50% of all patients with cancer will be treated with radiation therapy during the course of their disease. 50% of those patients will receive this form of treatment with a curative intent, so we want to cure the patient. And 50% of the patient receives radiation oncology in part of the palliative care, for instance, to take away symptoms of pain or bleeding. Radiotherapy is a non-invasive outpatient treatment. It can obviously also be given inpatiently, but most patients really receive it outpatiently. It is accompanied with fewer side effects compared to a lot of other treatment modalities, and it is delivered in 1 up to 35 treatment fractions. So this is, let's say, a modest form of downside. 1 to approximately 10 fractions of treatment are given to patients treated with palliative intent, and we go for more treatment fractions in a curative intent because we want to reduce the side effects of patients. Radiotherapy has come a long way. In 1895, with the discovery of Röntgenstrahlung et al., you see it was still not known what treatment side effects it could have for those healthcare deliverers. And it was first used in also as curative intent in benign lesions, as you can see in a publication from 1897. And this lady survived the treatment, but has had scars afterwards. And it also has been used for treatment of squamous cell carcinomas, for instance, of the nose. This was all putting the beam on what we wanted to irradiate without any form of treatment planning. The modern treatment equipment that we have in Dresden looks slightly different nowadays. So most of the patients treated worldwide are treated with a photon form of treatment. So photon beams directed to the target that we want to irradiate. And there is also an increasing interest in proton beam therapy, of which we also have one of the machines in Dresden, but I'm going to concentrate on photon treatment as depicted on the left side for this talk. We have come a long way also in the sense of treatment planning. In 2000, 2005, and also obviously in the 80s and 90s, a lot of cancer patients were treated based on a two-dimensional treatment plan. You can see an X-ray image on the left, and on this X-ray image, the treatment fields were really delineated, and with beams and also with multi-leaf collimators that reduced the beams to the angles that we wanted to use, this head and neck cancer patient was treated with curative intent, and we treated a lot of people really to cure them, and we also succeeded in curing them. Nowadays, we produce a three-dimensional representation of the patient prior to having the treatment plan calculated. This is done on the so-called computed tomography or CT scan. You can see a transverse image of the lower bit of the jaw on the down right side, and also the view from the right side of a patient, a so-called sagittal view of a dose distribution. So there's a lot of effort now taken on board when delineating what we want to irradiate and also what does not need to be irradiated. And for the last, the so-called organs at risk, artificial intelligence is moving into play at the moment. Apart from the two-dimensional to an intensity modulated technique, we've also seen different other treatment modalities striving, and this is the so-called stereotactic radiotherapy of very small lesions. One of them, a benign disease in the brain, a meningioma, which is very close to the brainstem, and another one on the right-hand side, a lung tumor. And stereotactic form, which means that we deliver the treatment in 1 to maybe 5 fractions, and that we give a high radiation dose per treatment fraction. And this is only possible because we use multiple beams that concentrate on this one area, so giving a very low dose bath to the remaining tissue and a very high dose to the area that we want to irradiate. Because we have this 3D representation of a patient, we have to make sure that the patient is also aligned accurately prior to every treatment fraction. This is mostly done with cone beam CT. So this is a computed tomography that is composed with a so-called fan technique, so the cone beam technique. And we have a 3D representation prior to every fraction. And we are proud that we've been the first, just very recently, that were able to introduce a novel technique called IRIS that has been supported by Electa. It's AI enhanced, so artificial intelligence enhanced, and it really makes cone-beam CT imaging so much easier. You see a representation of a pelvis patient, so a male patient with a pelvic tumor on the upper image, and you see that a lot of the soft tissues are very well visible after the reconstruction with IRIS. So we are very happy that we have been the first center worldwide able to introduce this to our patients. But soft tissues are always very challenging for radiotherapy, and so we are also moving forward to finding other solutions for soft tissue tumors. Is it a problem? Well, yes, 60% of the tumors that we treat with radiotherapy originate from soft tissues, and most of them also move. And we know that by the increasing the radiation dose per fraction, so having this stereotactic technique or hypofractionated technique, we can increase the biological effectiveness of radiotherapy. And lastly, it would be great if we were not only able to account for different anatomy prior to every treatment fraction, but also because some of the organs at risk can also move and also some of the tumors can move, that we can look into this in real time. And this all is not possible with cone-beam CT that I just showed you, because it's based on radiation, Röntgenstrahlung, which also gives another layer of dose to the patient. So photon linear accelerators integrated with magnetic resonance imaging is the way forward. They combine excellent high-resolution soft tissue contrast with real-time imaging, and they do not have any additional radiation dose. And therefore, these so-called MR-Linacs enable individualized, image-guided, daily adapted high-precision radiotherapy of complex and moving targets. We have been very fortunate to be able to introduce one of those machines in June 2022 in our department in Dresden, funded by EU funding, and it combines a 1.5 Tesla MRI scanner, which has been very elegantly combined with a 7 MV photon linear accelerator, and we've been treating many patients very successfully since. The first patient I just want to share with you was a patient, again, with a pelvis. So you were just introduced to the concept of cone-beam CT and pelvis. But here you have this almost same view of a male pelvis with the bladder depicted with the letter B, the endorectum with the letter E, and also the area that we wanted to irradiate. This was a recurrent disease of a prostate tumor in red. And you can appreciate that it's very well visible also on the soft tissue imaging, which is the right image, MRI image with no additional radiation dose. And we were able to daily adapt the treatment plan because this patient had already been irradiated and we did not have very much dose left. So we were able to, as you can see here, very nicely spare the pre-irradiated area. This is again the bladder at the front and the rectum at the back side of the irradiated area, as well as the two hips on the very lateral sides depicted in light blue. And you see the representation. This is what we as radiation oncologists really image and accurately monitor during the course of treatment. So why radiotherapy? I hope you are as enthusiastic as I am. It's an ever-improving pillar of high-precision treatment of oncological patients. With the technological developments which we have seen, so integration of IRIS AI, but also cone-beam CT and MR scanning on the day of treatment and at the moment of treatment, we are able to efficiently and safely deliver the treatments that we want to give to our patients. It is highly cost effective and it facilitates the treatment access of the patients. We need a highly educated multidisciplinary team for this. And last but not least, digitization and international collaboration is what we strive for as a community. So with this, I thank you very much for your attention and I'm happy to take any of your questions.
Bardzo dziękujemy pani profesor.
Madam Professor, thank you very much. And now we will have a panel, and let me invite Milena Angelowa, Professor Urszula Demkow, Professor Marzena Dominiak. Please take your seats, just leave one spare place in the middle. Professor Bartosz Karaszewski, Professor Brygida Kwiatkowska. I am reading in alphabetical order, President Stanisław Maćkowiak, and Dr. Marek Mignał, Professor Konrad Rejdak, Professor Janina Stępińska, and Madam Professor Elizabeta Zanon. Well, because of the fact that Professor Jasem had his keynote speech, I'd like to ask you to stay here because we need to keep one seat free. We're waiting for a surprise, and we are starting a panel entitled Plans for Europe's Health. Should Europe's Beating Cancer plan serve as inspiration for developing similar strategies in other areas of medicine? Professor Jasem, his wonderful presentation made my task easy because he showed the plans that could have been implemented as continuation of this idea, namely that the European Union is working out a recipe for success, evidence-based, vetted, like Europe's Beating Cancer plan, and the countries are implementing it because it's not interfering in the policies of the countries. But indeed, this would be an inspiration. So let's think about this in our group, inspired by Professor Jasem's slide. What are the next plans? What could be the next plans in other areas of medicine? Because we heard about oncology. The positive side is that if such a plan is implemented, then we have national cancer profiles where you can make comparisons, 5-year survival, and other indicators. So let me start with Professor Brygida Kwiatkowska. Madam, there is this document entitled EULAR Manifesto, and this was ground for discussion whether the EU should have such a plan for rheumatic diseases. 3 minutes. I'll try, as always. Well, why was such a manifesto developed? The number of rheumatic diseases, especially inflammatory rheumatic and non-inflammatory diseases, such as osteoporosis, because of aging society and a lot of autoimmune diseases, this is going to be a logistical problem for healthcare system. This is going to be something that we will have to carry with us, and we will have to face it, and as we have less and less doctors across the EU. So that's why we developed the manifesto, to develop a plan for prevention of what's going to happen in 10 or 15 years, when we will not be able to deal with it. In Poland, we have a sectoral view, but as regards those my diseases, we follow oncologists where financing is always bigger. And a pilot project, comprehensive care of early arthritis, has already started because our diseases generate an increased risk of cancer. For example, if you have lung disease, you have increased lung tumor, risk of lung cancer. So it's really important to detect rheumatoidal diseases, vascular diseases. Inflammatory process is one of the factors that accelerate certain venous problems. So the risks really increase. And all that is intertwined. That is why you need to work out a good preventive strategy for diseases where we can implement such preventive strategies. For example, osteoporosis, early detection, right treatment, which we don't have. So 80% of osteoporotic cases remain undiscovered. It's only discovered when there's a fracture. So a holistic approach is also important. So such a comprehensive approach and guidelines comparing to DILOS card, early diagnostics, comprehensive approach with interdisciplinary approach. It will help us with the future tsunami of the avalanche of diseases. And I am looking at the last Lancet publication publication where I summed up adverse effects of GLP-1 analog inhibitors, and the risk of pancreatitis is 43%, and increased risk of joint inflammation. So it might have implications also for other complications. So to sum up, it would be good if the European Union thought about a structured plan on how to be successful, to diagnose, to successfully treat and slow down the progress of autoimmune diseases and rheumatological. Yes, most of all early detection, because it's a problem across Europe. 2, good treatment so that the patients can keep working and take care of themselves so that they don't burden the family with care. It also applies to both older and younger patients with rheumatoid diseases. And comorbidities shouldn't spread, so vascular diseases and cancer, because if you treat well, then these comorbidities occur later. Moving on to the next area, a creation of such a plan, European Beating Cancer Plan, is justified for brain diseases. And gentlemen, you made it easy for me, because not long ago we have a summit about it. So let me start with Professor Redak, who was the initiator of that summit. So, Professor, in the European Union, should the European Union have a plan for brain health?
So, for sure, yes. As neurologists, we are very much striving to have it. We are so happy with the activities of the European Academy of Neurology. There is a strong group of experts, people who create such a plan. Of course, we are aware of this diversity of problems, challenges in different countries. So when I talked with Professor Claudio Bassetti, who is a European leader, he's a dean of the medical department at the University of Bern, person that fulfilled the function of the president of the European Academy of Neurology. And maybe we won't be able to create this one plan, formulate this only one plan, because neurology is a very wide field. It has a list of diseases that impacts 1/3 or 1/4 of society. A lot of us suffer from different problems of neurology. There is a roadmap created when we focus on the pillars such as medical assistance, medical care, and everything, and prophylaxis as the first aspect, but also scientific research. There is a lack of resources when we compare different grants or scholarships, and neurology is not the leader in the financing. And we know that a decade of brain from years ago brought revolutionary progress in neurology. Thanks to this decade, it was a program financed by US government. This is when we get a great progress, for example, in rare diseases. So this is also one of the postulates. But I'm happy that during the Polish presidency we have managed to organize this summit with the presence of representatives of the Ministry of Health and also the minister. So that shows that there is a great interest in that, and we can proceed to formulating activities together with Professor Karaszewski, national consultant. We are strengthening this cooperation, and we want to create a plan including also psychiatrists and children's neurologists, because such a plan was created when it comes to epilepsy. So it's an example that systematizing actions in the EU diagnostics, access to treatment of epilepsy, showing its social dimension, is a direction that prepared some actions when it comes to a plan for healthy brain. Epilepsy is a disease which has great social impact. There is a number of challenges and social aspects related to that, and there are such plans because that also concerns different age groups, starting from newborns until including also seniors. There can be epilepsy seizures and epilepsy diagnosis. In every country we have different challenges. In Poland we have insufficient surgery treatment of epilepsy. It looks quite well when it comes to access to different therapies, but of course there are constantly challenges. New drugs and drug resistance at the level of 30% is still a problem, and we need individually address patients with very well adjusted drugs. Bartosz Karaszewski, brain program at the level of the EU. I'm so happy that Professor Rejdak presented what we are jointly working on, and we hope that this plan will be implemented. It was implemented in 2 countries so far. Let me present a general comment, because I represent the Committee of Clinical Science, also in the context of many statements that we have heard today. Ladies and gentlemen, this is my main work. I work individually with patients, and in this space, as Professor Jason said, every disease is equally important. There's no more important disease or more important patient, but in the area of policy, health policy, creating this policy, priorities are very important as long as we have limited resources. So creating priorities is indispensable. The stance of the Committee of Clinical Sciences indicates disciplines or areas which in media and social areas are not addressed proportionally to their impact in medicine based on facts. So I would dream about a report that would actually formulate social burden of different health problems. This might be, for example, brain strokes or neurodegenerative diseases, and also it should be supplemented by tools that we have in order to limit or mitigate this burden. Do we have such tools? So if we would have such scientific dissertation, then the decisions would be much easier, because let me repeat once again. The starting point to this statement, we have 2 spaces in health policy, either chaos related to lobbying, positive lobbying, because we know that patient organizations should do it, and they do it well. They should lobby for creating therapies, reimbursement of therapies, and coordinating treatments, but that also implements chaos, and some communities that are not able to take care of themselves, like patients with stroke, would not be as effective. So including mathematics to creating policies, health policies, that would be crucial, and then the decisions would be taken on the basis of more systemic data.
Bardzo dziękuję, panie profesorze.
So much, professor.
Na slajdzie pana profesora
on the
Jasema było również
on
plan
Professor
na rzecz
Jasem's slide, there was a
zdrowia
plan
dzieci.
for
Cokolwiek by to nie znaczyło,
children's
może to
health.
rozszyfruje pan
Maybe
dr Marek
Dr.
Migdał,
Marek Migdał
dyrektor
would
Instytutu
decipher
Pomnik
that.
Centrum Zdrowia Dziecka, no naszej
Director of the
wizytówki na Europę i
Institute
świat
of
i
Children's Health.
chwalimy się
We
tym miejscem,
often
bo rzeczywiście tam
present this place
osiągano
because this is
znakomite
where we
wyniki
achieve great
leczenia
results
dzieci.
when it
Bardzo
comes
proszę.
to treatment of children. The floor is yours.
Szanowni Państwo,
Ladies and gentlemen,
zacznę od komplementów.
let me start with compliments
Pod adresem pani
to
minister Dębów,
Minister
która tutaj
Dębkow,
siedzi. I
who
nie
is
dlatego,
here,
bo czasami
and
dyskutujemy
not,
i różnimy się
we
w
often have different
ale
opinions,
na przykładzie naszego instytutu,
but at the example of our institute, which, as you said, the biggest pediatrician hospital, the biggest children's hospital, we are in the network of European hospitals. We are the Association of Children's Hospitals in the US. And on our eyes, we can implement what we've been discussing for years, the national plan for rare diseases. Please remember that in our institute, you can see all the problems related with rare diseases. 70% of diseases which are classified as rare start in newborns or in children.
I to, co się wydarzyło, bardzo
and what has
ważnego,
happened for
po latach dyskusji,
that after years of
w
discussions,
różnych panelach mówiono, przyszliśmy do konkretów.
we have
Nagle okazuje się,
proceeded
że
to
dzięki
concrete.
wprowadzeniu
So, thanks to
finansowania,
implementation of financing
poprzez wprowadzenie
through
kodów ORFA,
adding ORFAM codes for patients, for ambulatory patients, 36% of our oncology patients have ORFA codes. That generates statistical data. In around 1 week, since the 1st of March, we will start having financing for patients during hospitalization, which was critical because we know that currently diagnostics and treatment of rare diseases starts with molecular tests, large-scale tests, which until now, unfortunately, were not implemented in children, and now we have very good financing, and we treated some comments to the minister, so and it suddenly turns out that we can finance some of the diagnostic which was impossible before, and it will be very well assessed. When it comes to prices, I want to use the example of our institute and the Polish system of treatment of rare diseases that we need centralization. The fact that we are the only unit that transplants liver and kidneys in children causes that we are one of two biggest units or such entities in the world, and that translates into experience and possibility of conducting research that will change treatment in the future. So to end up, I just want to say that in pediatrics, we need to have interdisciplinary approach and adding the possibility of modern diagnostic methods, including genetics. And we have such experience that we can even transmit to Europe. Let me ask about two things. How many units from ERN you have in your institute, and which are the fields where we are leaders? Which field of children treatment? Transplant child, so dealing with transplantology. There we have a register which is called Peter. Piotr Kaliszyński, head of our clinic, is laughing that it is because of his name. It's the acronym of pediatric transplantology. Thanks to participation in the networks of reference network. Last year we talked about it, and there is a necessity of increasing the share of Poland in this network. Our Twin Hospital in Barcelona has 37 networks. We have 7. Colleagues have 2. So we should be more active because it's a fantastic possibility of exchanging experiences. It has nothing to do with international movement of patients. It just abolishes barriers when it comes to access to specialized medicine between the countries of the European Union. Thank you so much, Doctor. Congratulations on the last investment. We saw in the media the psychology, oncology center, so we fully recommend visiting this center. The director is a great host, hopefully not as a patient, but you can make an arrangement and see how children can be treated in Poland. President Stanisław Maćkowiak, Director, and Dr. Migdał talked about rare diseases. The President has been addressing the European plan for rare diseases. Is it becoming realistic? Is it feasible? I think it is. Ladies and gentlemen, let me be specific, so I have prepared some data. Historical data. So it all started in Europe in 1999 through regulation number 141 of the European Union and Council concerning rare diseases. Then the next legal act is 8th of June 2009, recommendation of Council of Europe for rare diseases. It was a recommendation of the member states to build strategy or plan, national plans in all the EU countries. Such a plan was developed to copy-paste those solutions in the member states to build a strategy. It was in 2009. After a decade, this thinking has changed, and in 2020, resolution of the EU Parliament calls for elaborating EU action plans. So we go from national solutions towards international solutions. In the same spirit, we have created the next, we've dealt during the next presidencies of France, Czech Republic, and Sweden, when they offered creating platform for rare diseases in Europe. The next document, European Social Economic Committee calls for publishing a plan for rare diseases in order to define specific goals. Next actions is the list of MPs to the President of the European Commission, signed by 86 MPs, including MP Jarubas and MP Kopacz. And the next actions at the level of Czech Republic, so building call for action, so European ready-made solution concerning European plan for rare diseases. Next actions, next presidencies, Hungarian presidency, including Minister Denkov, and the action towards execution of those EU solutions as solutions that will provide us with an opportunity to create a plan for rare diseases and to be implemented in all the countries. And I hope that the follow-up, our actions of our presidency, 11th of April, Minister will tell you a bit more about it. So those will be steps to execute this goal. Poland has a plan for rare diseases, right? This is the second edition, 2024-2025. This is an argument why Poland in its presidency should push for such plan on EU level. Yes, for sure, because we have partial plan, which does not cover all the actions. That's why it's justified that those solutions that are managed on EU level to be implemented also in Poland, and there's such a declaration on the side of our ministry that we will go into this direction and will work on those solutions. Professor, would you like to comment? Minister, would you like to comment on rare diseases plan? Should Poland, in the framework of the presidency, initiate such work to develop and adopt European rare diseases plan? And this plan already exists. We contribute to this work, this development, and I think it's critical in rare diseases so that our European efforts are merged, because rare diseases are rare. So if in our country we have 10 patients for given disease, in Germany 20 patients, in France 15 patients, then only total of those patients allow us to gain some more knowledge about these diseases. We know more about the course, about the history of treatment, about efficacy of drugs, the prognosis, and I think it's critical here to merge those efforts, national efforts, with EU efforts, and this is what is happening. We constantly try to get involved in EU works and EU actions, and also conduct our plans. We implement the plan, as the previous speaker said, Director Migdał and Mr. Stasiak Maćkowiak mentioned. Thank you for that. Thank you for your words. We create a team which is working and implementing this plan. What I wanted to say, and what I think is critical here, and I'm sure Minister Kasia Kasperczyk, that is smiling, will confirm that it's important that Europe goes together. It's not only about rare diseases or cancer or neurological diseases or cardiological diseases. It's about health. It's about acting together, because together we're stronger. If we look at current world and politics, we see how much we need strong and united Europe. We have EU for Health plan, and this is where we want to get involved in all this action in order to jointly with Europe build strong Union for Health that will allow us to jointly exchange experiences, unify our actions, conquer barriers and limitations, ethical and legal ones, and also conquer problems related with different healthcare systems which are different in Europe. Another very good and required and necessary tool would be European Health Data Space, so digital space which will be created in the EU, will be sharing data with each other, data concerning health. Each country will be acting in that space,
and they will be able to use the data, of course ensuring the right legislation and the right security procedures. I don't have any more time, but I think there are going to be a lot of other meetings, and Minister Kacperczyk is talking a lot about that because she's responsible for it. So rare diseases are really important. National cancer plan is also terribly important because 25% of cancer cases in the world, these are cases in Europe. Even though we only have 1/10 of the world population, we have 25% of cancer cases. So our efforts are truly important here. Thank you very much. Important guest has come in, so I think it's time to wrap up. Yes, this is a significant moment. President Lech Wałęsa is with us. Welcome, sir.
Tak, brawa, proszę Państwa. Marzeniem panelistów
Applause.
było
It was the dream of the panelists. They even left a middle chair for you to sit symbolically, because we are talking about plans concerning different areas of medicine as the future in the EU. Just as there is plan for beating cancer, we are talking about a plan for rare diseases, plan for brain health, for cardiology. So, President, if you prefer to sit in the front row and listen, feel free to do so. And if you want to, you can sit right away on the stage.
To byłoby chyba zaszczyt dla wszystkich, którzy tutaj siedzą.
For everyone sitting here.
W myśl zasady nie chcę, ale muszę. Jak pan prezydent sobie życzy, także kontynuujemy w takim razie panel, jeżeli państwo pozwolicie. Pani profesor Demko,
Deputy Minister for Health, talked about a plan for rare diseases, but she also talked about a plan which is called Health for Everyone. And ladies and gentlemen and President, from the very beginning of the conference, we keep talking about solidarity in health. Madam Minister, if you could comment on it, like in the case of plan for rare diseases. Well, solidarity in health, what does it mean? It means mainly that everybody, regardless of where they live, who they are, how much they earn, they should have the same access to healthcare. There should be equality and equal access. And it's also important to have equal access to drugs. The EU law with regard to equal access to drugs is being adopted. I think Minister Kacperczyk knows this because she just came back from Brussels.
To za chwileczkę.
You can talk about it in a moment. So what does it involve? So for all patients in Europe to have the same access to efficacious, safe therapies, it's terribly important. So that we can have access to drugs, also innovative drugs that are being developed, and they are available in some countries more, in some countries less. In one country you wait for 4 months, in another one you live for 2 years. And it's about being solidary, and we want to make sure that all of us have equitable access and solidary access. So, thank you very much.
Pani minister, zresztą Gdańsk ma dzisiaj mocną reprezentację, bo koło pana prezydenta Lecha Wałęsy siedzi pan profesor Jacek Jasen, który miał dzisiaj znakomity wykład i wprowadzał nas w zasady działania planu dla walki z rakiem w Unii Europejskiej. No właśnie, teraz pytanie do pani profesor Janiny Stępińskiej, dyrektor Narodowego Instytutu Kardiologii. Jak to się stało, że powstał plan
Madam, how come there's a plan for oncology and there's no plan for
Czy to
cardiology?
nie jest trochę tak, jak
Isn't
mówili sami
it
kardiolodzy, że kardiologia troszkę zachłysnęła się tym
cardiology was thrilled with success of intervention cardiology, and maybe it wasn't even thinking about creating a plan, and there are so many other problems: ischemic heart disease, rhythm disorders. Should there be a plan for vascular diseases, for cardiology on EU level? Well, one by one. The first question: should there be a plan similar as oncology plan? Yes. Why is cardiology ranked second? We are quite modest. We are always being compared in different comparisons, and we know that vascular diseases, cardiovascular diseases, are reason number one behind deaths in Poland and in Europe. But there is such a thing in oncology that it's hard to debate certain expenses in oncology. Professor Jasen talked about it. He said that not so long ago it was a death sentence, but now it's changed. But still it stays in our consciousness, in our minds. So lengthening your life by more than a dozen years for men and women for women even more, well, to a large extent, it's success of cardiology. So it's not like we were so thrilled that we are so successful in treating heart infarcts, because Poland is one of the leaders in treatment of the so-called acute cardiovascular diseases. We created more than 100 centers that treat acute heart infarctions 24/7, but in other areas we don't have as many successes. So there's a lot of things to do, but cardiology is in place in Europe. We are equal partners for working out guidelines for cardiovascular diseases. We are co-authors of guidelines for the whole Europe, and the guidelines are created in such a way so that they can be implemented in all countries. So we know that organization and expenses differ, but in cardiology we really do a lot. A lot of you know that soon we will have a new act on the National Cardiology Network. And this will guide the patients through the system, which is not easy for them. Coordinated care is necessary. We need different levels of different reference levels. But at the same time, we are lucky because we have a 10-year national plan for cardiovascular diseases, 270 million a year. So these are investments in everything, not just investments in the structure, but also investments in patients, in educating patients, in prevention. So I fully subscribe under what Professor Jasem said, that at least in this area, we have to cooperate with oncology. Prevention is the same for everyone. So let me just tell you that apart from the national program for circulatory diseases, we are reversing the health pyramid. So everybody who can be treated in an outpatient way will be treated like that. We are ready for this program. We are already operating on the European level. Even better organization, even more expenses. That will be better. Well, thank you, Professor. Professor Marzena Domyniak. Well, today we talked about oncology, cardiology, lung diseases. The rector talked about the significance of plan for lung diseases on EU level, and obesity and diabetes. Shouldn't European Union do something about it, like a plan that would stop the pandemic of obesity and diabetes? Well, it is a strategic direction for Europe and the whole world, because data is terrifying. Billions of people being overweight and having obesity. It's measurable. We measure BMI, weight and waist circumference, but we are not talking about visceral obesity, what's happening inside, where we are not even able to diagnose it. So we, as Medical University of Wrocław, created a campaign where we courageously talk about obesity. So we don't only talk about treatment, so bariatric treatment or conservative treatment, but we talk about preventing obesity. So we're starting with education and moving through next stages, taking concrete measures. So yet again, we have a pleasure of organizing on the 4th of March in the same, and thank you for that. So we are organizing a conference entitled Let's Be Healthy. Health is an acronym from the first letter Z, zdrowie, health, the diet, our movement, responsibility and inspiration. So during that debate, we want to focus on prevention. So how should we educate? We talked about it at every panel. I don't want to repeat it, but such education is necessary. Pedagogy is also important. So I want to draw attention to medical universities. So how many hours do we have devoted to diet in curriculum at university, medical university? I'm a dentist, a surgeon, and I practically didn't learn a single word about diet. And 3 billion people suffer from obesity in the world, and 3 billion have caries. So if you put equal sign between these two, why are we not talking about it? So we should do this in school. We should teach children how these things happen. Children can learn parents. Parents can teach children. So this is what we want to focus on, and other stages. So I encourage you to come to the conference. But this is an important aspect that translates into public health and the condition of stomatology, because the diseases of teeth are partly related to metabolic diseases. If you have diabetes, if you have vascular diseases, you won't be able to treat everything in your mouth. So we really have very quick diagnostics of what's happening inside. There are different things. So what we see on a day-to-day basis is really dramatic, and we dentists are often first contact doctors. So change your thinking about dentists towards thinking as first contact doctor. Thank you very much for highlighting that the Parliament have become a center of discussions about health. Thank you for that to the representatives, the head of the Senate Health Commission, Dr. Gorgoń Komor. And we are truly happy that also MPs are getting more and more interested in health and in changing the way health is perceived. We are going towards solidarity in health so that everybody has equitable access to health. Two last presentations before we meet with the President, Elisabetta Zanon, European Organization for Cancer. As you listen to our discussion, inspired by the European Cancer Beating Plan, what sort of indications, recommendations could you give to the remaining areas of medicine? So what comes out of what works in this European plan and what requires improvement?
Good evening, and thank you very much for the invitation. The cancer plan is, of course, still undergoing development, so there are still actions to be conducted, but after 4 years, we can say that it is a success. We have seen significant developments. For example, we have seen world-leading legislation in the field of prevention. We have seen cancer plans, controlled cancer plan being developed in countries where they were not existing, or we have seen these cancer plans being expanded, being reinforced based on the principles, the aspects of the EU Cancer Plan. We have also seen significant advances in the field of vaccination. I'm talking more specifically the vaccination against human papillomas virus, which is responsible for a number of cancers. We have seen a political commitment from countries to move to vaccination also for boys, not only for girls. And this is clearly very, very positive. A lot of work still remains to be done. It's a work in progress. But I would say if we were to expand to other areas, if we were to use the cancer plan as a blueprint for other disease areas, I would like to make a couple of comments. The first one is to avoid a silos approach, because very often we see, of course, with an aging population, patients being affected not only by a chronic disease, but more than one disease. So if we take a cardiovascular disease as an example, of course, we have evidence of the toxic effect of many cancer treatments on the heart. And therefore, it is important to look at this, let's say, comprehensive, more holistic approach in terms of the patient with different diseases. But also conversely, we can see that cardiovascular disease has an influence on cancer, with increasing evidence showing a growth of tumors and more metastases being linked to cardiovascular disease. So I would say my recommendation would be really to have a more holistic, integrated approach in tackling these different disease areas. And secondly, another recommendation would be to think in the long term, because of course, we cannot fight cancer or cardiovascular disease in 5 years, in a short period of time. This is a fight over a long period of time, and it is really important to sustain both the political commitment, but also the financial resources to ensure that positive outcomes will be seen over a long period of time, and they will be sustained.
Bardzo dziękuję.
Thank you very much. Madam Milena Angelova, member of the European Economic and Social Committee, which has been very active in this discussion, whether health should be a priority in the European Union. We are very interested in your opinion, whether indeed the European Union should treat health finally as priority. And what sort of initiatives can you take as Economic Social Committee?
Thank you very much. Actually, it's easy to start because I completely share what my previous colleague said, that the Beating the Cancer plan is a big success. It's a big success not because it brings tangible results immediately, but because it gets together the member states and shows them how they can really cooperate in fighting this terrible enemy. And the fact is that the Brussels administration, that we blame to be very bureaucratic and administrative, really made a good job, because they took a very administrative and bureaucratic approach to something that is so huge that everyone's scared to go fighting for. And this is the cancer. So they decomposed the cancer to what has to be done in a comprehensive manner, and how exactly the different things to fit together into a puzzle. And if you have a look to the action plan, actually, you will see 11 action areas with about 5-6 actions each. So it's like a big puzzle, and it's an example how we decompose the thing to defeat it, because you can only eat an elephant if you take it piece by piece and slice it very precisely. So the lessons learned and that they can be replicated to all other areas is that we can defeat together the diseases by taking a comprehensive approach, and in that case, really to stress on the prevention in all forms, like primary prevention with vaccination and healthy lifestyle, secondary prevention with screening, and tertiary prevention, care and rehabilitation. And in that occasion, all the member states, because it's their competence and the European Commission cannot really interfere, should merge the forces and cooperate in order to defeat the enemy. What more? Putting the research and innovation where it's necessary, namely to decompose on the different factors, the diseases, so they depict the factors that are provoking disease and help prevention better, and also create an innovative ecosystem comprising by the researcher, but also by medical professionals and patients' organizations, so that every aspect of the process is covered indeed. Second, the digital health data project was mentioned, and I'm very happy about this. My only ask is also to link it to genomic data and biobanks. And then, if I may, because you're the Polish presidency of the European Union, congratulations to that, I have a wish. Please return back the mental health, but not the limited way that, sorry to say, Belgium and Spanish presidency did it. Thanks to them, they really put it at the scene, but take the holistic approach, because cancer is visible. Mental situations are not visible, and the most important, it's a growing concern for young people, and most importantly, the kids. So please do that. Thank you very much for your attention. Thank you.
Bardzo dziękuję za tę wypowiedź, bardzo dziękujemy za pracę Europejskiego Komitetu Ekonomiczno-Społecznego, który rzeczywiście daje bardzo dużą kontrybucję do tej merytorycznej dyskusji o zdrowiu jako priorytecie w Unii Europejskiej. W takim razie poprosimy teraz panią minister Kacperczyk o podsumowanie i te spojrzenia. Tutaj bardzo serdecznie prosimy, bo zapraszała pani minister Demkow. Tak, zaskoczenie, ale tutaj na prośbę też pani minister, bo tak jest, na tym polega urok tego życia. Pani minister, króciutko, bo pani minister Demko już mówiła o chociażby inicjatywie planu dla chorób rzadkich, ale pani minister wielokrotnie mówiła, że polska prezydencja oprócz realizacji tych priorytetów, jak jest profilaktyka, cyfryzacja, zdrowie psychiczne, zdrowie dzieci i młodzieży i bezpieczeństwo lekowe, również wspieracie bardzo plan dla chorób sercowo-naczyniowych. Także jakby pani mogła
medicine safety, you also support cardiovascular diseases. If you could just sum up. So I'll take half of this time to have some more time to discuss with the President. Thank you so much for the signals. We always listen to that and integrate it in the program of our presidency, referring to the prevention plan or prevention of cardiovascular diseases. This subject was one of the main issues of Hungarian presidency, and in the conclusions of the European Council, this encouragement, or maybe not mandate, but this proposal of elaborating such a plan was very clear. So if the Commission addresses such a necessity, we'll be in touch with national associations and we'll promote it. We talked about many successes, and indeed they were achieved in the EU. And I think that the fact that we are talking about those issues in the EU, things like oncology diseases, rare diseases, it's a great success. As a person that often visits Brussels, and I observe how those initiatives translate into what we're doing today, I'm not as optimistic when it comes to this European Cancer Plan. I think that it's great that this plan was adopted and well created. However, we would expect better results of this plan, and I think that the Commission is doing this right now. I think it's worth considering what was done before during those 4 years, and also what we failed to do when it comes to implementation of this plan. And we should use these experiences in next plans, because it's not about quantity but quality. But yes, cardiology, for sure, I confirm that. Thank you so much that you saved half a minute. And now we would like to invite President to sit in the very middle, on the middle chair. If you could come and join us so that we can make a picture. And then I pass the floor to President Małgorzata Bogusz.
Bardzo prosimy.
Here we go.
Tak. Bo myśmy właśnie dyskutowali
we have just discussed all the challenges, all the problems, so now we are going to summarize this discussion. We're going to take a picture. Thank you so much for this panel, and I pass the floor to President Bogusz. Thank you so much, Doctor. A short technical break, just a second, because together with the President we'll be talking for a while together on the stage. So if you allow, and in the second we'll get back to the conversation. President promised that after our short conversation we will discuss and we'll have a chance to take a lot of pictures with President during today's event. Thank you so much. I prefer applause in the end, not at the beginning. Now I have to work for that applause. I wanted to thank you for inviting me. I would like to thank you for the possibility of speaking in front of you. I'm afraid only that most probably we are transmitting on two different frequencies. I'm just a consumer in the field that you provide, and I don't understand that much. And physically, I try to run away from medicines and doctors as far as possible to stay in very good condition and health. However, I'm a politician, and most probably you're not in line with politicians. So I'm sorry, I'll be working in the field of politics. As you probably know, I have finished I'm 81 already. And I have decided to balance my life and summarize my life and look from another perspective, because I never had time. Just like you don't have time to consider or think that much about your life. When I looked at my life, I'm surprised because actually I was going from one success to another success. And I was thinking, maybe actually I never had chance to achieve this success. So there are so many people that are better educated, richer, and I've made it. And I've been thinking, well, why? So, ladies and gentlemen, in life, there's coincidence, different circumstances. I have learned to take advantage of those possibilities and opportunities. I was born just after the war. I lived in Lipno, Płock, Wrocławek triangle, somewhere in the middle. In those times there was no electricity, there was no radio, and people, neighbors, were coming to chat about stuff, discuss the issues, and they were always saying they have imposed communism on us. The Soviets are exerting pressure on us, and as kids we're dreaming about regaining what those generations lost. Unrealistic dream. But as I told you, sometimes there are different circumstances, and in my life there were always circumstances which convinced me that one can go in this direction to regain the lost positions of our predecessors. So from this place I have left to the seaside. I had a ticket to Gdynia, but in Gdańsk the train stopped and someone said it's going to wait here for half an hour. And I was so thirsty, so I jumped out to have some tea. I had some tea, and it turned out that the train left. And it was a coincidence. I didn't know anyone. I didn't have any money. I didn't know what to do. And I left there for 50 years. It's been 50 years since I've been living in Gdańsk. And I've met a colleague who told me what to do next, and there was another coincidence. I met a colleague that I knew well. I knew him from the past, and I told him, look, my train has left, what am I supposed to do? He showed me a place, where should I go? To the shipyard, and I was admitted. I got a job, I got a flat, and I walked through the store when my future wife was working. I really liked that girl, and I was supposed to live somewhere else. And we've been together for 50 years. And once again, coincidence. Unbelievable. Going on, there were strikes in 1970. Because I was raised this way, I got incorporated in this fight. And because I fought well, I was pretty brave, they made me the head of this strike. And I recalled that I've been dreaming about the liberty, so I thought that maybe I can do something here. We have lost the strike, but when I was leaving, I thought, God, just give me the possibility of coming back, because I know why we lost, and there's a chance to win. And in 10 years, in the next 10 years, I got this chance. And once again, a coincidence. There were braver people, people with better education, but there were not that many people to lead. I was asked to lead in 1980, to lead this strike. So everything was a coincidence. So I was selected to lead this strike, but there were agents, bugs. So I had no chance to become the strike leader because they were listening to everything I said, and there was a moment where I was supposed to check in the shipyard. I think it was 5 a.m. I looked through the door to my corridor, and there were agents, they even had chairs, they were just waiting for me. And I thought, there is nothing I can do. I was on the first floor, so I decided to jump through the window, and there was police and police car as well, so no chance. And there was a coincidence as well, namely, in these conditions, I went to sleep and I slept for 3 hours. And when I woke up, I thought, what am I going to say to my colleagues? That I was afraid. So I thought, well, I'm going to go to jail anyway. I have to go. And look what has happened. You can check that in the papers. So the ones that needed to lock me up at 5 or 6 a.m. lost this authority when the commanders came to work. And this happened in Gdańsk. So the commanders were working when I departed from my flat to shipyard. This is where they need to ask their commanders, what are we supposed to do with Wałęsa, because he's going to strike. The commanders in Gdańsk were afraid to make any decision because they remembered that when the committee was closed in 1970, there was bloodshed, so they found Warsaw, and they asked, what should we do with Wałęsa? I don't remember if it was the Prime Minister or the Minister of Internal Affairs. He called the director and said, Director, listen, what's the situation? And the director replied, we are closing the strike, we're shutting it down, and they have notified the ones who are watching me. Just watch him, don't close him up. So it was difficult, they didn't have telephone calls, and I've managed to run away and get to the shipyard. And then they got the command to lock me up. And the reply was too late. He's already left. So everything was a coincidence. Then the elections, and I became head of Solidarity again. And I thought, there's a chance to improve what we've started. But everything we've done together was, ladies and gentlemen, abolishing the previous order called Solidarity. Everything that we're doing was called Solidarity. Solidarity was building monopoly against monopoly of communism. We have chosen a very good moment. The world was fed up with Soviet Union, with communism. At this time, there was good atmosphere for solidarity. Everyone had the same denominator, communism or Soviet Union. Some loved and some hated Soviet Union. There was one denominator. Everyone had own interests, of course. When we have destroyed the common fundament, we have lost denominators and different interests. I'm saying that so that you understand it. Solidarity, after losing the common denominator, there's no solidarity because there's only different interests. We are not connected by Soviet Union or communists because there's no common enemy anymore. So, in the war of Ukraine against Russia, there might be a common denominator, but that's not the topic of my speech. Our generation was allowed to demolish the previous order, and at the same time, we're giving the possibility of building a new order. The world was always divided since Adam and Eve, but when it developed, it needed to expand. And the fate showed us how expanding looked like. Till the end of 20th century, all countries on every map were created through including the weaker ones. Soviet Union included over 60 nations by force, and the biggest inclusion was South and North of the U.S. There was even a movie about it, and this is what was happening until the end of 20th century. At the end of 20th century, there was a new concept. We need to get together, but not in the old style, but peacefully, through unions, NATO, UN.
So we know about this single concept, and the question that's left for us to answer, which concept is going to win today? The old one, applied by Russia and China, of the big countries, or the new one? Our fight, solidarity fight, showed the world how to fight and how to win. If back in those times we were fighting by force, we wouldn't stand a chance, and the world would not help us. So it's only through peaceful methods, through arguments, that we conquered the world and entered a new era. Well, to me, there is no question, looking at how the world is developing. There is no question whether to move to order that matching the current times or stick to the old order. More than 20 years ago, seeing what was happening, I said publicly to implement a new order. And there were 15 global topics that I was proposing. I wanted us to ask the United States to prepare some solutions. If they do it well, then they will be responsible for those topics and the others will follow. So some 30 topics that were continental. I developed them and I proposed them to the French and the Italians and the Germans. I said, prepare solutions in those 30 topics. If you do it well, Europe will give you the right to solve these topics and the others will follow. Well, ladies and gentlemen, such civilizations as our today, with the current development, they've already been in place, even higher civilizations, because they were building pyramids and many other things that we don't know much about. Incredible accomplishments, and these civilizations disappeared, and many think today why. They can't understand why. And the fate tells us exactly, showed us exactly why. Well, they had a similar situation as us. We are arriving at the same height as them. They too had separations. Now we have China, Russia, the Arab world, different religions. And we are fighting. There's a lot of hate. And everybody's thinking about the other, how to criticize the other. So if they did what I'm proposing today, they would save themselves. And I'm talking about it again. Will we be able to save ourselves? Well, we've had more and more doubts. As I told you, to me there is no question whether to do it. There's just a question how to do it. So at meetings like this one, I've just came back from London, thousands of people. Here there are not too few of you, but at such big meetings, public meetings, especially in Europe, I tell people, listen, we have to enlarge the structures. What foundation would connect the fighting Europeans, those with different levels of development, so that we start building what needs to be built, because otherwise we will die? So when I pose the problem like that, there are two ideas for a foundation that could connect connect Europeans, and they could start implementing the concept. So 50% of Europeans, 50% of the world in general, want to build on the foundation of freedom, free market, and right and law. That's 50%, and 50% of Europeans. And the other half says, no, this is not the right idea. First, we need to agree on the values that we will be following, and then free market and the law. So we cannot part this division, because everybody occupies their position. So once we satisfy this, we will have another problem. So what sort of economic system do we need in the new world order? So there are two economic systems, capitalistic and communistic. In theory, it looks better. If you look at communism looks better. I'm frequently in the West, and young people do support communism, and I tell them, why are you doing it? Well, sir, look at the programs, at the fairness, at solidarity, integrity, taking care of the poor. Yes, I say, yes, beautiful, but you know it's not implementable. Well, look at examples. Whenever they want to help the poor, a big group is founded, and this group will eat up more money and steal more money than they are going to use for help. And thus, good idea of communism loses to capitalism, and capitalism is terrible. Competition, very often unfair competition, causing unemployment, and it wins because it's implementable. So I suggest reject communism and, try with capitalism. But with capitalism, I suggest leave a free market economy, and the rest has to be changed. So keep market economy and change the rest. And you need to find the unemployed and give them work. So in that capitalist system, this was not possible because there was competition. Rat race. But when we move to continents, to globalization, we stop such competition. So you can start dealing with the unemployed. So that's the other problem. And the third problem, that is an obstacle for the future. How do you cope with demagogy, populism of politicians on a larger scale? Now, noticing one thing that few people notice. Until the end of the 20th century, nations would not admit to that, but in their consciousness, they were thinking about God. They would name God differently, but it was present in the social spirit, and we departed from that. We coped with the Soviet Union, but now a question remains: how do you keep nations that have no brakes? These are the challenges ahead of us. And one more thing, ladies and gentlemen. All organized forms from those times do not match today. We need to understand that we are living in the times of changing era. States, countries, blocks do not match this technology. So this is the era of globalization, and we are in the middle. One thing was there, the other thing wasn't established yet. For me, it's the era of word and discussion about how the world should look. We need to redefine what it means, the left today. What does it mean, the right today? And Christian parties are the prettiest. Because of my belief, often, I frequent those parties, and they are such proud Christians. But I look at them, and none of them are believing in God. So in the old times, conditions were different. This worked in the old times, but our generation has to start bring order to things. The fate gave us examples for all those problems that we are facing today. The history shows us how to solve and remove obstacles. Look at the Ukrainian-Russian war. What does it tell us in practice, not in theory, but in practice? It's not Putin, it's not Stalin, it's the political system. If Putin had 2 terms of office, no longer than 5-year terms of office, he would have never built such a criminal group. So if we are fighting today, the world is fighting Russia, we have to shoot because Putin is shooting, but we need to have solidarity. It's not difficult, but it needs to be done. It will take time, but we need to convince every Russian that we are friends. We want to help them. Dear Russian, tomorrow Putin will conscript you. You will go to war and you will die tomorrow. You don't believe? Just look. Look at your neighbors. How many neighbors have died? We want to save you. Russia is a beautiful country, but you have to improve your political system. And the other thing, what we've accomplished, we were able to break the Soviet Union, and I was such a friend of Russians and even a friend of Putin's. But, ladies and gentlemen, again, Putin was in Poland. He was meeting with Tusk and others. He was compassionate, even. Back then, in those times, he was going the right pathway. But what did we do? We turned him into a criminal. We said that he killed half of our government by assassinating the plane. So we pushed him in that corner. He said, damn, I'm doing whatever I can. I understand them. And what are they doing to me? I need to wrap up. I've been long-winded. Ladies and gentlemen, please. So we managed to accomplish incredible things by being humble and by destroying. And we are in the world of word and discussion. We're discussing what the world should look like. So the next generation, after solidarity, if it's successful, then this will confirm that we succeeded. Unless post-solidarity generation is successful, they will criticize us. They will say we are agents. I'm old today and tired, but I still travel the world. I travel across Poland, and I keep saying that we really do stand a chance. It's not difficult, but let's discuss about what's happening in the world, thinking about discussing about good solutions. And Trump and Kaczyński brothers, these are examples, because it's a discussion. It's a discussion, and after the discussion and wrong decisions, we are supposed to choose good decisions and propose good solutions to the world. This is how you need to interpret what's happening today and take advantage of that chance. Although I already said that, I have my doubts. Because, well, I'm going to the United States for 2 months, so I have to be careful. I can't exercise too much pressure on the president, but I also have to tell the truth that the world has been developing. It has been enlarging its structures. It's the result of the development of the civilization. And Trump offers something reverse, withdrawing. And he enjoys the Russian style of management, because it's nice to manage like that, but it's impossible. It's impossible to stop the world's development. It's impossible. He doesn't stand a chance. Of course, he can launch destruction processes, that he can, but he doesn't stand a chance. He can't win. So this is all I wanted to say. And now let's discuss unfinished sentence. President, thank you so much for your inspiring talk.
Natomiast my też, nie będę chciała już tak długo z panem prezydentem.
I don't want to talk to you too long, because you already said exactly what I wanted to talk to you about. But we prepared something special for you, President. President, you said that in this group of healthcare specialists, you try to keep away from this group, but we have this slide for you, your social media, President. Again, it got me, hospital. And the other thing, November 2024, the president is in the hospital, and then slightly later, November, the president is in rehab in Lądek-Zdrój, and I can see that you are hugging a healthcare worker, and you are undergoing physical rehabilitation, you're taking care of yourself, you're visiting doctors, and you're doing Nordic walking. And there are some pictures from 2021. It looks like that, the first dose of COVID vaccination, the second dose. You are a wonderful patient, President. We are here at the Warsaw Medical University, surrounded, in fact, this is a pediatric hospital nearby, Warsaw Clinical Hospital nearby as well, representatives of the healthcare system everywhere. And based on your social media, you look like a perfect patient, President. I concluded they didn't want me there. President, we do want you here as long as possible. I've been living the longest in my whole family, but when I was joking like that they don't want me in the hospital, I started becoming ill, so be careful what you say. Yes, President. On the other hand, I made some research and I asked your collaborators about your weekly routine and about your regular days, and they look as follows. Like during the last 3 days, flight to London, lectures, meetings, a huge gala during an innovative summit, and then you are coming back by plane, another meeting. You're today with us. President, how do you do it that you are so fit? Because the thing is that very young people, even students, they simply wouldn't be able to carry such a load. And you have been carrying a huge load for 40 years now. And let's say it bluntly, you are in perfect form, President. Well, you know, I simply say what I feel directly. I'm blunt, and that's why I don't have any extra loads. If I was doing other things, well, I came back from London, and really the whole world was there, and I got the biggest applause of everyone. I'm not surprised, even for the fact that I didn't have a piece of paper, but I was speaking freely off the top of my mind, and everybody else had a cheat sheet, so to say. Everybody was reading. I can do it because I say what I feel, and I also try to hear what you want. I adapt. I have a gift in that way. I was great in destroying things, but I'd rather build things, because I'm afraid that unless we start building, they will burn, incinerate the world, damage the world. We are closer to those civilizations that stopped existing because they had similar problems as us. And they were developing strongly, but they were fighting. This was, they were like enemies, and same here. So my proposal is that there are topics that are impossible to solve by China or the States. There are several topics that are global, and we simply need to make sure they are managed globally. There are several continental problems, but listen, this is the only solution. Unless you do that, you won't be able to manage development. You won't be able to keep developing.
That's why I'm almost done, but I'll be looking from the sky if you managed or not. In a short sentence, what's the prescription of Lech Wałęsa for healthy and prosperous Europe. If you only want to achieve everything, you made it. So I didn't have a chance. I didn't have a chance at all. I'm neither educated, I was poor, and look what I've achieved. I just believed in God, and I believed in what I was doing, nothing else. And I've made it. The word and the word appreciated. I have over 100 honorary doctorates. I have a lot of medals. They are so heavy that I can't even take it up. But at this time, I had no other choice. I needed to keep on working. I got so many rewards and appreciations and diplomas and medals. And at the beginning, I didn't have a chance to do it. And I could have been imprisoned. So I have deposited all my treasures in Częstochowa. I hope we'll be able to appreciate that in the future. And as the last thing, when I'm going to be old, and there is this text that if someone would try to kill me in the future, there's no way. President, thank you so much, as always, for such inspiring discussion, inspiring statement, inspiring lecture. You've been inspiring us for 40 years. I'm from the people, you know. I don't like empty spaces. But we like you. It might be rude, but I've been wondering. We had great people here, right, of the professors. And what is the task? What is the objective of this meeting today? But who are you discussing for? Thousands of people are watching us online because it's online, it's transmitted. I want to give you a tip. I travel a lot globally. At such meetings as you have, they do it as well. But they know that it's undigestible for that many hours. It's too difficult, it's too wide, so they find people like me and others to make it more attractive. So they have someone attractive every 4 hours, so people can relax, have a laugh. So don't you, because it's a great loss, so maybe you should work on the details. So you could say that someone's going to dance or sing president. Oleg Wałęsa is only one, so there's no one else to substitute you. If there were more people, they will kill each other. Thank you so much. It was an honor to talk to you for a second, at least to host you here. Thank you so much. And now the long-expected possibility to take a picture, have a picture with President Wałęsa. Thank you so much.
dzisiejszego spotkania. Miło nam, że uczestniczyli Państwo w panelach, które przygotowaliśmy w spotkaniu z naszym gościem specjalnym i zachęcamy cały czas do lektury Białej Księgi, z którą można już teraz na spokojnie się zapoznać. Miłego weekendu, dziękujemy.
Have a great weekend. Enjoy your weekend in health and in peace. Thank you so much.
Nie zarejestrowało się.
Ale co, mamy się pożegnać jeszcze raz? No dobrze. Szanowni Państwo, dziękujemy za udział w dzisiejszych panelach i w całym naszym dzisiejszym spotkaniu, także w rozmowie z gościem specjalnym, panem prezydentem Lechem Wałęsą. Zachęcamy do weekendowej lektury naszej Białej Księgi. Teraz już można na spokojnie się z nią zapoznać. Dziękujemy.
Dziękujemy i życzymy miłego studiowania Białej Księgi.
Thank you so much.